Good morning, everybody. I'm happy to call to order the meeting of the Santa Barbara County Board of Supervisors for our second day of budget hearings. Madam Clerk, please call the roll.
Supervisor Nelson?
Here.
Supervisor Lavanino? Supervisor Lee?
Here.
Supervisor Hartman?
Here.
And Chair Capps.
Here. Please join us in pledging allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. CEO Miyasato, you kicked us off so well on Monday. Do you have a report this morning?
No report this morning.
Okay. Any changes to the agenda, Madam Clerk?
Chair Capps and members of the board, I do have a couple quick announcements this morning. As we begin today's session, we kindly ask all attendees to ensure that your computers and phones are muted this morning. This will help minimize background noise and ensure that everyone can hear clearly. Thank you for your cooperation. Additionally, we posted an addendum on Saturday, April 12th, 2025, adding a closed session agenda to today's meeting. The closed session agenda added is conference with legal counsel, anticipated litigation, paragraph 2 of subdivision D of Government Code Section 54956.9, significant exposure to civil litigation. One case on April 11th, 2025, the county received a threat of litigation letter attached to the closed session agenda item, file number 25321. From Latham and Watkins, LLP, regarding change of owner, operator, and guarantor for the San Ynez Unit Popco gas plant and Los Flores pipeline system final development plan permits. This addendum was posted and made available online to both the board and the public. And lastly, members of the public wishing to address the board will have the opportunity to provide comments at the conclusion of each functional group presentation. If you're registering to speak via Zoom, please specify the functional group you wish to address during registration. A general public comment period for items not listed on today's agenda will be held at the end of the budget workshop schedule. For details on public participation methods and to register for remote public comment, please refer to page 2 of the agenda. If you have any questions or need assistance, please contact the clerk of the board's office at area code 805-568-2240. That concludes my announcements for today.
Sounds good. We'll all keep our phones off today. Okay, let's move on to our budget workshops for fiscal year 2025-2026, our overview this morning.
Supervisors, before we begin, we just have some housekeeping, and Mr. Clemente will talk about what's been posted since Monday.
Thank you, CEO Miyasato. Good morning, Chair Capps, members of the board. Yesterday, we posted online and distributed answers to board inquiries, board inquiry forms we call BIFs. All 6 of those are now posted online. They relate to sheriff asset forfeiture, enforcement of unlawful roadside vendors, Northern Branch Jail zero net energy options, sheriff in-car video upgrades, jail cost benchmarking, and board-approved funding for sheriff systems. In addition to that, we distributed 2 addendums. Those are also posted online. Addendum number 1 is the ongoing cannabis revenue and expenses. It's a detail of the table I showed on Monday with the more specific costs broken out. And then addendum 2, capital projects recommended for funding and deferral list. That is, again, the $10 million CIP list and our recommendations that we talked about on Monday, coming back today with recommendations for what to fund and what to defer. And both of those items will be discussed later today in more detail.
Supervisor Hartman.
Yes, I had a question about Chair Capps' BIF on benchmarking jail costs. That is before the well path and the 1.5.
Supervisor Hartman, through the chair, the year that was provided here is fiscal year 22-23 adopted, which is where we could get the best
Right.
comparable information through the state controller office.
Thank you.
Okay, and just because I don't like to use acronyms too much, you did say it, but board BIF, can you just explain it for the public, please?
Thank you, Chair Capps. Yes, they're board inquiry forms. Short term is BIFs, and it's when the board offices will submit a formal question that they want a response to that we will distribute to the whole board and post publicly. So those come from your offices. We note on them which district the question came from, and that's what those are.
And where are those posted for the public?
Those are posted on our Budget Workshops website. There's a link to it from the county's homepage, I believe, and also on our CEO Budget Documents website, as well as through the actual posted agenda for the clerk of the board manages.
Wonderful. Thank you so much. Okay, are you ready for the overview for our first functional group for today?
Yes.
Please proceed.
Good morning.
Good morning.
Thank you, Chair and members of the board. The first functional group presenting today is Health and Human Services. The Health and Human Services functional group is comprised of the Public Health Department, First Five, Social Services, Behavioral Wellness, and Child Support Services. This functional group represents 35% of the total county operating budget and 41% of county FTE. However, because the Health and Human Services departments are funded primarily through state and federal sources, this group only receives 7% of the county's general fund contribution. Looking at a 5-year trend of operating revenue in GFC, we see that GFC allocated to BWell, Public Health, and Social Services has remained relatively flat over the 5-year period. Operating revenues in BWell and Social Services have increased significantly over the past 4 years due to increases in state realignment, Medi-Cal related to behavioral health payment reform, state and federal assistance program revenue, and state and federal grant funding. However, in fiscal year 25-26, BWell's revenue is anticipated to decrease due to declining grant, realignment, and Mental Health Services Act funding. Social Services revenue remains relatively flat in fiscal year 25-26, primarily due to decreasing state and federal CalFresh and Medi-Cal administration funding. The increase we see for public health revenue in fiscal year 25-26 is related to a 6% CPI increase in clinic revenue and growth in Medi-Cal pharmacy revenue. Trends in operating expenditures largely match the operating revenue and GFC trends from the previous slide. BWell is the exception in fiscal year 25-26 with budgeted growth in expenditures related to increased mental health bed placement costs and service contract costs. The department has budgeted approximately $19 million in fund balance to support its increased operating expenses in fiscal year 25-26. We see increases for social services in fiscal year 23-24, largely due to additional staffing for protective, economic assistance, and workforce development services, as well as increases in cash assistance payments. However, in fiscal year 25-26, social services has had to make reductions in operating expenses due to flat revenue growth, which you will hear about in more detail from the department today. Turning to FTE, we see stability in child support services, First Five, and public health over the 5-year period. You'll notice that BWell's FTE count increased in fiscal year 23-24, primarily due to the addition of 17 FTE in support of the CalAIM implementation. In fiscal year 25-26, BWell staffing increased by 10 FTE, primarily to support Mental Health Outpatient Services and Behavioral Health Services Act planning and administration. Social Services saw recent increases in FTE count. 48 FTE were added in fiscal year 23-24 to expand various protective and economic assistance services, and 71 FTE were added in fiscal year 24-25 to support an expansion of the CalFresh program. Due to flat revenues in fiscal year 25-26, Social Services has decreased staffing by approximately 46 vacant FTE. Here we highlight major challenges and initiatives of the functional group. Major challenges include increased reliance on fund balance for ongoing expenses, growing caseloads and service costs for HHS programs, and increasing uncertainty surrounding federal funding and regulation. Significant initiatives include interdepartmental coordination of CalAIM pre-release services for individuals leaving custody and implementation of new statutory requirements. Next, we'll provide a high-level summary of departmental sources and uses of funds. Most of public health's revenue is generated through charges for healthcare services at $63.3 million, which largely consists of Medi-Cal revenue and supports operations at the department's 8 healthcare clinics. Intergovernmental revenue is also a major source at just over $33 million and primarily supports disease prevention and health promotion services. Here we see that the majority of first five sources come from state funding at $3.2 million and is used primarily for core investment and program support services. In social services, the majority of funding comes from intergovernmental revenue at $218 million, which includes realignment, as well as state and federal dollars for economic assistance and protective services. Most of behavioral wellness's funding comes from charges for services at $99 million, which is largely comprised of Medi-Cal revenue, and intergovernmental revenue at $89 million, which consists of realignment dollars and Mental Health Services Act funds. These sources primarily fund the department's mental health outpatient and community services. Lastly, we have child support, whose primary funding source is intergovernmental state and federal revenue, which supports the department's core case management and collections activities. And that concludes the Health and Human Services Functional Group summary.
Okay, thank you. Any questions on the overview from the board? Let's get right to it then. We'll move, thanks for the overview. We will move into county health.
Good morning, Madam Chair, Supervisors. Happy to present you with our budget for the county health, as it is now not public health. With me, I am privileged to have such a great team who has put a lot of effort into preparing the budget, but also into what we are going to summarize over our presentation. Our Chief Financial Officer, Gus Mejia, our Deputy Director for Operations, Lars Sievert, our Chief Medical Officer, Josephine Phyllis Preciado, and 2 days on the job, our newest addition to the team, Lindsay Walter, as our Deputy Director for Clinical Care. Also joined with us is our ever so popular Director of Animal Services, Sarah Aguilar, with her team of fans and supporters. As many of you know, we are celebrating 100 years of the establishment of county health, and we stumbled upon a resolution that was dated in March 2nd of 1925, established by the Board of Supervisors, your predecessors, establishing the county health. The budget at that time was $10,000, with $2,500 that goes into the salary of the director and $7,500 that goes into the budget of the department. I did some research, and it turns out that $10,000 in 1925 is the equivalent of $182,000 in our days. So as you can see, we have moved and changed a lot. However, over the past 100 years, although we have evolved, the need for the department and the services that we provide to the community has not changed tremendously. So with that, we'll go over. So care for animals as well as our people is in high demand, and also the cost of providing that care is also getting higher. So the two challenge programs, as you can tell, are the animal services as well as our health centers. And these are the ones that are currently challenging in terms of being over budget, slightly in deficit, and this is due to the increased demand, but also it's due to the increased cost of delivering care for our people as well as our animals. We have been able to increase some of our efficiencies as well as increase our services to observe some revenues. However, that is not matching the increase in cost as well as the increase in demand. There are several measures that we have in place, specifically as it relates to animal services through more efficiencies, looking at our fees, some of the technology solutions, And I'm glad to tell you that we finally have a veterinarian, so that is something that probably is going to get us a little bit over. But also, as it relates to our health centers, we are putting cost efficiencies with the goal of reducing our reliance on our fund balance by 1.5 million every year in the next 4 years. And we were able to do this successfully for this fiscal year or the coming fiscal year by reducing our cost by $1 million through some shifting vacancies and also looking at some efficiencies. Our overall operating budget is $118 million, which we are using currently in this year almost $5 million from our fund balance to support the deficit. We have almost 400,000 that goes into our capital budget, and the general fund contribution is about $11 million. There are general county program transfers, which we will explore in more details. These are specifically from the cannabis as well as the TSAC that go into some of our operations. We have almost 540 full-time equivalent staff members, and there are no service level reductions or restoration requests or expansions. Although the next two slides are talking about specific units, but I am very proud to inform you that in the past 2 years, we have been moving towards functioning as one department, aligned with our one county, one future, one department. So this is where a lot of the crossover between programs have been happening. And I would like to share with you 3 stories that highlight this collaboration. Specifically collaborating with one of our community partners, which is the food bank. So between March of 2024 and March of 2025, our 2 health centers in Lompoc and in Santa Maria has partnered with the food bank to establish a 1-day, a month where we are providing fruits and vegetables and produce. So far in that last year, we have provided 164,000 dry pounds at Santa Maria and Lompoc, and 86,000 produce pounds, with a total of 250,893 pounds of food. That served 5,347 households and 20,734 individuals. Also, another story is what our disease prevention and health promotion team was able to do. So our HIV case manager came upon one Mexico individual who was diagnosed recently with HIV. Through our collaboration with our community partners and through an interpreter, we were able to meet with the patient and his wife and provide very much needed education on prevention and the treatment and how it is needed. However, with a little bit of more probing, we also found out that they are a family of 8 that has a budget of $75 only. So our case managers were able to expedite an application to CalFresh, and the family was awarded $1,039 per month and was able to pick up their EBT cards on the same day. All this was done in 24 hours, which is definitely a government efficiency at its best. Our next slide, which again, highlighting some of what Animal Services does beyond just keeping our shelters and adoption and all that. We had a patient that was referred by one of our clinic that needed shelter before being homeless, but the patient was very concerned that he had a litter of cats and kittens, and the shelter would not allow him to bring the kittens with him, or he needed to pay for someone. So we were able, through Animal Services, to take care of the kittens. The patient was placed in shelter, and this was, again, a collaboration between several departments, including Community Services as well as Animal Services. As we mentioned, our program transfers are close to $3 million, of which $100,000 comes from the cannabis education program. The cannabis program. This goes into our cannabis education and prevention coordinator. We also have $2.9 million that comes from the Tobacco Settlement Allocation Committee funds, and these go into several of our programs, such as animal services, public information specialists, some of our homeless shelter clinics, as well as administrative operations, such as HR and IT, and some of our safety and compliance operations. Our staffing increased. However, the net increase was close to 4 FTE. In mid-year, we had an increase of 6 FTEs. Specifically, those were in our ECM program, which is the Enhanced Care Management Program that is part of CalAIM. And we also had a 2 FTE increase in our behavioral health service based on the grant that we got. There has been changes as well in decreases in some of our FTEs, specifically due to cuts to our California Children's Services, where the state has slashed our funding with a substantial amount where we had to decrease our staff. The next slide goes into our operating budget. Our operating budget has increased by almost $8 million, of which half is due to increase in salaries due to the negotiations and benefits increases. And the rest is split between some of our charges for IT and utility and facilities, but the bulk of it is $3.4 million due to our pharmaceutical supplies, and especially with the loss that happened a couple of years ago with our 340B program, then we are seeing an increase in our pharmaceutical costs. A lot has been done in the last year. Some of the things that we are mostly proud of are, again, us coming together as a team and staying true to our goals and objectives of what the department has set for us through our strategic plan. One specific thing that I'm very happy to announce, and this is something that the public can benefit from, is a comprehensive, linguistically appropriate project that provides educational materials, not only bilingual, i.e. English and Spanish, but also in the Mixteco language. And as many of you know, Mixteco is not a written language, so we were very innovative in providing QR codes that would be scanned on a smartphone, and it will take you to a video or an audio message that is overdubbed by a Mixteco speaker. And these are on our website under patient resources, and they are very valuable in providing these information to our Mixteco population. We also were successful in launching the Enhanced Care Management. In fact, we are the only county department the only department in the county that is an ECM provider, and patients at our health centers are now being cared for their not only clinical needs, but also their social and needs, and they receive the supports from our ECM managers. We are also successful, which is an extra thing that we're proud of, in billing for those services. And we started seeing some of the revenue coming from billing SynCal for ECM. Many of you know we have established a correctional health team that has hit the ground running and is producing a lot of what is needed in support and oversight of healthcare delivery at our county correctional facilities. We also secured a grant from HRSA to to expand our behavioral health services. We are now officially providing psychiatric health through telepsychiatry, which is, again, a step into our integration of services with behavioral wellness, where now we are a step down. The last report that I got, that we were able to step down 8 patients from behavioral wellness into our clinics where they are being managed, and we also have increased our medically assisted therapy or treatment for those that have addiction problems. We, in light of the new ambulance services, we reconfigured the Contract Compliance Committee into the Emergency Medical Care Committee, which had its first meeting almost 2 weeks ago, and it will be enhancing coordination and communication amongst our emergency medical care stakeholders. Finally, we have established and increased the capacity of our foster program, which many of you have been beneficial of that program. And it has implemented 6,000 placements, including the implementation of a doggy day trip program that provided over 3,000 community experiences. Our goals and objectives are still in line with our 4 major strategic priorities. We are still investing in supporting our public health workforce. I'm happy to tell you that the long overdue accreditation by the National Public Health Accreditation Board is on its way. We submitted our application, and we project that by the end of this year, we will be nationally accredited. The accreditation is going to give us a lot of benefit in reviewing many of our policies, but also in reviewing our resources and making sure that we are working efficiently. We have promoted enhanced communication externally, but internally as well. We have currently a contract in establishing an internal dashboard that will make managing of our programs and keeping track of our KPIs and deliverables an easier task, and this is something that is also part of our strategic plan as well as our accreditation direction. We are still looking at equity, and equity as it is not a bad word. It is equity in terms of the services that we deliver for everybody, whether it's north or south, whether it's people who have the ability to pay or not to pay, or whether people that come from different backgrounds with different language barriers and all that. So through our Office of Health Equity, Wellness, and Promotion, we are including our prevention programs and policy development and training and looking at many of our services from an equitable lens. Finally, we are expanding the use of data and technology as data-driven data programming, but also data-managed programs. And we, this year, look forward into launching a communicable disease control and prevention website for community resources and a dashboard that will expand on some of the things that we have done as a linguistically appropriate to include more resources. And we're also looking for environmental health to expand the current software that they use as a SILA to allow public access to inspection reports and permits. Our KPMG priority recommendations were 4. 2 of those were completed. 1 specifically is in the clinic workload and workforce management, where we implemented a monthly visit targets, where we increased some of the efficiencies, which translated into some of the revenues that we have seen. However, in progress is our need for fiscal deficit management. This is something that is part of the 5-year strategic plan, and we are also establishing a working group that is going to look at more efficiencies and how we can design or redesign some of our workflow to improve our revenue. The other one, which was Epic Implementation Data Management, it's also in progress. We have custom dashboards where we can look at each service line and each specialty and be able to manage it more. And we completed the animal service workforce and fiscal management, and many of you do get the operational trends and the monthly reports that are generated by our team members. There are still so many things that we need to be aware of. We definitely are aware that we need to pay more attention to the 2 programs that are in deficit. So we are looking at ways to mitigate some of those deficits, but not a secret that there are so many uncertainties that are coming from the federal government, as well as uncertainty as it relates to the state budget and specifically Medi-Cal, which are, as you saw in the analysis, is a huge source of our revenue. So we are on the lookout for that. And of course, still being aware that with many of the I guess, relaxed and redesigned thought process of prevention and trying to be very delicate in stating that the next public health crisis might be much sooner than we expect, especially when we look at measles outbreak and bird flu and other exciting stuff. So we need to also be ready whenever that happens. Many of our performance measures are still, we aspire to achieve those. We were successful in achieving some. I want to highlight specifically the expansion of our assigned lives by CenCal. These are the Medi-Cal members that select our health centers as their medical home. Although the percentage is not increasing, but we are increasing in absolute numbers. We are in active, always in active communication with CenCal to get more of our share. And I think with the expansion and the redesign of some of our workflows, we are able to get more assigned lives, which will translate hopefully to more revenue. I won't go through each one of those, but finally, the last one, which some of you are specifically interested in, is our customer service as it relates to environmental services. We have been doing much better, and we still aspire to improve our customer satisfaction and our services across all, but specifically as it relates to environmental health. There are no service level reductions. And lastly, I will leave you with a quote from comedian Stephen Wright. I've always admired his subtle sense of humor. But this is wise, astonishingly, where it's if you want the rainbow, then you've got to put up with the rain.
Thank you, Dr. Hamami. Any questions from the board? Supervisor Labanino.
Thank you, Madam Chair. So, Dr. Hamami, on the front of where we're seeing so much uncertainty and change kind of at the federal level, what are you seeing different, or are you seeing any difference in people accessing our clinics for fear, or are we looking at any ways to try to move our services to them instead of having them come to us?
So the first probably several weeks in mid-January to early April, we have seen a I guess, less tendency for our patients to stick to their appointments. There were people that were concerned about showing up to our clinics. We saw more in the past, children were accompanied by their mothers. We saw them being brought by their fathers. We had a lot of canceled appointments where we switched into offering a telehealth visit in that instead. We also have reinforced or re-established some of our policies in terms of what can be shared and what can be not shared. We have redesigned some of our waiting area to give our patients more privacy and more sense of being safe. We also communicated that we are still open to serve everybody that walk through the door regardless. And I think we have stabilized that a little bit. However, the flip side of also what you mentioned is we have seen the first casualty of a CDC termination of funds for what used to be known as the COVID money. That translated into almost $4 million that went into our lab capacity as well as our epidemiology. And this is what we're trying to mitigate now for the next year. This is going to probably reduce some of our ability in the public health lab and some of our disease detection.
Okay, thank you. And I just want to say, I know as one of our premier outward-facing departments, I just really appreciate your leadership style of being out in the community. It really seems like you come from a place of empathy, and your department now is trying more to fit our services to who our customers are, instead of, I think we've spent a lot of time and energy trying to take our customers and fit them into our programs. And so I just want you to know I appreciate that.
Thank you, sir.
Excellent. Supervisor Nelson.
Yes, thank you, Chair Capps. The reserves budget summary, $5 million of one-time operations going towards operations. What would be the reserve balance after we spend the $5 million from our reserves this year to balance the budget?
So we started tapping into that, I believe, 2 years ago, and we started with $20 million. And Gus, you want to add more?
Yeah, so we started, as Dr. Mahamami said, we started tapping into our reserves about 2 years ago, and at the beginning of this year, we have $17 million. We're expecting to have a balance of around $12 million at the end of the current fiscal year.
So we tapped in about 3 million over the last 2 years. Now we're going to tap in 5 million this year.
Yes.
Okay.
And this is why, Supervisor, this is why there is a need for us to start looking down the road, because if we continue with that, in 2 years, we will deplete our funds.
Right.
Yeah.
Which I think is troubling from our perspective
Absolutely,
here. So,
absolutely.
you know, I would hope that next year's one-time funds be less than the 5 million so that we can start to.
That's our hope. And again, a very aggressive goal that we're, even yesterday I had a meeting with all our providers and we delivered the news. It is something that we all have to share in achieving. A 1.5 million every year less is going to be something that not only the leadership is invested in, it has to be the whole department.
Thank you. And then something that caught my attention was the emergency services contract, medical services contract, that you said that compliance is now going to be folded into the EMCC. So that only meets, what, quarterly or a couple times a year? How often does the EMCC meet?
Supervisor Nelson, through the chair, the EMCC right now is, they are still, at our next meeting, will confirm the frequency of the meetings. However, we have initiated that. The initial proposal was a quarterly meeting. However, the chair and body of the EMCC could make that more frequent if they so desired.
Well, I'm concerned that contract compliance is going to only be doing quarterly. What I've heard is it's folded into that, and I thought there'd be some additional contract compliance on top of that. So I'm just trying to right size what I just heard from Dr. Hamami.
And
or
we can
Director Hamami.
definitely convey that to the committee. I do believe that contract compliance is still going to happen by the LIMSA. However, I think the reporting to the EMCC is going to happen.
Okay,
quarterly.
that's a little bit different than what I heard, so I want to make sure that I got that quite right. So, and when does that, under the new contract, when does that actually begin?
Supervisor Nelson, the operational start is May 12th.
May 12th, and then the LIMSA will be meeting monthly to do
Yes,
contract compliance?
there would be a monthly contract compliance calculation that would be made. However, the LAMSA would be reviewing data continually. They get the data daily, and so basically that monitoring is going to be continuous. However, then there's a monthly contract compliance report and calculation made as far as the contract goes.
We haven't done that for a while, right?
Not to my knowledge, no.
Okay, so looking forward to that actually starting again. Thank you.
Thank you. Supervisor Lee.
Thank you, Chair Capps. I see we have a couple of special guests today hanging out right over there. With that said, Dr. Hamai, can you talk about Project Pet Safe?
Absolutely. Project Pet Safe, as my understanding, and I'll let Sarah expand a little bit more, is more a community-based preventive program where some of the work of eliminating the need for pets to come into our shelters happen in the community. So a lot of community education, a lot of licensing, vaccinating, and all that are happening either at community events or through canvassing and visiting some of the pet owners and educating them about how to keep their pets safe, but also how to prevent them from being surrendered to our shelters. One of the benefits of such program is that it would lessen the burden on our shelters, and this way we do not encounter a lot of cost. The program was eliminated at some point. However, it came back partially in 2023. We do have currently one FTE that is providing some elements of Project Pet Safe, and it is producing some of the results. We are still evaluating how valuable or the effectiveness of such a program to see whether we need to expand it or not. However, there are other things that we are also investing in that can support this, or in lieu of that, definitely the use of our new software and technology in increasing licenses. We have seen already a 25% increase from last year in license fees. We are also, again, as I mentioned, our veterinarian is going to be a huge boost in making sure that we are providing more efficient care as well as more cost-effective care. We are looking at our service fees as a way of increasing some of our revenues, and definitely there are, in a year, probably the need to relook at our contracts with the local jurisdictions in terms of ensuring that we are all sharing the cost of caring for our animals. Sarah, you want to add something about Project Pet Safe?
Hi, yes, thank you. Supervisor Lee through the chair. Project Pet Safe has demonstrated previously large growth in license revenue generation, which also is the compliance rate across the county with mandated licensing requirements. And at the time that it was launched, there were 3 staff working that program, and over the years, 2 of those positions have been peeled off to focus on animal care as the expectations of what humane care have changed.
Okay, just a
I don't know
follow-up.
if you had any other specific questions.
So what would it take to get this program back to what it was?
I don't have exact numbers at this time. Knowing that there were 3 people committed to the program and there's currently 1, I think that would be a starting point for establishing the first steps in rebuilding the program back to its the glory that it was before.
Thank you.
Thanks, Sarah.
Did you want to continue on that?
I guess it's a tricky question, as in what would it take? Definitely when we had it in the past, we had completely a different operation, a different process, a different workflow, and we didn't have as much of the tools that we currently have. So this is where I guess the more realistic answer is we are still looking at it right now to see what exactly it can do and what is needed if we want to take it to a higher scale.
Thank you. Supervisor Hartman.
I have about 4 questions. The first, could you expand on the California Children's Services cuts and what that means?
Yes.
That's pretty alarming.
This is, the California Children's Services, it's a tricky way how the state calculates the funding. It is based not on population and services provided as much as expenses. And there were definitely less expenses and therefore less reporting of budgetary needs during the pandemic. And this is where they said, oh, you don't need this much money, we're going to then reduce it. So we are definitely in communication, and not only us, everybody in the state, all the local jurisdiction, we're involving CHIAC as well as our entity that advocate for us in saying your calculation is completely wrong. I think the reductions we had are close to $500,000.
That's correct. So we experienced close to $500,000 in cuts, and we were able to quickly look at vacant positions and not fill them, but yes.
So that $500,000 is definitely going to translate into our less ability to have staff to provide those services. And this is what we do not want to do, because this is not only a mandated program, it's also a needed program. And that's what we're trying to advocate with the state, to reinstate some of those levels.
Yeah, well, my big fear is that undocumented children will no longer be covered. And that's, in the past, the county stepped up. And we're going to have greater demands on your reserve fund rather than fewer going forward. And I think that that's a sobering fact for all of us to think about.
Absolutely.
The second question I have, we're all of us very interested in how data is being used to drive policy and greater efficiency and effectiveness in our programs. And probation has been a real leader in that. I think public health is coming up now. And I wonder if you could describe a few of these initiatives and maybe even with the LIMSA as well.
Right. So we do provide a lot of data, and we sit on a lot of data, and we are able to even generate more data. However, what does it mean, and what can we do with it? I think in the past there were reports that we needed to provide for regulatory or grant requirements or whatever, and sometimes to report to you in terms of what we do. However, those reports, once released, they just go into the vacuum. So now we want to establish a data pool where we are looking at data trends. We are looking at profiles. We're looking at, do we really need to generate this report, and is it feeding into our operations? So we have this new dashboard currently that we're in the process of establishing through a company that's called Achieve It, which would take most of this data and provide it into KPIs. This will have in the future a public interface as well, and we're trying not to duplicate whatever the county is doing in terms of what we had as HHS dashboard. But we are able to show, for example, how many people are benefiting from WIC, or how many patients have been, or how many children have been vaccinated. And that is a two-way tool for us to know that we are doing what we're supposed to be doing, but also it gives the public the opportunity to know that these services are happening and they're available. So this is where we have it, and this is why it is part of our strategic priority through our strategic plan to start thinking of data design programs as well. Data is showing that syphilis is higher in North County, especially among the farm working community. Then it means we need to design a specific bilingual program that is targeting that population and put more resources into that versus a blanket across the whole county. And this is how we are changing.
Thank you. That's a very helpful example. So in criminal justice, we're talking about how these departments can better collaborate. I haven't heard as much discussion about Health and Human Services, that is, Be Well, Public Health, Department of Social Services, and how we can better realize collaboration and better results for the people we serve by more collaboration. Can you comment on that?
It definitely is something that is ideal, and I think we are moving towards that somehow. There are great collaboration that is happening, maybe not as publicized, in terms of how our departments are working together. One that I would love to talk about is a pilot that we started last year that's called Coordinated Entry, or Whole Person Care, where we, as well as probation and community services, have service navigators that are helping anyone that come through any one of these departments, any client that comes through any one of these departments, can access all services that are provided by all our county departments, including social services, including public defender, for example, and all that. And this is a concept that we are investing in exploring further to see whether this can become a way of connecting all the services through one portal, regardless who is the entity that is serving. We have started also early last year in working groups between us and behavioral wellness, specifically with the goal of looking at CalAIM and looking at how do we integrate better in service deliveries, and hence our new role now in psychiatric health, and how do we coordinate that. This is something that continues to grow. Our biggest example probably is going to be in terms of our role in correctional health, and where us, behavioral wellness, the sheriff, and probation are going now to be literally working hand in hand in ensuring that care management and CalAIM deliverables are happening. And I think once all those are in place, then that makes the seamless move between all those departments more achievable.
And I understand you can't do it all at once. It's an incremental process, and I think you've got the goal in mind, and so I'm glad to see that. I also, we did have a board information forum about resources for enforcement on unlawful street vending, and I just wondered if you could expand upon that a little bit.
Sure. Lars?
Supervisor Hartman, through the chair. Yes, the question was related to, I think, an ongoing effort, and one that I thank the board for highlighting recently about coming up with additional tools, enforcement tools to try to ensure that there's a fair playing field with food vendors in our county. Right now, we're allocating resources we can to address those and do that enforcement with environmental health. In the board inquiry form, I think I highlighted some of that effort and the cost associated with that effort. Right now, we're looking at about 430 hours of overtime and after hours and weekend work that our inspectors have provided in support of that, and that continues to grow at this point in time. But it is an effort, I think, that is well worth the commitment, but it is at a cost that's not budgeted. And so that board inquiry form was to highlight those costs at this point in time, but I think more detail will be provided, and I think the board has directed the task force to come back with some other additional recommendations, and we'll be doing that, I think, probably about 6 months from now, I think was the time frame on that. So we look forward to coming back to the board as a collective with various other county departments to make some recommendations on what that effort looks like moving forward.
Great, and my understanding is that we're learning a lot in that task force, and how to design our ordinances in a more focused way that will give us perhaps more tools.
Yes, that's correct, and I think we've met already internally, and we look forward to expanding that to our partnering jurisdictions as well. We do currently work with all the city code enforcement in the county, as well as the unincorporated county sheriff's department. So there's a lot of coordination going on already, but we look forward to continuing to build those bridges so that we can have a coordinated response.
Great, thank you. And then my final question just had to do with animal services, and just wanted to call out how much I've appreciated their support at some of the fire forums we've been doing, and a new program. Maybe Ms. Aguilar could talk about the livestock registration program that she's designed, because one of the biggest problems in my area is when you get the notice to evacuate and you've got, in my case, 6 large animals to get out of there, what do you do?
Thank you. Supervisor Hartman, through the chair. We did relaunch a voluntary livestock and live animal registration. We know that time is of the essence, and when resources are put towards evacuating animals, it's potentially taking away from resources that could be helping people to be safe and also evacuate. So the more information that we have about where large animals reside, what routes they would take to get out, what trailers or other resources might be needed, the better that we can plan and prepare as a county to make sure that we consider all of the needs and target our resources and our information in order to keep as many lives safe as possible.
Great, and you might want to get a PR notice out there and give something for our newsletters, because a lot of us have rural areas where people have livestock and other horses. I don't think of horses as livestock exactly, but so we want to get people to actually use this. So thank you very much. So those are my questions.
Okay, thank you. I just have a few myself. Dr. Hamami, I just want to echo Supervisor Laffanino's praise about how accessible your department is. I've been just really impressed with these health fairs that you've done and the attendance rates. And another example of that is just to emphasize the pet adoption for a day or fostering for a day program. It just really meets people where they are. So I just appreciate that ethos within your department. Okay, you mentioned Medicaid. I went to a disability rights event this weekend. It was alarming, the fear and the worry of caretakers and those who have disabilities with these potential cuts. And the numbers that my staff got from me ahead of the event were that about 35% of our county depends on Medicaid, Medi-Cal. And so that's 157,000 people. And right now, that is being debated in Washington when they get back from recess. So could you just speak a little bit more about what that would look like if these cuts go through? Again, the numbers I had prepared is that it would be about, I think, a 24% cut in California, which would have severe impact on people who, for whom Medicaid and Medi-Cal is a lifeline.
Right. It definitely is something that we're keeping an eye on, and it keeps me up at night.
Yeah.
The thing about it is that we will not see less people because we are a safety net.
Yep.
However, we are going to see less people that we can bill. So the volume at our clinics are federally qualified health centers. That means you do not turn anybody away.
I see.
And right now, if let's say out of the 100 we're seeing 70 come with Medicaid or Medi-Cal, then if they lose that 100 is still going to come, but only 50 will come with Medi-Cal. But we are still providing service to the 50 that are uninsured. So it will definitely put a financial burden on our operation.
Absolutely, yeah.
And we are still the safety net. We are still going to see those people, and we are still going to provide the service that they need and they deserve. How is a different story. And this is where we're looking at different scenarios.
Yeah, something definitely for us to keep an eye on, and let's hope that those cuts don't go through in the next, I think we'll know in the next few weeks, but I appreciate that. And you mentioned vaccination, and also Supervisor Hartman asked about data. So I just want to be clear, I know that childhood vaccinations went down as a whole during the pandemic because parents just didn't take their kids to the doctor as much, understandably. So could you just give us a snapshot? We've seen some measles deaths in places like Texas. Our department tracks that, is that accurate?
So yes and no. The state of California did not have a childhood vaccine tracking program until 2 years ago. So the data is still relatively fresh.
I see.
The way we can get it, which is skewed data, is looking at children in schools that are vaccinated. However, because it's a mandate to get vaccinated to get into school, then that percentage is 90% or 98% or whatever. Because if you're not vaccinated, then you are not in school.
Right.
So that data is not as reliable. We are now looking at the new registry, and we're trying to extrapolate some of those numbers, as well as what is the national trend. So I do believe that the county at large is not in a bad place. We are probably at the 70% or 70-ish%, which is what you want for herd immunity, but we definitely want to increase that. How is it going to look like this year is something that we are definitely looking at and watching.
And you mentioned schools because, again, just my interest in schools. Can you speak a little bit about the relationship between your department and schools, for example, with vaccine, if there's a push, or would, I would hope that would be the first place to start.
Absolutely. Our immunization program works mostly on vaccine promotion and vaccine education, and this is mostly what we do in the community. All the vaccines are provided through our clinical care, which are our health centers. However, we do understand that there is a need to be more involved in school health, and last year we established a school health liaison, and we are working closely with the school districts as well as the county superintendent in evaluating what are some of the needs. The needs might be different in Santa Maria versus Guadalupe versus what's happening in Santa Barbara. And we want to, and this is where our health officer, Dr. Ansorg, now sits on a school wellness committee to understand what exactly we can contribute. Definitely, if the need for childhood immunizations in schools is needed in any of the school districts, then we will do that. We have communicated with the State Department. Again, the differences between states are what I'm learning. For example, Michigan, where I came from, had a school immunization program. My team would go to the 130 schools and vaccinate children on the spot. CDPH does not require that, and there is no money for vaccine to be in schools. So we have to use that as part of community outreach, and there are different ways of doing that. So this is something that definitely is in our plan of looking at what is needed in schools. I remember first year when I got here and I was meeting with Santa Barbara school superintendent, one of the issues were vision screening.
Yeah.
So that's something that we definitely are looking into. And if there is a need and numbers that justify establishing some of those programs, this is where, again, the data showing and trends is going to put us into where we want to be.
Thank you. I'm very interested in if we ever get close to threatening the herd immunity. So if you could please make sure to highlight that for us and the public so that we can do our part. I know that we came close a few years back with polio. We're getting close to threatening the herd immunity. And I, again, just have this worry that we might be veering in that direction again. Sure. Thank you so much. That's it for me. Supervisor Nelson.
Yes, just one follow-up on the unpermitted food vendor question that Supervisor Hartman brought up. You know, it occurred to me that, you know, our enforcement is paid for by permitting fees. Is that how that's typically, how does the enforcement, the food inspectors, is that paid for through generated fees?
Supervisor Nelson, through the chair, the majority of our revenue and that supports the food program are paid for by permitted food businesses and their permit fees. That includes complaints, public inquiries, other responses that we do, and so those are built into the cost and the fee revenue that we get.
And that's where I kind of had this aha moment was, you know, I guess I don't understand that prioritization on enforcement and why that's not the premier or highest priority for environmental health, just because, you know, those that are permitted are paying for permits, you know, for inspections on themselves, but they can't get inspections on those who aren't participating in the process. And it seems like that should probably be the highest and best use of energy, because, you know, something that's permitted is probably more likely, you know, following most of the rules. You know, we got these group of people that are following none of the rules. And it just seems to me that it makes a lot more sense that it would be all hands on deck to address that issue first before going back to the permitted public who's at least participating in a process. You know, just participating in the process itself seems to suggest that it would be someone who's compliant. So just kind of the aha moment there, and that would also provide then value for those people who are paying for their permits, that they know that at least that they're being protected from that unfair competition. So anyway, just maybe that's just a little off topic, but I think it is, you know, for budget workshops, but it definitely highlights that that's an issue. And I hope that you guys can work within your ongoing budget to continue to address that, because it continues to persist throughout the county and is a real issue that I think needs to be addressed sooner than later. Thank you.
Thank you.
Supervisor Hartman.
Just wanted to add something quickly. Dr. Hamami and I both serve on the CenCal board. The CenCal is the administrator for the Medicaid, Medi-Cal program in our county, and they are very active in advocating in Washington right now for the providers. And as your representative on that board, I've signed on to a letter, but others are welcome to do the same, and they could contact Gina Fisher in my office if they have an interest.
Good to know. Thank you. Okay, we had a lot of questions for you. It's a big department, and appreciate the answers and the dialogue. Thanks to the team.
Thank you.
And we will move on to first five. Dr. Sims-Moton, welcome.
Good morning. Good morning, everyone. I think I may be kicked. So good morning, Chair Capps and members of the board. I'm Wendy Sims-Moton, the proud director of First Five Santa Barbara County. With me here today to present our fiscal year 25-26 budget that is rounded to the nearest hundredth. I want to shout out to, to Charlotte Mack, who is our budget analyst, and we were always making sure that we were rounding it to the nearest hundred. So we did it, and thank you, Charlotte, as we were navigating through that. So here with me today, and as well as online, is Deputy Director Michelle Robertson, Liliana Martinez, our office administrator. I also want to give a shout out to Liliana, who was very patient and graceful as she was very much supporting this budget process this year. And Sarah Gonzalez is the clerk of the commission. They're online. And Brianna Don is our PIO and communications manager. And Caitlin Kenner is the evaluation manager. And Lexi Brenner are all online. And I just want to acknowledge and thank them for their contributions to this budget and this presentation as well. I just want to just say this opening slide really is, if you're familiar with the weekend radio show called Top 10 Now and Then, this is a take on that. This is Prop 10 Now and Then, who we were as we were little folks and who we are now as adults. So we just always want to keep it real about it's about the children all the time. And this opportunity, when we were putting this together, really had us an opportunity to talk about our childhood experiences and what we have stories behind each of these pictures. But we can talk offline, but the best one that came out of this conversation was Michelle's bangs there that she talked about, that the story about that was really funny. But it was just, it's always, it's important to talk about childhood experiences. And as I listened to the presentations that were before us on even yesterday and today, how critical it is to make sure that we are working and coordinating with all of those departments so that we can make sure that all the children, they have a great childhood experience, because that is the absolute entryway to adulthood. You can't get past it, so it's might as well get a good and strong start. So thank you. The key takeaways that we really want to be able to talk about today, that it's 25 years of First Five when voters passed this very critical legislation that was, to make sure that we were building our own childhood systems in state and local levels. And so it has been critically important to be able to make sure that we're elevating, educating, and making sure that we are emphasizing the importance of those early years. And through in this last 25 years here in Santa Barbara County, we've done a lot of great things. I've had the fortune to be here since the very beginning, and including this year, we've actually distributed about $70 million in services. I can think back, starting back with playground equipment, and making sure that it was safe for kids to be able to do that, coming to home visitation. So a lot of things that are there that weren't there, but for Prop 10 wouldn't have had the attention on it. So I want to acknowledge that and appreciate the fact that we do have this service still in our county. Also, we're getting ready to go into our new strategic plan in the post 25 years that really going to be reflecting upon the lessons that we've learned in these last 25 years and taking that forward, and how do we evolve and make sure that we're continuing to meet the needs of today that the kids are being presented with. And as we move into our next 25 years, it's going to be guided mainly through policy and change in the changing roles of First Fives across the state. We're coming in 25 years ago, we were a huge influx of dollars into the community, but knowing that there was an inherent decreasing of funding in there, we have evolved in making sure that we have adapted over the years to make sure that not only being defined by the decline of it, but more about the impact that needs to be made in those early years. And so we're looking forward to that, and we'll be out into the community, convening in a way that we did 25 years ago, really out in the community, asking the questions in the community, making sure that we who are leaders and gathering data, that we understand that data, how are we sharing that data with the community to make sure that it's aligned with what is really happening on the line in the communities. Our budget, the numbers are what they are. It's about $3 million. It's not too different from what it has been over the last 5 years. It has that decline, but we continue to adapt and make the necessary changes to ensure that we continue to be impactful in the community, still making sure that we are touching those kids at the earliest moments and their families. And this year, because this year 25-26, which is the first year of our new strategic plan, there is less of a decline. You see a huge decrease in the amount of the one-time use of ongoing funds because we are going to reinvest after the strategic planning process. We'll determine what investments will go out into the community. So this year, you'll see less of needing to release from the reserve as a result of that, and then we'll come back next year to determine what investments would go out to the community. These are our three major budget areas of service. We have administration, that you see the numbers there. We have measurement and evaluation. It is a call out through the Prop 10 that we have to make sure there's a separate accounting for our measurement and evaluation. So that's where you see the different budgets there. And then the investment in the program support is the care where our staff is making the things that they're doing internally, as well as the investments that we're making out into the communities. And these are the four areas that are mandated by the proposition. It's the improved family function, improved child health, improved child development, improved systems of care. All 58 counties, including the state commission, have to adhere to these counties, but locally you determine what strategies to go toward improving family functioning. And you don't see those dollars there because, again, this is the planning year. We're going to be using this year to gather the data, and then coming next year, based on that conversation, what we would then be investing out into the community. And I think, this is really important. I think everything that has come and presented today, that we're talking about what we need to do, the different things, is that this is a quote by Alice Walker that look closely at the present you are constructing. It should look like the future you are dreaming. And so we also just wanted to share a story of our home visitors. That was our first pediatric summit that included Santa Barbara, Ventura, and San Luis Obispo counties. So if you could play that.
We visit parents, new parents in the home where they are most vulnerable.
Getting housing for them, helping them find a job, going back to school, childcare.
Providing local resources, providing emotional support in that moment. Our biggest thing is just to try and make someone's life a little bit easier.
So it's almost like a coach that we're there for our families.
So just being able to tell them, it's okay, everybody's process is different, and every child is different. So each child brings their own complications, their own struggles, and it's always great to just be there as support to help them.
It's just magical when everything works out and you can help a family with any resources, getting a home, helping them with food, anything that makes their life easier.
Telling them, I'm here to support you, whatever that looks like for you or whatever support you may need, I'm there.
Thank you for that. We know that home visitation is that also there's a window of opportunity where children are born and they've been home and parents are struggling. They have a new baby sometimes too, and little ones that are there. And so each child is different, so they have different support. So be able to be there at that moment when you're really able to answer those questions and get a sense of relief that someone kind of knows and they feel what I'm going through. So our home visitors are very important to that, and it's an important piece of the work that we do. Our staffing summary has not changed pretty much over the years. We've maintained 7 and 8, depending on if there are additional dollars that are coming in from the outside that we needed a position to do that work. We did a FTE where we unfunded an FTE during the middle of this year, and so we unfunded that position, which allowed us to do, because we are without a fiscal analyst, and so really taking a good look at our internal operations to look for opportunities for internal growth and also the efficiency use of the dollars. And so what we did was unfund the fiscal analyst position and use it in a different way. The fact that we were doing a reclassification for an internal position to work with the fiscal operations, as well as it also allowed us to fund the mid-year management classification changes. And as I said, our operating budget remains the same, and it is about $1 million less than in previous years, particularly in this last year, because we had additional dollars that we were able to pull down from the state. But know that $1 million cut is really not a permanent. It's just while we are planning this year and figuring out how we're going to reinvest those back into the community in the new fiscal plan. Our anticipated accomplishment is that we are concluding this strategic plan. I think for the last 2 years, we're in the last year of our strategic plan. We are truly concluding that. I think it has been successful. This is the last strategic plan of the 25 years that has come across this county, and I think we've been doing very well, again, adapting each strategic plan to what is going on in the community with our funding. And then we know during the last 4 years, there has been an improvement with kindergarten readiness. The more that we focus and narrow our focus on school readiness, we know those scores will go up. And working even more closely with our school districts, our partner agencies, and our anchor agencies. And also, we began the process of results counts framework, working with the Annie E. Casey Foundation, how we start to use the data that we're gathering, training leaders to be able to use that data, making sure that we're able to communicate that out to our to communities, and making sure the data that we're having, that we're gathering, does it reflect what's really going on in our community. So we're starting to look at that in our next year strategic planning. And as a part of, a savings, we did close our Santa Maria office. Being efficient with that, we only really need one office based on the services that we are providing, but we still continue to cover the entire county to be able to make sure that all the children, basically, that we're in charge of looking at, that we continue to meet those needs as well. And of course, we completed a successful third-party audit. It is necessary. We don't complete it well, we don't get money. So we always make sure that we have a good one and that it's successful. And our goals, as you know, in the next coming year, we're going to draft and adopt a new 4-year strategic plan. And the next year, really excited about that process, because I really think this first year of 25-26 is really going to get us out into the community, be more in touch in the community as to what happened, and to really begin to make sure the community knows that we're in touch and that we're not out of touch, because we're going to hear it from them we're going to convene family groups, we're going to convene various groups across our county to make sure that we're gathering from all perspectives. And again, it gives us the opportunity to talk, to make sure that we're still talking about the importance of early care and education. I had the opportunity to, just last week, to attend Advocacy Day in Sacramento, and a lot of the staffers that we met for Assemblymember Hart and Senator Lamone, they had new staff. And so it is an opportunity to talk about First Five, from which they did not have an idea or a clue in terms of what it was. But it was, again, that opportunity to keep it on the forefront, how critical early care, the care and education of our children. And as I said, as part of that, we're going to continue to gather and build stories in our community and design our next steps to how we're going to now invest into the community for impact. And we're going to hold conversations and create meaning, moving research beyond just talking about it, but moving it from action to results. And as we strive for equity, we continue to do that, includes for every child aged birth through 5 years of age. We just recently had a conversation with our commission to update our racial and justice equity plan. It was a good conversation. It's a needed conversation. It's a necessary conversation. It needs to be an ongoing conversation. Equity is the opportunity to make sure that voices are heard, folks are at the table, and we get to hear the diverse voices to make the services that we provide much better and much more aligned with what services are being presented for need. So we hope to present to our commission on May 25th a final draft of the discussions to have that. We continue we inherently, because we have a declining in revenue, so we are always monitoring Prop 10 revenue, and we continue to have residual impacts from the passage of Prop 31, which is the flavor ban, which was the absolute right thing to do. But we tend to do that and making sure that we are aligning and adapting to make sure, again, that it's not impacting the services that we need to get out to the community. In our long-term fiscal plan, we are redoing that as well, along with the strategic planning process as well, and we consider that it's a natural decline, and as I said before, we're not going to be defined by the decline, but rather the impact that we make. So I'm going to refer to Ms. Robinson to talk about the performance measures, if you will start there.
Good morning, board and administrative staff. You were given a packet of our annual results through our focus areas, and then also an overview brief. You could see that not all of the work that we do can be captured in one performance measure slide, but here we're highlighting what is our strategic intent, which has been for the past 4 years and will continue in our 25 through 29 strategic plan, and that is that 70% of all children entering kindergarten are ready, and we defined ready as the ability to access the curriculum and also have their social and emotional needs developmentally where they should be in order for them to be successful. 70% is very aspirational. You can see we are not quite meeting that, not for lack of trying, but lots of things have been occurring. We kicked off our strategic plan in the middle of COVID, which affected a lot of our ability to see some of our strategies come to fruition. But even with that, we remain out of 18 elementary school districts in the county, that 10 of them are engaged with us on an ongoing basis, which represents about 75% of all entering kindergartners. We tend to have about 35 to 5,000 births per year, so anywhere between 30 and 35,000 children. So we feel serving 3872 out of the 5,000 is a pretty good indicator of how we're doing. School-ready, cognitive school-ready knowledge is basically 6 indicators. Basic school-ready skills such as knowing your numbers, your shapes, some letters, some pre-reading and pre-math skills. And then social emotional readiness is, are they able to self-regulate? Are they able to not poke their friend that they're sitting next to? Are they able to ask an adult for help? This is based on a screening tool developed by UCSB that is valid and reliable and also correlated to 3rd grade math and reading scores. So we've actually been tracking this for 20 years, starting with Santa Maria Bonita School District. So we've been able to see the trends across time, and just was recently published in a couple of education journals. Yeah, so in your packet again, gets into deeper data. If you ever want to know the state of the children and families in the community, our briefs are the place to look. And we'll be doing a 4-year cumulative report on everything that we did in the strategic plan. It'll be ready in September.
Thank you, Michelle. And so our next slide is there's no service level reductions here. We're very fortunate to not be able to do that. And so again, this is, I feel, a quote that bears repeating. To look closely at the present you are constructing, it should look like the future you are dreaming. And I know that if we start at early care and education, we're always going to make sure it's going to look like the future we're dreaming. So thank you for your time today, and if you have any questions.
Thank you to the First Five Department. Any questions from the board? Supervisor Nelson.
Yes, thank you, Chair Capps, and thank you, Director Simpson-Moton, for your presentation. Just a few questions. I was just thinking about the measurement, and those are good measurements, but a lot of that's outside your guys' control. And so I just, I know that's very aspirational that you guys want to impact some greater number, but it makes me think whether that's appropriate, just because you guys have such a limited contact to actually influence some of those numbers. Obviously, that's your goal, is to influence that overall, but there's so much of that that's outside of your power, and I just don't know how fair that is for you guys to hold yourself to that standard when you guys only have a piece of that. And maybe if there was some way to quantify something a little bit more specific, that might help you guys achieve a success. And then that's also what you sell to the public is, hey, if you tie into what we're doing, you can be a part of those successes. That was just, I guess, a comment there. I didn't understand the $1 million less this year in your budget. So it's about 25% less in your budget. It's a significant amount. You're saying that money's not going away. So I'm trying to, it's just that you guys are in a planning year, and so it doesn't.
Yes, so as you can see, I'm not sure which number that slide is. You can see pretty much our budget has been about $3 million, averaging about $3 million, maybe probably 3.23, depending on if there's additional dollars from the state any additional dollars. So in that 4.2 year that you see there, that included $950,000 from a grant from the state.
Okay.
And so that's what our budget is now. It's $1 million less from that, not because funds are going away. That program is going away, but 3.2 million is essentially our average budget if you look at it, a little bit less than that.
Okay, so 3.2 is essentially your baseline. You guys go up and down from that based on grants that you guys might be able to receive. And the grant that you currently have is expiring.
Yeah, the $954,000 was a 2-year grant that expires this year, which increased that budget to 4.2. The 3.2 million would probably be a little bit higher, closer to the 3.8. But again, those were not investing out until we get the new strategies coming in the new strategic plan. And that was indicative of the 13,000, I think, that was being released from the reserve, because we're not funding in the community at the level we would have until we get in the new strategic plan.
And what are the current reserves in first 5?
I think it's probably about $6 million in our reserve.
Okay, great. And then you guys mentioned about the state of the family that you guys do, or state of the children. I mean, it seems like that might be something that's, I don't know if that's in concert or that overlaps with what social services does with the Children's Network. They also have a similar deal. Is that the same thing, or is that, are we doing it twice?
Is it the Kids Network scorecard you're
Yeah.
referring to? Yeah, there's 0 to 12, and so actually 0 to 18 at some point. So we're restricted legislatively, so ours is about the youngest.
And
But
they-
we do contribute to that scorecard.
Okay,
as well.
gotcha. And then, it just occurred to me, the accomplishments in closing the Santa Maria office, obviously, I didn't know if that was an accomplishment or not. I understand you're trying to save costs, but, imagine that, most of your clients are probably in the North County. Did you guys consider possibly just moving the office to Santa Maria to be closer to the clientele that was there, probably more affordable rents, other options that might be better for an organization that's trying to manage towards the future?
Actually, before we actually made that decision, it took us about a year to determine that. Some of that had to do with safety. A lot of those things had to do with where we were, in terms of the area where we were. We looked at many areas, and the cost of it really came down to, they were about the same level of cost that we were just, having to do in our Santa Barbara office. And now it used to be very pertinent to have an office in Santa Maria, because that's where we were doing more direct service, whereas we're doing less of that now. Okay.
And then lastly, you mentioned that other counties throughout the state are wrestling with first 5 and the future first 5. What does that look like in other counties? What are you seeing as, as some of those dollars dwindle? Is first 5 being absorbed into other departments? How does that look throughout the rest of the state?
Well, first 5s across the state, some are within county departments right now, some are independent, some are quasi, essentially like us. But what we're seeing across is the fact that a lot of the direct services that were being provided by first 5s are now not be able to do that. And so how do we then combine our services, collaborate with other departments also that's, facing with revenue declines as well. So it's really just about how, what more can we do with regards to, do we close them down? Do we work more regionally? It could be where we're at San Luis, Ventura, and Santa Barbara, is it become more in a regional thing? So there's a lot of options that we're starting to look at, but it depends on the county. In smaller counties where first 5 is the only direct service, probably we're looking at what does that mean to be able to do that. And so we, the association, which is made up of all 58 executive directors, are coming together often to talk about what's going on in the various counties individually and locally, and how do we need to come together as a whole. Also working with the state commission and figuring out how we can kind of manage and navigate what does the state commission look like, how we can collaborate those funds to be able to, get us through. But I don't know that necessarily combining offices is something that I've heard, across the county. It's always on the table to be able to do that. But it's still, because it's its own special, unique kind of funding source, it's kind of hard to just kind of combine it into a number of departments.
Yes, I was curious, are we anticipating hearing some conversations over the next couple of years, maybe here? And does that end up getting decided by the board, or does that get something decided by the first 5 commission?
It's by the commission.
So the commission decides the structure moving forward?
Yeah, we have the statute of how we need to be, and then if there's something they need to change that, then we'd have to go and look at the statute, how they would do that, how we would need to do that, but that would rest with the commission and then come and making this as a recommendation to the board.
Okay, thank you.
Supervisor Hartman.
I had a question. Your anticipated accomplishment is raising by 8% kindergarten readiness in the last 4 years. And I was just trying to reconcile, I mean, that's extraordinary, but with the performance measures that you set out, so could you explain my confusion?
Yeah, so when we started the strategic plan in 2021, we were operating off of baseline data from 2017, 2018. At that time, the school readiness throughout the county was extremely low, 15 to 20%. So in those years, we've made strides. You'll see 1 year went up higher because we put a lot of effort in. Then what you're seeing this year is all of the children born during COVID or that were in infant and toddler are now hitting school. And so you're seeing a drop because of their lack of exposure to high quality early learning opportunities, different family stressors, this and that. So it's going to ebb and flow. But we're still making progress. So that's an accomplishment, right? It may not be this large, peak, but we are making progress.
Well, that's great to hear. I think this comment goes back to what Supervisor Nelson mentioned. Should you carve out something smaller? I once served on the board, and I came to understand that First Five is a backbone organization that really isn't competing with other child and family serving organizations. It's trying to bring collaboration and trying to support different programs. And I think, I hope you keep your noble goal of kindergarten readiness, even though it's not all within your control. You're an extremely important organization to keep that goal center for all the others. I had a question. Where is Head Start now in our county?
They're in Communify. That's where they could, but in terms of.
Right, in terms of funding or.
They are severely cut. I think it was they just closed the 2 regional offices, I believe, that were in San Francisco. We've been meeting with Patricia, the head of Communify, to see where we can do, how we can support, be that advocacy or bringing resources together at the state level and across the First Fives. And so they're in severe what they need to do next. And they know that the first was that they could function with a percentage. I think she said between a 10 and 12%, 15%, they would be okay. Anything above that, then it would be catastrophic.
So the schools are still open, but
yes.
Okay.
Yes. And we are watching that as a First Five association, because that is, again, one of those pieces that we don't have control of, but it's part of what we're trying to do to make sure that kindergarten readiness is there.
Thank you.
Supervisor Lee. Are you?
Oh.
Okay. Most of it's been covered, but I just wanted to have you speak a bit about how eventual mandatory TK is helping your work, hopefully.
Yeah.
Yeah, so thank you for all the questions about and worrying about our aspirational goal. However, our legislative mandate is kindergarten readiness, so that that's not ever going to go away. Where we can control, right, is the conversations, the facilitated conversations that we're having. So TK is a big investment for the state. We're super proud of that. But as we know, those of us who've been in school districts, it's just this little piece of a really large thing. So First Five has really taken the opportunity to help have those conversations about what quality looks like, helping them to understand how to set up environments that'll work. That goes hand in hand with our partnerships with State Preschool and Head Start and all other child care feeding into the system. So our improved child development focus area is having all of those conversations with those providers. We still think TK can be a game changer in terms of our K readiness if it's done correctly, right? So out of these 10 districts that was part of our work, developing early learning plans with them that would include what that full high-quality rollout would look like. So we've invested over $1 million each year for the last 4 years into that. Where the $1 million went this coming year is that we've pulled back on that to now have districts start to claim that work a little bit more. And so we're still doing little kind of teaser grants with them, but we'll reevaluate where we want to invest, probably back to Title I schools and those districts that have the most marginalized and higher burden students moving forward.
And I realize this is adjacent to your work, but do you have a sense of the proportion of TK for 4-year-old, 5-year-olds that are eligible now? I mean, what percentage of our public schools
that are
offer
attending TK
currently?
It all depends. Working parents still have a hard time accessing TK because it is on a school calendar. Even with the Early Learning Opportunity Program, which is the after-school extended hours, it still can get challenging during intersessions like summer. But I would say about 70% to 75% of eligible TK students are accessing. Santa Maria Bonita in particular turned all of their state preschool classrooms into TK, and so many districts took the rollout and just did it right away instead of waiting for 25, 26. So we're starting to see the results of that now.
Great. Well, and thank you, Supervisor Hartman, for bringing up Head Start. I know that 600 families depend on Head Start here locally, so those cuts are a huge concern. I think that might be it for us, and just an appreciation for the work you do focusing on our little ones.
Yeah. Okay.
Thank you.
Thank you.
Okay, we move right along to another not so small department, social services. All good news from Director Nielsen, right?
I beg your pardon?
All good news, correct?
Not so good news with a positive attitude.
Perfect.
So I'm Daniel Nielsen, your Director of the Social Justice Services Department. Before I introduce my staff that are with me here today, I would like to express my heartfelt appreciation to CEO Mona Miyasato and to our County Budget Director, Paul Clemente, and his staff. They've worked very much with us over the past 10 weeks or so, spent a lot of hours working collaboratively with us to get us to this point today where we're at with our budget. So I very much appreciate that. With me today is Assistant Director Amy Kruger, Chief Financial and Administrative Officer Rachel Lippman, Chief Fiscal Officer AJ Kinoveva, Assistant Director Maria Gardner, and Alyssa Stovall is a program manager from the Workforce Development Board area. She's here in place of Luis Servine, who could not be here today. As we began our budget process this year, we had a $14.2 million gap when we attempted to create a status quo budget. We unfunded 46 positions that were vacant or anticipated to be vacant by the end of the year, and made reductions in contracted services and IT equipment replacement. That got us to a $3.4 million shortfall, which the CEO is recommending be filled with one-time funds. The primary drivers of our gap are in 4 areas. There has been minimal growth in both 1991 and 2011 realignment revenues compared to the increasing costs associated with activities that those revenues support. As an example, our total realignment revenues in the current year are $752,000 less than they were in the 23-24 fiscal year, and we are only anticipating a 4.9% growth increase in those funds in the budget year. Another example is that we are currently owed $556,000 in 1991 realignment caseload growth from the 23-24 fiscal year that we had hoped to receive this year. We didn't budget for it, but we hoped, and that we will not be receiving this year and will not be receiving until some future year when the economy improves enough that that money will be paid. The second gap area is the cost of living increase for the administration of the Medi-Cal program, previously implemented by the state. which was supposed to give us a guaranteed percentage increase every year for the administration of Medi-Cal. That was frozen in the current budget year and is frozen next year and is frozen for the 2 subsequent years after that. That totals $854,000 in revenues that we're not receiving this year and in the budget year. In the CalFresh program, as the result of state actions after our current budget was approved, our budget in CalFresh was reduced by $2.3 million in the current year and will only increase by $1.1 million in the budget year. The third area is in our categorical aid, which grew by an unexpected $1.1 million in the current year and is expected to grow an additional $3.6 million in the budget year. Categorical aid is payments to families and individuals in the CalWORKS, foster care, and adoptions assistance programs. The fourth area is that the department is charged the amount the department is charged in county charges has grown by 50% over the 4 years, outpacing the rate of growth in our revenues. There is a net increase of $4.9 million in charges over those 4 years, which is a combination of higher internal service fund charges from general services, information technology, and risk management. We are unable to maximize the amount of CalFresh allocation available to us, even if your board supports the filling of our gap with one-time funds, as those funds will only support existing staffing levels. We still have $3 million in CalFresh allocation from the state and federal government that we are not able to draw down due to a lack of $870,000 in required match. In addition to the structural issues with our revenues and expenses, the federal funding for our programs remains uncertain due to the new administration's review and potential reduction in federal spending, as well as decisions made by Congress that we anticipate will impact funding levels, as well as who is eligible for Medi-Cal, CalFresh, CalWORKS, and the Workforce Innovation and Opportunity Act programs. There is also a possibility that the Child Welfare and Adult Protective Service program could be impacted. State decisions about how they will respond to those federal decisions and what direction they will give the counties is also unknown, as is the impact to our programs by changes to the proposed state budget that will occur in the May revise. Should the board approve the use of one-time funds to fill our gap, the department will still need to return to your board in the fall to present a thorough update on the impact of federal and state actions that will occur in the coming months, as well as take a closer look at updated revenue and expenditure projections. The department's operating budget totals $237 million, with $1.3 million allocated from one-time funds for ongoing operations, representing 0.5% of total revenue sources. The capital budget is $67,000. Total general fund contribution is $12.9 million, which includes general county program transfers that I will address when we get to slide 5. The department is budgeted for 858 full-time equivalents. Any positions currently vacant have been unfunded in the recommended budget, and no restoration or expansion requests have been included in the budget for the fiscal year. This chart reflects the programs and services in our 3 budget areas. 86% of our staff provide direct services to the community, and the remainder support those staff in completing their duties. Under the heading of General County Program Transfers, we have $300,000 for the in-home supportive services program and $3.4 million to close our budget gap. The state requires an IHSS maintenance of effort annual increase for the counties to increase their local share of costs by 4%, plus pay the local share for any negotiated pay increases. Our increased local cost for the budget year is $534,500. If we have unanticipated 1991 realignment revenue in the budget year, we will reduce the amount of this transfer accordingly. As a point of context related to the IHSS program, the total cost for the IHSS program in the budget year is $126 million, and the local share of that is $13.9 million, which is 11% of the total. As discussed on an earlier slide, our preliminary budget has a $3.4 million gap remaining, even with even after $10.8 million in cost reductions. This chart reflects our staffing levels for the past 4 adopted budgets and the proposed staffing level for fiscal year 25-26. The lower staffing levels are a result of the factors addressed on the first slide of our presentation. Our operating budget for fiscal year 25-26 totals $237 million, a decrease of $1.6 million from fiscal year 24-25. The net decrease in operating budget is comprised of a reduction in salary and benefits of $3.3 million, driven primarily by a $1.7 million decrease in reduced staffing levels and a $1.5 million decrease in overtime costs, a reduction in services and supplies of $2.9 million, primarily due to reduction, elimination, or deferral of contractual expenses and use of consultants and our computer replacement cycle. An increase in other charges of $4.6 million is primarily due to increase in cash assistance payments and a $700,000 increase in charges for liability insurance. We have several accomplishments that we would like to highlight today on this slide and the next. Each month, the Department of Social Services serves over 176,000 county residents, or 40% of the county population, and over 69,000 children, or 71% of the county's child population. To respond effectively during emergencies, enhance public safety, and contribute to a more prepared and resilient county, we train staff on safety and security topics, including de-escalation, mental health first aid, building evacuation, Red Cross sheltering, and disaster service worker responsibilities. And I know your board knows this, but just for the public that's watching, the Department of Social Services is responsible for care and sheltering in the event of any declared disaster countywide. In order to align with the priorities identified in the Children's Scorecard, we expanded services through the Family First Preservation Services Act to increase primary prevention services for those families with children at risk of entering the foster care system. The Adult and Aging Network completed the local master plan for aging as a first step toward addressing the current, emerging, and future needs of older adults, people with disabilities, and caregivers through cross-sector collaborations and transformational systems changes. As a critical partner in the county's California Advancing and Innovating Medi-Cal, otherwise known as CalAIM, we have made improvements, including a data sharing agreement to reduce manual work, the screening for Medi-Cal of every person booked in the jail, and the engagement with people not in custody while they are at the court in accordance with Proposition 36. Lastly, the Workforce Development Board has secured $3.2 million in local, state, and federal grant funding for the Farm Worker Resource Center, ensuring the county can continue providing essential services and resources to the agricultural community. Some of our goals and objectives are listed on this slide and the next. We will upgrade our IT division online help desk ticketing system to include facilities requests. This will allow another core central services division of our department to manage and monitor service requests efficiently, improving overall responsiveness and support for the department. We are reinstating our leadership and professional development program, which utilizes supervisors and managers to provide training and mentorship to line staff. The department takes an active role in fighting food insecurity, and a key aspect of these efforts is the CalFresh Utilization Committee. The purpose of this committee is to ensure that barriers are identified and removed, communication and outreach campaigns are implemented, and strategic goals and initiatives are developed so individuals and families in the community who qualify and need food assistance have access to CalFresh benefits. The department will continue to work with critical county partners, including behavioral wellness, public health, sheriff, probation, public defender, and the county executive office and CenCal Health to ensure that the CalAIM justice-involved population is served and has access to Medi-Cal benefits in a timely manner. In child welfare, we are preparing for CWS Cares, which is the new automated child welfare system, which is scheduled to go live in 2026. This new system is designed to better support both staff and families we serve by automating tasks, streamlining workflows, and creating a more interactive platform, helping us to work smarter and stay connected with our clients and partners. We are also working closely with behavioral wellness to strengthen the continuum of care for children and youth through the BH Connect program. The program expands funding to support children and youth who are involved in child welfare and who have or are at risk of significant behavioral health conditions, provides for joint child welfare and specialty mental health assessments, and establishes a dedicated child welfare liaison to improve communication and reduce barriers to receiving care. The Workforce Development Board will continue leading industry sector roundtable initiatives in partnership with local chambers to facilitate connections between industry and education partners, enhancing a local workforce development pipeline that promotes internships and work-based learning opportunities. Several key priority operational performance review recommendations have been fully implemented to improve efficiency and workforce alignment. The lead worker model was completed in June 2022 and continues in operation. Each district office has a multi-program intake unit where eligibility staff are trained in multiple programs, including Medi-Cal, CalFresh, CalWorks, and General Relief. This allows for a client to work with one staff member when applying for multiple programs and improves customer service, and allows us to quickly pivot work assignments based on annual program funding allocations, as well as peak season demands. While the workload and staffing analysis has been completed and acted on, it is important to note that our programs are dynamic, and the reality is that we continually make workload and staffing adjustments as regulations change, updated tools are implemented, and/or funding changes. The suggestion related to automated scheduling was completed in July 2023, shortly after our CalSAW system went live in April of the same year. The Benefit Service Center now uses an automated scheduling system which allows us to direct staff to high-priority tasks, improving service accessibility. The final priority recommendation we would like to highlight is outcome-based program measures. Beyond state-mandated metrics, we have adopted additional measures to track the impact of our programs, including the rate of CalWorks program reentries, improved linkages coordination, and increased permanency for children. On our slide of fiscal issues to watch, as I said at the beginning, we have a great deal of uncertainty at the federal level between the executive orders signed by the president, which are in the process of being acted on by various federal departments, the cuts being implemented by the Department of Government Efficiency, and legislative action in Congress that will likely lead to reducing the size and scope of CalFresh, Medi-Cal, and CalWorks programs. The department is in a position of waiting to see from day to day what actual decisions get made in a manner that makes them actionable, and most importantly, waiting to see what the state of California and the California Department of Social Services directs us to do regarding any changes to funding and service delivery. In the area of foster care and adoptions categorical aid growth, the department continues to see impacts on the local share of costs from growth in categorical aid programs. These include foster care and adoptions assistance, for which the mandated aid amount per child is increasing at rates that exceed growth in revenues. From June of 2024 to June of 2025, we projected that the amount of aid per child in foster care would grow by 10% and for adoptions by 14%. In the area of IHSS MOE, the county's MOU with the IHSS providers ends at the end of June, and negotiations will begin shortly. Any wage increase negotiated will increase the county's maintenance of effort beyond the required 4%. AB 283, if enacted, would move IHSS negotiations from the county to the state effective January 1st, 2026, with a funding framework that is yet to be decided. That's something that we're keeping our eye on, but I'm not really too worried about happening in that timeline, because the report to the legislature that was due that was mandated legislatively 2 years ago that was supposed to be to the legislature January 1st of this year, did not get to them until like last week. So it's something to watch and it's something to be concerned about because as we all remember, those of us that were dealing with HSS 4 or 5 years ago, the state totally changed the sharing mechanism at that time, and a lot of negotiation, and CSAC had to be involved and others had to be involved to get it back to where it's at now, which was much better for the counties than what the state was trying to do. So it's certainly an area that we're going to be keeping our eye on. And then growth in county charges. Over the past 5 years, county charges have increased by an average of $1.2 million annually. Of this, IT services was the largest contributor, growing by an average of $416,000 year over year. During this period, the department saw county charges increases ranging from 7.5% for workers' compensation to 28.1% for liability insurance. And on the state front, so when the governor put out his budget in January, he cautioned everybody at the time that the May revise could look drastically different. That was prior to the fires in Los Angeles, and it was prior to him realizing that they're at the state level overspending their Medi-Cal budget by about 100%, as we've seen in the past several weeks with the legislature pumping more money into that so that doctors and hospitals can be paid. So it's anybody's guess what's going to happen to us in the May revise. And then lastly, I just want to say, as I said before, it's our hope and expectation that we'll be returning to your board in September or October to do an in-depth look at how all of these changes at the federal level and potentially changes at the state level and have impacted us, as well as to take a deeper dive looking at our revenues and our costs as a structural budget issue. On this slide, we have some of our performance measures listed. I won't go through them one by one. I will point out that on the very last one for WIOA, the correction on that slide for the budget year of anticipated, our anticipated target was incorrectly put at 72% when it's actually 77.3%. Funding reductions. This chart and the next reflect the funding reductions we have made for the budget year. The unfunding of 7 staff in child welfare services and the unfunding of a public health nurse, which is also in child welfare and not adult protective services as indicated on the slide, is due to insufficient growth in 1991 and 2011 realignment revenues. Additionally, the increased local share of costs for mandated cash assistance payments, as previously discussed, has shifted our realignment revenues and general fund contribution away from staffing to make those mandated payments. Under CalFresh and Medi-Cal, the chart reflects a net reduction of 29 positions in the budget area that includes CalFresh and Medi-Cal, and this includes the net 29 includes 35 position reduction in those program areas, and then the addition of 6 people in the Farm Worker Resource Center program based upon a grant that we received last year that your board accepted to support farm workers in growing their skills for their careers. And the funding problems in CalFresh and Medi-Cal are similar to what I described related to child welfare services in terms of revenue decreases or remaining flat. In the staff support area, the reduction is due to the reasons described previously related to child welfare services related to realignment. On this slide, in our areas of IT, facilities, and staff development, we have eliminated all planned IT purchases, eliminated all facilities improvement projects and deferred maintenance, and eliminated the use of any external trainers. These reductions were made to preserve as many staff positions as possible. The department has avoided implementing any further service level reductions due to the additional general fund contribution totaling $1.6 million for the in-home supportive service program and one-time funding from general county programs totaling $3.4 million recommended by the CEO. The additional ongoing general fund contribution for IHSS will help offset the cost of the county's maintenance of effort which, as previously mentioned, will increase next fiscal year due to the applied annual inflation factor of 4%, as well as slower growth in 1991 realignment revenues. The one-time funding from general county programs enables the department to close its budget gap. And lastly, our quote, now that I'm doing quotes, because I never used to do quotes, but last year I did a quote, and this year I did a quote, so I really feel like I need a gold star. And this is a really good one. What do we live for if it is not to make life less difficult for each other? And this is from Mary Ann Evans, a 19th century poet and author who wrote under the pen name of George Eliot. And with that, I am finished and would be happy to take questions.
Thank you, Dr. Nielsen. I'm sure there's questions. Yeah? Yeah?
Sure.
Supervisor Nelson.
Yes, thank you. So there's going to be the backfill of ongoing general fund of the 1.6, along with the one-time 3.4. Is that what we're doing here? So is it a $5 million general fund contribution for fiscal year 25-26?
Supervisor Nelson, through the chair, you could characterize it that way as 5 million. The 3.4 is one time, but yes, the 1.6, which is ongoing to cover the annual increases that happen in the IHSS MOE, plus that 3.4 million one time, that's a $5 million to cover their gaps.
Okay. And speaking of the IHSS, do we ever consider filing any test claims with the state on when unfunded mandates, when they increase services and send us the bill? I know that there are mechanisms at the state to do that. Some counties have done that and filed test claims in the past. That's something that we're considering at all in our county?
I can't answer that question, Supervisor, but I can tell you I have not heard of that happening from any of my colleagues around the state.
I know CSAC and RCRC are starting to push back on filing test claims for counties who don't have the infrastructure to be able to do that themselves.
Supervisor, through the chair, we are looking at test claims with CSAC, RCC. It's a topic of conversation. One of our staff has gone to a couple of the webinars or meetings they've had. We haven't been talking about the IHSS MOE, but we can certainly ask if that's been brought up.
Yeah, I know how it works, right? Everything rolls downhill. And
I would interject, Supervisor Nelson, through the chair, that over the past several years, there's been constant discussion amongst my peers about the awareness that this is not a sustainable program for the state or for the counties. And it's, over the past 10 or 15 years that I've been watching it, it's been batted back and forth a little bit in terms of share here and share there. But I think there's a recognition that with the ongoing growth of the program, that it's just truly not sustainable in either environment.
Yeah, I agree. And, we have such limited general fund dollars, for the missions that we have to accomplish with those general funds that are specific to that. And, these other departments, while important and critical, that's not what general fund dollars are typically supposed to go towards. And so trying to balance that out, and when the state continues to send us bills that we just have to pay, I would like to see us start to push back on them in those places where we have legal mandates or illegal pathways to do that. So that's why I wanted to just daylight that for a moment. So can I assume that our reserves are down to zero in social services? Is that where we're at, that we're needing general fund backfill?
Yes, correct.
Okay.
We will have AJ would have to fill me in to recall. We do have some money that we're carrying forward into the next year as part of our overall budget that still requires the $3.4 million to keep us status quo. AJ, do you have that number?
Supervisor Nelson, through the chair, we are budgeting to use our $1.2 million from our reserves, which will leave us with a reserve balance of about $300,000, which is from our trust fund.
Okay, thank you. Just was curious, and that's what we might be seeing in other departments as they start to spend down their reserves as well, that we're seeing in other departments that are bringing that to our attention. So, already have one department that we're having to address that with. So, I think it's an overall alert for us. We just heard from County Health. I think I said that right. And their their reserves are starting to spin down, and we need to get these things more sustainable moving forward so that we're not diving into general fund either one time or ongoing. My last one was the Farm Worker Resource Center, which is near and dear to my heart, and I know that we have this other grant. And when that was brought to the county, my understanding was to sustain the Farm Worker Resource Center and that program and what we built upon. And my understanding is that what we're doing, or are we doing a separate program now? Is that a different pathway?
Supervisor Nelson, I'm not quite sure I understand your question, but I'll attempt to answer it. So the most recent grant we got for Farm Worker Resource Center, which was like $1.9 million for the current year, federal year, which we hope to be able to renew for, I believe, 3 additional years in that same amount, was specifically targeted on working with farm workers for skill development for them and for their children. Part of that would be collaborating with growers to identify what sorts of skill development that would be useful so that those farm workers could grow in their careers. Part of it would be for children so that they have better opportunities heading out.
Right.
And so the reality of the Farm Worker Resource Center is we got the original grant, which lasted for about 15 or 16 months. It went away, but before it went away, Luis and his team got additional grants. And so that's kind of the life cycle of that program is they're constantly, there's little changes in maybe focus area within the farm worker population based upon what the grant requires, but it's all still about enhancing the well-being and the livelihoods of the farm workers.
Understood, but we have the team that you have now that's built a lot of trust in the community and has had a lot of success. So it's under that umbrella that this new program will be in existence?
Well, actually, we hired new staff, the 6 additional staff that I referenced, that we hired specifically for that grant. And so they're all working together in treating the families and the farm workers holistically, but the specific focus of this grant required additional staff with the skill set to be able to do that.
And that's what I understand, and just under the umbrella of the current Farm Worker Resource Center program, and I always say it wrong, Proyecto Campesino. I think I got that right.
Yes.
But it's under that umbrella that this program will now fit.
Absolutely.
Okay.
Absolutely, and all of which still continues to reside under the Workforce Development Board umbrella.
Sure, I just want to make sure, because I guess there's been a lot of work that's been done there already, and there's a lot of value there, and I want to make sure that's not lost or go too far afield in an effort of chasing down other grants. So, I know that's really important. I want to make sure that we're staying on top of that, and so, all right, thank you. Sure.
Supervisor Labanino.
Thank you, Madam Chair. So on AB 283, so is that, it hasn't been approved yet, or
So
the whole idea, or is it just kind of in concept, or where are we on that?
Yeah, where it's at is the report that went to the state finally last week, 4 months late, to say, and it wasn't a recommendation report, it was here's what you would have to deal with and factor into if you move forward with this. So, like who's gonna control how much wage increases can be, and the funding thing, who's gonna pay what share, and if the state's deciding, then what's the county burden gonna be, and are there gonna be different pay scales based upon region or area, that sort of stuff.
So there's a lot of work to do.
Right, yeah,
Okay.
so that's why I don't think anything will happen. And about 3 years ago, there was a major push in this direction as well. And I recall it because it seems to coincide with when we're getting ready to head back into bargaining.
Right.
That this is happening at the state level, everybody's waiting to see, is that gonna happen or not? I'm very, very confident that it's not gonna happen anytime in the next year or two, but we have to keep an eye on it.
Okay. And our contract ends in June?
Yes.
Okay. So we're close to getting back into negotiations.
We will, yes, the union has requested to start negotiations, and so we'll be starting that in the coming weeks.
Okay. Sounds good. So let's talk about backfilling. So first off, we talk about spending down reserves, and I want the public to understand something too, is that, it is alarming that we're going into our reserves, but I also want to stress the positive of it, that we have built up reserves. And these are why these exist, is because state and federal funding are not flat. There's good years, there's bad years. And so, I think you guys have done an excellent job of especially this year, of being proactive. And instead of just coming in and asking for the whole enchilada, it's like, hey, here's all the things and steps I've taken so far to get to this point, and I still have a gap. I appreciate that. And so, I think I was probably the loudest, adamantly opposed, do not take general fund money and backfill those departments that aren't general fund. But in this situation, just because of the lengths that you've gone to and I would just say the circumstances that surround us, I support this time, and I also appreciate the fact that you asked for it for 1 year. And CEO's office that I've been in conversation with is confident that we'll be able to fix this by next year moving forward. So, I can support that. And a lot of it has to do with the district I represent. They believe that social services is the county, so that's their point of contact, and that's their world. And I have to say that I don't know aspersions on any other department, but you are so super responsive to, and by the time people get to me in the community, they've exhausted everything they know how to do, and they're generally at a breaking point. And so for someone to be able to respond in 24 hours and just say, hey, sometimes you can't fix the problem, but at least that I know and the constituent understands that something's been addressed and we've done what we can do. And a lot of times in social services too, we don't actually get back the information because a lot of it's confidential, but just the fact that, hey, we've talked to this person, we're working it, they know we're working it. I just appreciate that. That takes a big load, because a lot of these social services issues are super complex. They're very personal. And, when I start getting involved in it, I get emotionally attached to that issue as well. And it's nice to be able to have somebody that responds to it right away and takes the care and the need and the contact. And I know you have a huge department with a lot going on and a lot of FTEs, but your response to my office has just been amazing, so I really appreciate that.
Thank you, Supervisor. And if I may just briefly respond back to you, Supervisor Lavanino, through the chair. Part of why I want to come back to the board in the fall, in September or October, to go over all the changes that we've been impacted by, is also to then look specifically at all of our funding sources and the realignment, because specifically on 1991 realignment, for example, the last time IHSS was rearranged and we were saddled with the 4% MOE, the state said, your growth and realignment will cover your increasing costs year after year. And it's not. It's simply not. And so when I come back in the fall, I want to be able to spend some time going through our different funding sources and educate the board in terms of, like, here's what the hope was when it happened, and
here's reality. Right. Yeah. Okay, great. Looking forward to it.
Any questions? I just wanted to thank you and your department, and I hope the morale stays up and during a really challenging time, because you really are on the front lines of talking to people, spending 45 minutes on the phone in English and Spanish, other languages, and I just hope that staff hang in there, 800 of you, to make sure that, these, as Supervisor Lavanino said, these services to many people, probably the most, this is the county, and this is their government, and this is a time that they hopefully continue to trust us. So I just want to appreciate all the work that you and your department do.
Thank you.
Thank you.
And I will convey that to my staff.
Okay, sounds good. We will take a short break, about 12 minutes, come back at 11:30. Thanks. Okay, welcome back. Thank you, Director Navarro. We'll start with your team.
All right,
Be well.
good morning, Chair Capps, Supervisors, CEO Miyasato, and County staff. I'm Tony Navarro, Director of Behavioral Wellness Department, known to all as Be Well. I'm joined here today in the front at the table by Be Well's Chief Financial Administrative Officer, Chris Ribeiro, Assistant Directors Dr. Katie Cohen, Jamie Hustling, and Laura Zeitz. And also joining us here today is Fiscal Manager Josue Sanchez, and our Public Information Officer and Chief of Strategy and Community Engagement, Suzanne Grimacy. And before I get started, I want to recognize and appreciate all of them so much for their work and contributions to this budget and the D pages. It is with much hope and necessary cautiousness that we present to you today Be Well's operational budget for 25-26. All right, next slide. Key tragedies within this decade, including the opioid and fentanyl crises, the COVID-19 pandemic, and the impact of California's affordable housing crisis on the mental health and well-being of persons and families across the state, have resulted in an unprecedented spotlight on California's county behavioral health system. In just the past 3 years, there have been 50 statewide initiatives that have required county behavioral health systems to modify, enhance, and more recently, completely transform our program practices and operations, including how we staff our departments, how and to whom we provide care, as well as how we are funded and able to leverage additional revenues. And just as we thought we had a handle on all of that, now the anticipation and planning for possible further changes to our revenue buckets from the federal level has also become part of our daily agendas. The budget we bring forth today represents a transition, and it reflects both a wrapping up of long-established ways of allocating funding and operating county behavioral health dollars, as well as a ramping up to ready our department for the new programs and funding priorities that go into effect July 2026 under Proposition 1, now known statewide as Behavioral Health Transformation. Consequently, as with any new venture and substantial business overhaul, the 25-26 budget projections are based on Be Well's and its network providers' historical performance and our hopeful assumptions for the future based on rigorous planning and change efforts that began this current fiscal year and will continue ongoing. The Behavioral Wellness Department consists of 5 functional groups that we refer to as branches. They collectively hold the vision and in collaboration effectively execute the department's mission. These are administration and support, mental health inpatient services, compliance and quality care management, mental health outpatient and community services, and alcohol and drug programs, which provides both residential and outpatient care services. 73% of the staff representing 3 branches, mental health inpatient, mental health outpatient and community care, and alcohol and drug programs, provide direct care to clients within our community and bill directly to Medi-Cal and leverage valuable funds under those treatment services. Not known to many, but also important to note, is that an additional 6% of the Be Well staff under the quality care management team provide also billable services. We are able to leverage Medi-Cal dollars through the compliance monitoring, oversight, and quality improvement activities of that team. All right. This year's capital projects are both technology projects, and they are vital for Be Well's operational efficiency and to ensure compliance with all required documentation, data tracking, and billing expectations under its contract with the Department of Healthcare Services and the CalAIM initiative, as well as behavioral health transformation. General program transfers for 25-26, although limited, provide added capacity for Be Well to provide valuable, expanded, and specialized support to persons at high risk for adverse mental health and or substance use conditions. The 25-26 operating budget is an 8.2% increase over current year. This growth is driven by a few different factors, including the increased need and utilization of acute and longer-term subacute treatment beds, the implementation of new initiatives and their consequent service requirements, and by the strategic preparation for behavioral health transformation. These additional costs result in a one-time fund use this coming year of $19.3 million for ongoing services. In order to address the growing demand for specialty behavioral health treatment services in our county, this next year, Be Well will add an additional 7 beds at the Crestwood Champion Healing Center, support additional increases in the cost of specialized care for an aging behavioral health population with complex medical needs that are placed in skilled nursing facilities, and expand service provider contracts across both the mental health and substance use disorder program areas. It is important to highlight that costs related also to unreimbursable services for the psychiatric inpatient care of children and youth in our county experiencing eating disorders has risen dramatically and is anticipated to add nearly $2 million in costs next year. In regard to the treatment beds and the specialized care under a skilled nursing facility, much of those funds are unable to be leveraged through Medi-Cal given their restrictions within the Medicaid contract. Therefore, those costs continue to increase, and Be Well is, with behavioral health infrastructure applications, looking to increase our continuum of care to minimize those impacts down the road and in future years. The growth in staffing costs for fiscal year 25-26 are mainly accounted for by mid-year staffing realignments this year. Following a review and assessment and overhaul of our crisis services system in Be Well to be more responsive and efficient and effective in care to our community, we finalized changes to that team in Q2, and we contracted out our overnight mobile crisis services, leaving us with a surplus of 7 staff to be allocated to vacant positions. They were ultimately placed on the access line team in order to address multiple years of external review audit findings that indicated that annually the numbers of persons accessing Be Well specialty mental health services is low relative to the number of counties' Medi-Cal recipients and the system's expected capacity for care. So we put those folks on the line beginning in December. We made some notable changes, and I want to report out to you already some notable outcomes and progress in that area. Since December 2024, there has been an average increase of 25% in the monthly call volume to the access line and an approximately 30% increase in mobile crisis support response to the community in the same time frame. Of particular note is our data that shows prior to the final changes in the crisis service system in December, the majority of all calls to mobile crisis, about 65%, resulted in hospitalization, which is, of course, our highest cost and least accessible service. That has now flipped, and in the first quarter of this calendar year, we now less than half of crisis encounters, which average about 180 a month in the first 3 months of this calendar year, or about 45% are ending up, only about 45% now are ending up needing that highest level of acute care. Instead, persons are being connected to lesser restrictive and more appropriate levels of the outpatient care system. Additional staffing requests noted this year here are necessary to successfully conduct next year's first expanded integrated community planning process under behavioral health transformation, as well as to ensure best standard operational efficiency and staff utilization at the PUF, as well as to expedite access to ongoing care within the Be Well outpatient mental health system once folks have called in for service and been given a referral. The anticipated accomplishments in the current fiscal year represent the broader array of administrative as well as programmatic changes happening in Be Well this year alone. Collectively, these accomplishments reflect Be Well's intention and progress towards creating a responsive, timely, accessible behavioral health system with a full continuum of care that meets and provides people access from a number of entry points to a number of programs addressing all of a person's issues in a way that is fiscally responsible in order to be sustainable. I want to share with you now a success story that demonstrates what is possible in such a system of care that provides timely, accessible, integrated care. Following years of substance use and struggling with mental health issues, and after a near-fatal overdose, an individual entered our system of care via a psychiatric hospitalization earlier this year. He was stepped down, once stabilized at the psych hospital, he was stepped down to a substance use disorder residential facility, and then found his footing solidly in recovery after moving into a recovery residence and becoming active in the local 12-step community. The individual also quickly started outpatient treatment for co-occurring, which is both substance use and mental health issues, and utilized the county's newly onboarded contingency management program to maintain his sobriety. He soon after found gainful employment, and within 7 months of that near-fatal overdose, was working full-time, solidly grounded in his recovery journey, was part of a positive social recovery community and living independently. And maybe most important, he is now engaged as a mentor to help others as he was helped. With timely access to the right level of care at the right time, and with consistent support of dedicated professionals addressing a person's whole life, not just their illness or their addiction, life-changing, life-sustaining recovery is possible, and in a relatively short time frame when there is adequate capacity across the care continuum. Be Well's departmental goals and objectives for 25-26 are focused squarely on setting a solid foundation for the department in order that we can best leverage the opportunities of payment reform, integrated care, new care initiatives, including mobile crisis benefit, the care court, Senate Bill 43, and also to focus, in Senate Bill 43, the focus on these goals will also increase the likelihood that Be Well is most prepared and will be able to transition relatively easily into behavioral health transformation in fiscal year 26-27. I want to highlight that Be Well's goals and objectives are in alignment with and fully support the operational performance priority recommendations. Specifically, the recommendations seek to improve care to those most in need of service, maximize the leverage of available funding, and focus on the successful implementation of CalAIM, as well as other program requirements upcoming in behavioral health transformation. And despite our clear roadmap of requirements and recommendations, there remain issues outside of our control that we will remain attentive to and vigilant about, and are outlined here in the fiscal issues to watch slide. And for those issues over which we do have influence and impact, Be Well will set clear protocols, provide effective leadership, and consistently exercise accountability to meet, always aiming to exceed, the assumptions and expectations outlined in this operating budget. The performance measures highlighted here reflect Be Well's focus on operational efficiency and regulatory compliance success, both of which are necessary for the department to realize fiscal stability and ongoing system sustainability as we move closer to the implementation of behavioral health transformation, which will totally upend our way of doing business for the past 20 years. Moreover, focusing on these performance measures and those themes hopefully increases the likelihood that next year we're going to use this same slide right here. 0 service level reductions for years ongoing. So as noted at the start of my presentation, the past 3 years have been characterized by unprecedented and seemingly continual change. 3 years is also exactly as long as I've been in my role here in Be Well. So needless to say, it has been the fastest and the longest 3 years of my career. And I'm pretty sure that there are department staff at all levels that feel the same. I want to be sure here to acknowledge and uplift the Be Well department staff. They are an incredibly dedicated, compassionate, smart, and creative group of professionals that has adjustment, modification, and change after adjustment, modification, change, proven their commitment to rising together to strive to be a behavioral health center of excellence for Santa Barbara County and its residents. In other words, and as staff often hear me say, Be Well rocks. In closing, I also want to recognize that the successful execution of this proposed budget, as well as the mission of Be Well in general, relies on the support and collaboration of a number of other departments in the county, including the CEO's office, all of our public safety partners, the Public Guardian's Office, General Services, County Health, Social Services, Community Services, ITD, Auditor Controller, County HR, County Council, and of course, you all, the board. On behalf of the entire department, I want to say to everyone, thank you in advance this next fiscal year for your grace and patience and understanding, as well as your support and collaboration as we maneuver in this most transformational time for the field of county behavioral health. With that in mind, and in resonance with the core philosophy of our field, which is the recovery model, in keeping with our budget theme of hope, and in commitment to transparency and accountability in everything we do, this is our quote for the upcoming year. Ask what is possible, not what is wrong. Keep asking.
Excellent. Thank you, Dr. Navarro. Questions from the board? Comments? Supervisor Hartman.
Well, I guess I'm asking what is possible or how things are working with our, with both the mobile crisis and co-response. And, you know, that's one of our first points of contact. And if that happens well, then, as you say, we may not need people in longer-term care of various kinds. So could you talk about that? And as you know, I'm a keen, have a keen interest in how the work that you've done with the fire department and where that stands.
Okay, yes. So thank you, Supervisor Hartman. I'm glad to be speaking on this topic. As noted in my presentation, the recent statistics, the data for this first quarter of the calendar year on mobile crisis demonstrate that we are up an average of 30% calls and response to the community in mobile crisis. So we began a media push, both on our social media and with other media outlets in the county, including a weekly ad in the Independent that highlights the mobile crisis, the access line for people in need of support or referral to service. And as a result, we are seeing increased calls, and we are seeing staff responding in the community, in the field, and a significant reduction in people getting hospitalized. So that's been excellent.
And Director Navarro, forgive me for interrupting, but so mobile crisis is when there's not a law enforcement issue, and
right. Yes, so the mobile crisis benefit is the team that responds per the direction of the state and mandated by the state of California, that we have a team that is comprised of just mental health professionals. It may include an emergency medical team professional under a fire department, but it may not include law enforcement, because this is really meant to make sure that the system provides a full continuum of response for persons at the level that they need it. So we do have co-response teams within our county, and we are partners with those in 5 teams across the county from Santa Maria to Santa Barbara, with the Sheriff's Department as well as Santa Maria PD and Santa Barbara PD. Unfortunately, as behavioral health transformation looms in July of 2026, and as the state has adopted and identified that the way that counties are to do crisis response is through the mobile crisis benefit, we are looking at eliminating those positions for our clinicians in the co-response. There are some opportunities in the next year and years ongoing as we continue to learn how to leverage and maximize the performance in payment reform, that we may have additional dollars to support co-response. But at this time, we have talked to our partners, and everyone is understanding of the major cuts to services that are coming our way, anticipated in July of 2026. So for as of now, we have stated that those partnerships will stop, but we continue to look for ways to work with our law enforcement partners and support their continuation of co-response alongside us. I also want to clarify that anytime mobile crisis response gets out to a call and there is any indication that there is danger or risk, law enforcement is called and able to be at the scene, of course. And I think that we are seeing that, in general, the dispatch on both sides is getting much better at identifying when we need those higher cost and higher safety responses versus not.
And fire department working with BUL on mobile crisis or co-response, can you elaborate on that?
I'm sorry, regarding how we're working together?
Yes, yes. You looked at a model in Slow City.
Yes, we worked at a model. Oh, yes, with the fire. I'm sorry. Yes, we looked at a model in Slow City, and starting about a year and a half ago, we went up and visited with the chief Hartwig and his team, and over the last year have provided some training and preparation for a co-response model, pilot, if you will, with fire. There are a couple of other jurisdictions in the state of California that have exercised this. And it's based also on the county fires data that roughly, I think it's close to 1 in 3, 1 in 4 calls that they get really is somebody who's experienced a mental health crisis and would benefit from immediate access to a mental health care professional to bring them into the system. So we are intending and are committed to getting that pilot off the ground and are looking for some possible grant opportunities to be able to leverage that. That is a sustainable project, because EMTs on the team still allow you to bill for the full Medi-Cal bundle of mobile crisis response. Unfortunately, having law enforcement regularly involved in mobile crisis calls without specific and clear distinction as to why they're there versus not does not allow you to bill the Medi-Cal mobile crisis bundle, and you have to bill out services on the BUL side at a much, much reduced rate. That is not sustainable for a program like that.
Which is why I think that that's a pilot that's really worth trying to move forward.
Yes. Chief and I met last week, and our teams are meeting again next week to talk more about opportunities.
Could you expand a little bit how much the CARE Act, how much we're utilizing the black robe effect and how that is actually working on the ground?
All right. Well, speaking of working on the ground and having that data much more clearly at the top of her head than I did, I'm gonna throw it to Dr. Katie Cohen, our Assistant Director who oversees the CARE Act implementation and staff.
Thank you, Supervisor Hartman. Oh, it works. So we have hit the ground running with our CARE Act starting implementation December 1st. It was a little different than anticipated as far as the individuals that we were initially serving. As other counties ahead of us had rolled out, it was a higher number coming from the community as far as referrals. In our county, a lot of our initial referrals have come from our public guardian. And so those are individuals stepping down from conservatorship. I think at this point, we are under 15 referrals so far total, but happy to report we have strengthened our collaboration with all of our partners. We meeting monthly to talk through the individual cases. We're really trying to address the needs individually for each of those coming through Care Court to make sure that we're thinking about the range of needs that each individual is presenting with and addressing them as creatively as we can. So I think it's been a successful start, and yeah, look forward to continuing to collaborate with our partners and meeting those needs.
Thank you.
I just wanted to also say that the Be Well team will be back in front of you along with the Public Guardian's Office on June 10th to give an update to a CARE Act with more specific data to demonstrate for you, as well as to come back with an update and ask for a resolution on Senate Bill 43.
Thank you.
Okay, other questions? Supervisor Lavagna.
Not a question, just a observation. I always like to go back to the first budget I worked on here in 2011 and see what the differences are. Come on, Boomer. I'll wear that one proudly when I'm retired and you're still working here. So just in this department, the operating budget was 69 million, now it's 222. And we had 268 full-time equivalents, and now we have 480. So just let the public know that for all the folks that come here and talk about Be Well and the importance of this department, it wasn't lost on this board. People, this board, boards before us, we've invested in this department heavily. We know it's, we are, we're the last resort for a lot of people that are, suffering. And so I just want to put a little perspective on this isn't being ignored. This has been a huge investment for Santa Barbara County, and having you at the helm too, with kind of doing both things of being the clinician and also being a person with a heart helps as well. So also got to go out to one of the events, when you talked about public health fair or county health fair, you also, got your whole staff together. I was happy to go participate in a little bit of that, and it's just cool to see the culture you're developing in the department.
Thank you.
Okay, Supervisor Hartman.
Yeah, I had one more point that I wanted to raise, and that is that we have cannabis education occurring both in public health and in Be Well, and I would have an interest in seeing if we could consolidate that. I think that in tough times, if we can get benefits through consolidation, I think that might be worthwhile. So I'd like to explore that.
And Supervisor Hartman asked my questions about co-response, so thanks for your answer there. And I'm good. I think we're good to move on. Thanks to the team.
All right, thank you.
Okay, child support services. And for any members of the public, we'll take public comment after the end of this functional group. Okay, Director Richardson.
Good morning, Chair Capps and members of the board. I am Meta Richardson, Director of the Department of Child Support Services. With me today is our Managing Attorney, Justin Arnold, our Assistant Director, Tiffany Rocha, and our Child Support Managers, Maria Aguila, who's clicking the slides, and Jennifer Diaz. We are pleased to be here today to present to you our fiscal year 25-26 requested budget. I'd like to start with a brief budget overview. We have one source of funding, which is our state funding allocation. Our budget includes a $379,000 reduction in our funding allocation in comparison to our adopted 24-25 budget. This amount is subject to change pending the outcome of the state budget process. To cover the budgeted funding reduction, as well as increased salary and benefits costs, 5.2 vacant positions were eliminated. At this time, there are no known impacts to our funding from the new federal administration. Our fiscal year 25-26 operating budget is $10.8 million, which funds 68.8 FTEs with no general fund contribution and no service level reductions. Our services include assisting parents with opening child support cases, establishing parentage, developing fair orders for financial support and medical care, and enforcing those orders. Our program is highly mandated and complex. Our 36 child support caseworkers manage a total caseload of almost 9,500 cases, which averages to 263 cases per caseworker. Average collections per caseworker last year were $792,000. Over the same period of time, our 3 dedicated attorneys appeared in court over 1,500 times. One of our recent innovations is Parenting Court, which is a collaboration between our department, the court, and several county departments and agencies. Parenting Court, which is intended to reduce or eliminate barriers to payment of child support, was spearheaded by our managing attorney, Justin Arnold, who would like to take a few minutes to speak to its success since its implementation in July 23.
Just raise that a little. Thank you, Meta. Parenting Court's a partnership with DCSS, the court, the Public Defender's Office, the Workforce Development Board, and the Family Service Agency. The participants in Parenting Court are individuals in our county who have gone many months without paying child support and have been charged with contempt of court. In consultation with their appointed public defender, they've decided to address their barriers to paying support with help of the partner agencies. There's a quote from Abraham Maslow that I think about a lot as we operate Parenting Court, and that's, "What is necessary to change a person is to change his awareness of himself." When a participant joins Parenting Court, they could be homeless, they could be jobless, they may not be seeing their children at all. What we do in our monthly Parenting Court sessions in Lompoc is to help participants see their own potential. They can find stable housing, they can get a job, they can learn parenting skills, and they can learn to navigate the family court system. They can financially support their children through regular child support payments. They learn to change their awareness of their capabilities because they do the work. They show up at dedicated dad sessions run by the Family Service Agency and learn how to communicate and co-parent. They get job training and subsidized employment through workforce development, which puts money in their pocket, experience on their resume, and provides child support to their kids. They can file a motion to obtain visitation with the help of the family law facilitator through the court. When they do the work, a kind court commissioner in a black robe sitting high up on the bench congratulates and encourages them on their success. I've been an attorney for 17 years, and I've been in a lot of courts. I've seen a lot of life-altering decisions. I've seen justice being done. I've seen heartbreak and pain. But what I haven't seen before Parenting Court is a room full of dedicated professionals from a variety of disciplines trying to help one individual succeed. That's where the magic happens. A participant can bring up a problem, and we can bounce it around the room until we can find the person who has the right answer. And then when that happens, you can see the participant's whole facial expression change. Instead of feeling like they're the one on trial, they can relax a little bit, talk a little bit more about what's going on, and accept the help that's being offered. Parenting Court's still relatively new. We've had some successful graduates and many people who are currently working the programs, quietly building up successes. They're getting better jobs, they're getting their orders modified, they're getting criminal records expunged with the help of the Public Defender's Office. They're paying their support, they're seeing the potential in themselves, and they're moving towards it. So I appreciate this ability to talk about Parenting Court. I'll turn it back over to Meta.
Thank you, Justin, for that great information and for your work in implementing Parenting Court. Our budget includes 68.8 FTEs, and 88% of our funding is used for salaries and benefits. Notably, the average tenure in our department is almost 17 years. We are very fortunate to have high employee retention and to be staffed by highly experienced and dedicated professionals. This chart shows the small reduction in funding that I referred to earlier. Anticipated accomplishments. Our accomplishments include collecting and distributing $28.5 million in child support. We've also implemented sweeping federal and state legislative changes, including SB 343, which incorporates an updated child support order calculator into our practices that is intended to ensure that orders are reflective of a parent's ability to pay. and SB 1055, which was effective on January 1st and which removed driver's license suspension for all but a few participants who meet a certain income threshold. We're proud to have exceeded the statewide average in all federal performance measures, which you'll see in an upcoming slide, and we now rank 14 in overall performance out of 47 counties. Some of our goals for the upcoming year include implementing the second phase of the legal and procedural changes I referred to earlier. The second phase will go into effect in January 26 and will result in the inclusion of 14 additional factors in the calculation of initial child support orders, including such factors as a participant's job skills and their barriers to employment, all with the goal of more closely linking the amount of support payments to the parent's ability to pay. We're becoming more sophisticated, both as a department and as a state program, in the use of data analytics and algorithms to ensure that we're making the most efficient use of our resources, particularly child support officer time, to improve performance and outcomes, and we look forward to further strides in these areas in the upcoming fiscal year. And lastly, we'll be implementing our newly developed marketing and outreach plan, both to increase caseload and engage further with existing customers. Next, I'll briefly discuss our progress in responding to the recommendations from the KPMG Operational Performance Review. We are continuously exploring data sharing opportunities with other county departments. In furtherance of this effort, we are a member of the county's data sharing committee, and we are also meeting with other county child support agencies to brainstorm best data sharing practices in light of the child support program's strict security framework. Progress made in this area include the drafting of an MOU with the probation department, whereby we will work together to ensure that parolees with child support orders are provided with specialized outreach. We are also collaborating with the courts to strengthen the whole person approach to care through the previously highlighted parenting court. We have identified opportunities for targeted intervention related to child support arrears, which are past due child support balances, including a specialized arrears team and the implementation of a state algorithm in the upcoming year to ensure that caseworkers are focused on past due amounts that are deemed to be most collectible. We are targeting marketing and outreach activities to individuals in need of child support services using U.S. Census Bureau data, newly developed marketing materials, and collaborations and warm handoffs with key partners. Fiscal areas to watch. We have fiscal issues that we are keeping an eye on. These issues are not specific to our county, but rather are statewide. Similar to other county departments, we're experiencing salary and benefits increases, but historically, our funding has not increased to the degree necessary to fund those increases. Another issue is a declining statewide caseload for reasons that are not entirely understood. We are making every effort, both as a county department and as a state program, to ensure that community residents are knowledgeable about the services we provide and that they know how to access them. And finally, federal funding is at risk if the program's cost effectiveness ratio, which is collections divided by costs, falls below $2. The statewide cost effectiveness ratio has been declining and is currently $2.28. So that means that costs are increasing faster than collections. Efforts to increase collections are being undertaken throughout the state to counteract this decline to help ensure the state as a whole stays above the $2 threshold. Performance measures. The department continues to perform well in all federal measures of performance, and to exceed the statewide average in all measures. The slight decrease in distributed collections last year was primarily due to the closure of 550 foster care cases pursuant to AB 1686. As I've mentioned throughout the presentation, the department is continuously pursuing strategies and initiatives that will help to increase its outreach and impact to the community as well as its performance. We have no service level reductions. I'd like to conclude our presentation with a quote, "On the other side of a storm is the strength that comes from having navigated through it. Raise your sail and begin." And the quote is by Gregory S. Williams, who is an author. Thank you.
Thank you, Director Richardson. Any questions or comments from the board? Supervisor Hartman.
I have a couple. What are the theories for the declining caseload?
The theories, there are theories that relate to just different generational views of child support, that they, people don't want government involved in something so personal as their children, their finances, and that type of thing. So I think the main thought process is that it does have to do with just what the views of the program are, and whether or not people want to be part of a government program that is voluntary.
And who came up with the idea for parenting court?
Justin Arnold.
So that really was initiated here. I imagine, I would think that's a CSAC award. So many parents who don't pay for their children start pulling away emotionally and feel badly themselves, and then they regret on their deathbed that this is their big regret in life. And the children, suffer emotionally because they pulled back. So this is just an extraordinary program. I have the opportunity to talk to halftime highlights when people have been here for 6 months, and I tell them that government used to be kind of stayed, and now things change so much that we have to innovate. That really is where people who want to be creative now seek jobs, and you're the quintessential example of it. I just think that's extraordinary.
Well, thank you, Supervisor. I appreciate that. But to me, it's just so much, through the process, getting to interact with so many great people through the courts, the public defender's office, throughout the county, and just realizing just how many great resources are here, and just trying to tie them up together, put them in one place for the participants. It's been the honor of my professional career to get to work with the great people here to do it, and so many have been involved in it.
Wow.
And Supervisor Hartman, through the chair, if I may add, we kind of see that as our job is to incubate ideas, not to do things the same way, but to change things. So and this is a phenomenal example of that. But it takes the support, and then it takes the person to have the idea, and it was an effort to get it started. Justin worked so hard in getting this started. So yeah.
Okay, well, thank you to our whole team of Child Support Services. Really appreciate it. We appreciate the report. That ends our dysfunctional group, and Madam Clerk, I'll turn it to you for public comment.
Chair Capps and members of the board, we have 10 requests to speak from the public on this item. We are going to begin on Zoom with Michael Bird, to be followed by Jean Silva. Michael?
Can you hear me?
Yes, we can. Please proceed.
Good morning, members of the Board of Supervisors. My name is Michael Bird. I am a retired combat veteran and former military dog trainer, as well as a current rescuer. Although I was raised in Santa Barbara, I currently live in Kern County, but I'm making this public comment this morning because I have dealt with Santa Barbara County Animal Services a great deal over the past few years. And I want to express my strong support for this program for getting additional resources. I have taken a number of behavioral challenge dogs from Animal Services, starting with a fear-aggressive young cattle dog with a deadline to get out of the shelter because she was doing so poorly there. Sarah Aguilar drove that dog to me 3.5 hours each way to ensure that that dog had options. Since then, her staff have coordinated all necessary resources to send me several other dogs that were behaviorally challenged and unsafe in the shelter environment. They knew that I had the skill set to handle them, work with them, and find them good outcomes. One example is a Belgian Malinois named Sabi, who a dedicated animal service volunteer drove out to me. If you do not know the breed, they are popular with law enforcement and military because of their dedication and drive. They are also very athletic and can jump 13-foot fences. So some of them are not suited for normal family life. Sabi was a classic case of this. That dog is now a police dog in Alabama, serving its community. So that dog was not only saved by Santa Barbara Animal Services, but is now serving and saving people in its community. The credit has to go to Animal Services for reaching out to people like me who do everything they can to find good outcomes for so many animals as possible. I have worked at shelters throughout Kern County, and I can tell you what an amazing work Santa Barbara County Animal Services is doing on the shoestring budget they have. I am a creative problem solver, and that's what I see in your Animal Services Director. I also know that you can only solve so many problems when you don't have the money to implement creative solutions. In these tough budget times, I would expect you to find much more money for this. I wouldn't expect you to find much more money for this program. But selling dog license is a guaranteed revenue generator if you can reach people. Your county, like mine, has far too many people who have not licensed their dogs, and that's a source of income that can make a big difference with animal services problems. I hope you can find the money to restart licensing outreach to bring that money in.
Thank you,
I am
Michael. That
very
is your
grateful.
time.
Thank you.
We will now go to Jean Silva to be followed by Margaret Bernal. Jean?
Thank you, Chair Capps and board members. I would like to talk about revenue and cost containment in animal services. Our earlier speaker noted that revenue means dog licenses. Based on the American Veterinary Medical Association estimate of dogs per household, the revenue potential for dog licenses in our county is over $2 million, somewhere with our existing fees between $2.2 and $2.5 million. In 2018 and in 2019, in your packet, you will see that we were receiving between $986,000 and $982,000 in revenue. By 2024, that had decreased to $5,075,000. We can do much better. And Project Pet Safe was one model for how you approach that. They went out into the community, the staff, and worked with, they knocked on doors of people who owned dogs and hadn't licensed them. They went to affordable vet clinics. They went to affordable spay-neuter clinics. They made licensing available as easily as possible, and they also conducted community education. And by doing that, they improved the services that we were offering as well. First of all, because a licensed dog or a microchipped pet returns home much more quickly when it is lost or comes into the shelter, we were able to reduce the number of shelter days that those animals had to spend in our shelter. And in addition, during fire season, those pets who were displaced by fire also had a better chance of returning to their home. They helped keep pets in their own homes. Often people relinquish their pets because they can't afford to feed them. And they also reduced the number of unwanted pets because of a spay-neuter program. They did that by working with community partners. And this is the kind of thing that Dr. Hamami was talking about in terms of going out into the community in different venues and reaching out and making our services known and more available. So I'd like to thank your board and hope that, that you can find another $250,000, which is my back of the envelope estimate for what this program, if we did Project Pet Safe, might cost today. But I would defer to Sarah Aguilar as well as Dr. Hamami in terms of what costs they thought might be needed. Thank you.
We will now go to Margaret Burnell to be followed by Molly Troop. Margaret?
Chair Caps and Supervisors, my name is Margaret Bernal. When my son Greg experienced his first psychotic break, he was living in San Francisco at the time and was diagnosed with bipolar disorder and schizophrenia. When help was needed, plainclothes responders arrived along with police officers. I later learned they were part of a specially trained team focused on de-escalation. They were able to calmly convince my son to go to the hospital where he was placed on a 5150 hold. Not long after his release, I brought him home to Carpinteria. One day, he made a call to the sheriff's office. The responding deputy listened patiently to his paranoid and confused thoughts, never reacting with fear or force. He also took the time to ensure I felt safe and supported. The crisis intervention teams and co-response in Santa Barbara County play a vital role in how individuals with mental illness are treated. The difference in outcomes when one of these trained teams is present is profound. They don't just de-escalate tense situations, they also open the door to treatment and long-term support. Having these professionals as the calm, compassionate voice of reason gives families like mine something we all desperately need: hope. Thank you very much for listening.
We will now go to Molly Troop to be followed by Philip Seymour. Molly?
Good afternoon, Chair Caps and Supervisors. My name is Molly Troop, and I have recently engaged with the Santa Barbara County Animal Shelter as a foster for a dog in need. Additionally, over the last few months, I've learned about the shelter crisis that we are facing here in California. Overall, more animals are entering the shelter than leaving them. There are many reasons for this, including overpopulation, and inequity, housing insecurity, and lack of community education. Thus, I'm here today to urge you to provide a one-time funding allocation to restart Project Pet Safe, which is a very beneficial licensed canvassing program that will help address overpopulation and community education needs. Through canvassing, the program provides a means to educate the community and support people in getting spay and neuter services, which is critical for reducing pet overpopulation and shelter impacts. Importantly, though, this program generates revenue by reaching more than 75% of households that don't license their dogs. Our county shelter provides critically important services for our community and is vastly underfunded. A funding bump for Project Pet Safe would go a long way in helping Santa Barbara County Animal Services continue its great work of caring for the people and animals of our community. I call on you to support our animal shelter to the fullest extent possible. Thank you for the opportunity to speak on this important item today.
We will now go to Philip Seymour, then we will return here in Santa Barbara with Lynn Gibbs. Philip?
Hello, Chairman Capps and Honorable Supervisors. I have been a volunteer along with my wife at the County Animal Shelter in Goleta for 33 years. And during that time, we've seen a lot of positive changes, and there are also some things that just don't seem to change. Right now, things are about as good as they've ever been at the County Animal Shelter System. We love our current director, Sarah Aguilar, and we really appreciate the support for the animal services programs from Dr. Hamami. But one thing that hasn't changed in 30 years is the shelters are understaffed. We absolutely need more line staff. And part of the problem is that the expectations on line staff have increased dramatically over the years as we've improved the quality of life for the animals in the shelter, and also included the interactions with the public and the level of public service. The problem with being understaffed is that on a bad day, a busy day, if one staff member is on vacation or calls in sick, the workload for the remaining staff becomes almost impossible to sustain. That in turn creates stress, which in turn causes more staff people to either call in sick or just bow out and quit, and which in turn compounds the problem. Now, part of the problem is that the understaffing is volunteers. We have an outstanding example of that at the county animal shelter in Goleta, where 2/3 of the animals are actually taken care of entirely by volunteer, self-sustained volunteer groups. That's the cats and the rabbits and guinea pigs. But that model does not work for dogs, and it has not been sustainable in North County. So it comes back to what can the volunteers do? Volunteers are a force multiplier, but they cannot be effective if they don't have a corollary level of staff support, staff training, and staff monitoring. So that's what we need. I hope that in the short run or in the long run, you'll find the funds to increase our staff levels, either by increasing county line staff or by increasing a volunteer support personnel. Thank you.
We will now return to Santa Barbara with Lynn Gibbs, to be followed by Dr. Lee Heller. Lynn?
Good afternoon, Chair Capps and Supervisors. I serve as Public Policy Chair for NAMI Santa Barbara County and as an advisor to Families Act. We appreciate your support for mental health. And I also appreciated Director Navarro's presentation today and her emphasis on the need for a full continuum of care. She said in quotes that we need to improve the flow between levels of care by increasing residential capacity. Director Navarro shared with us that has applied or will be applying for a range of inpatient, subacute, crisis residential, and sobering center beds under the Prop 1 multi-billion-dollar state initiative for mental health infrastructure, which is lacking across the state. But we'll need funding to operate them once we secure the grants and then are able to build the beds. So we'll need to begin planning for that. Our continuum of care is fractured. Not only do we see our most ill community members stuck in the jail and in the PUF for lack of secured step-down beds. Yesterday I learned that in March, the Cottage Hospital was only able to make 6 transfers to the newly relicensed crisis stabilization unit. These are people on 5150s who are staged at Cottage. The CSU is meant to be a point of triage from which persons in crisis can either be stabilized or sent home, and many of them are stabilized and sent home. But then those who need a higher level of care need to move to those beds, which we usually don't have. And so the CSU is rejecting transfers of patients they deem too acute, and even sending some of them back to the ER that they've received because they're too acute. Well, what does that mean? The CSU is an LPS facility. Where are these people supposed to go? Too many of them then either see their holds expire or are sent home with cobbled together safety plans. And so then too many wind up in the jail for lack of the treatment they need. Some counties, Alameda and Tulare are examples, have settlement agreements with the jails that require community-based treatment, and I wonder why ours doesn't. The DRC has recognized this need to keep people out of the jail. Some counties, such as LA and Sacramento, are working hard to avoid jail rebuilds and expansions.
Thank you, Lynn. That is your time.
Thank you. Mike, in conclusion, we won't incarcerate our way out of this crisis. We need to go to the source of the problem. Thank you.
We will now go to Dr. Lee Heller to be followed by Victoria Feld. Lee?
I was going to say good morning, Chair and Board, but it's afternoon now. I would like to begin by thanking Dr. Hamami and all of the hardworking staff at County Health for continuing to push their boulder uphill, especially at this very challenging moment for public health. And I want to thank all of the department heads and their staff for serving all of us. You know that I know the fiscal challenges that we are facing. And you know that I know how many important community needs have to be served with a limited budget. That's why I'm not here asking for a budget expansion for animal services, but like something out of Groundhog Day, I am here yet again to ask for a one-time allocation of funds to restart the dog license canvassing program that was an essential component of Project Pet Safe. Other speakers have covered the details, so I'm not going to go into it because you guys want to have lunch and go to closed session. But it is a revenue generator. Licensing canvassing brings animals into the system through DocuPet. Then we can reach them. Then we can get them spayed and neutered. Then we can reduce the service demands on the program. We are really lucky here with the leadership in this program. Director Aguilar is leveraging every resource that she can. One example is a vigorous rescue, transfer, and foster placement program that reduces staff workload and county expenses. The two dogs you see here today, Scout and Sadie behind me, were part of a group of 12 that were seized from a hoarding case. So Scout was pulled by Aussie Rescue Networking Group. He's not on the county's dime at all. I'm fostering him for them. And Victoria, who will speak next, is fostering this dog for animal services. In both ways, we are reducing demand on county resources while helping animals that will then go back into the community as family pets. My t-shirt, which is from Care for Paws is another partner that Animal Services works closely with to support pet pantries at all 3 shelters, which help our lowest income and neediest family members with their non-human family members. Although she and Dr. Hamami didn't offer specific numbers today, I'm pretty confident with what Jean Silva talked to you about because she knows how to do the numbers as a former manager of the budget department. So we think about $250,000 would get us where we need to go to start generating the revenue to get us back from $585,000 in license sales to $985,000 in license sales and maybe going up to $2 million in license sales. Thank you so much.
We will now go to Victoria Feld to be followed by Maria Valencia. Victoria?
Chair Caps and Supervisors, my name is Victoria Feld. I have a full-time job, 2 young children, and I serve as the volunteer dog foster coordinator for Santa Barbara County Animal Services. The foster coordinator role is like having a full-time job on top of my paid full-time job because we have dozens of dogs in foster at any given moment that may need me for anything, putting me on call at basically all times of the day. I also recruit new foster homes as dogs come in, and I act as the liaison to the veterinary clinic and potential adopters and fosters. Being in this role alleviates some of the work from the staff member in charge of the foster program, who is also in charge of the volunteer program, and the transferring of animals to other rescues and all elements that come along with being the community outreach coordinator. If anything is true for animal services, it's that we are very understaffed. There are days I go to the shelter to help clean kennels because I know that we don't have enough staff to do the job that day. I also try to help community members with everything I can so that our overworked shelter supervisor can do the things that I cannot do as a volunteer. I don't get paid for what I do, but that really doesn't matter to me because I love it. I love this program and its commitment to helping animals and people, and they do go the extra mile to do so. Our director and staff are dedicated to finding solutions for every animal that can be helped. That isn't all of them, but given that we are an open door shelter and can't turn animals away, it's amazing that we're able to save so many of them. It's really wonderful to be able to help members of the community who need help finding a home for their animal, who are looking to bring a new family pet. I personally also foster dogs that are struggling mentally, Sadie here, in the shelter environment. These types of dogs would have been euthanized in other counties, but Santa Barbara County Animal Services gives them a chance and allows me and other foster parents to rehab and find homes for them. I am so grateful to the Animal Services staff and volunteers who step up time and time again to help make this program work. As someone with a business background, I understand the county is facing challenging times financially. And with that, we really can't ask for money. But like the others have said, it seems to me that Project Pet Save program that generates revenue from dog licenses would bring in more money than the cost to administer it. That money could address staffing shortfalls to better meet the needs of our county. I hope that you'll find a way to support that. Thank you for your time and your support for this program.
We will now go to Maria Valencia, to be followed by Liz Bush. Maria?
Good afternoon, supervisors. I'm a NAMI member and also a family-to-family teacher since 2009. I have recently retired after 36 years with the State Department of Social Services, serving the public, ensuring the health and safety of our most vulnerable populations in at-home care licensed facilities such as assisted living facilities for the elderly, adult residential facilities, and child care facilities, to name a few. So I understand and appreciate your public service. I'm here to emphasize just a couple of several key points. While we are very grateful for Director Navarro for funding a clinician through the fiscal year, our understanding is that, like the Sheriff's Department, there is currently no funding for personnel, in particular clinicians, after the end of the coming fiscal year. As outlined on Monday's budget hearings, crisis co-response teams have the confidence of the community based on NAMI's relationship with hundreds of families through the family-to-family courses and support groups that we've heard from families. They prefer to continue to call 911 in mental health crisis, where they feel endangered or concerned for the life of their ill loved one. Medi-Cal mobile crisis benefit shouldn't be relied upon in the above situation because of the need for a fast, safe, and secure response, which NAMI believes only co-response can provide. Co-response has been widely proven a best practice for mental health crisis, especially considering not just for efficiency parameters, but more importantly, outcomes like superior record of de-escalation, lowered incarceration rates, and more importantly, increased trust in the co-response teams to provide this without jeopardizing anyone involved. Finally, we thank the Board of Supervisors for hearing and understanding our concerns and for your commitment to ensuring that this valuable program continues so that we have this outstanding service for our community.
And we will now go to Liz Bush, who is our final speaker on the Health and Human Services Functional Group. Liz?
Yeah, my name is Liz Bush, and I'm here to speak on behalf of Santa Barbara County Animal Services. It's an organization that I began volunteering in 2000, back when I was young and cool. A couple years after I got my teaching credential, my name could potentially, jiggle the mouse of your memory, because I did email you with some more comments. So if you reviewed it, and I know a couple have, I come from a social sciences background. My focus is in U.S. history, civics, and economics, and so I'm very well-versed in the economic storm, that we are facing, and it's been really illuminating listening to everybody else's presentations today and the way that you're all trying to come at this creatively in a really difficult time. My dad was a sailor, and the storm is coming, and it's really important in a storm to have the right captain, and we're very lucky at Animal Services to have the right captain. Sarah is remarkable. I don't say that of a lot of people. People who know me will know that that is true. She has this wonderful ability to be able to get in the weeds of data, but also understand the importance of culture and relationships. And that's so important in these kinds of human and animal serving capacities. She has no ego, which is so weird, in people who go to, how can you not have an ego? I know so many people, at this price point in their salary who are just there's a lot. And you can approach her with anything, and her creativity and her willingness to innovate and take feedback from literally anybody. You like that idea? Run with it. Tell me about it. Tell me more. Let's go. So I'm really looking forward to the ability to get the Project Pet Safe, which you're hearing a lot about. I think it is going to be a game changer because we know the landscape is, the funds are dwindling, and we need to be able to raise our revenues because we do need more help. We need more staffing, and we want to be able to serve more people that way. So thank you.
And that concludes public comment on the Health and Human Services Functional Group.
Thank you to our members of the public for speaking on these topics. And now it's time to go into closed session.
Can I just ask a question about?
Of course.
Thank you. So I don't know who this goes to. A question about Pet Safe. Yes, Sarah. So I'm just curious. So if you have a licensed pet, so I get email updates and it says I need to update the rabies vaccination. Do we not have a relationship with the vets? I mean, the onus is kind of on the dog owner, and then I don't get to go in and see the vet, and then I got to call the vet and ask for the rabies vaccination. Then my license was expired. I love the idea of communicating and going back and forth through email, but it just seems like you could cut me out of the process, get the vaccination paperwork, and then I could pay for it. Would be really cool.
That happens now.
Okay.
One of the things that we've put in place, I apologize, Supervisor Levenine through the chair. One of the things that we've put in place with the implementation of DocuPet is the increased ease of which our veterinary partners throughout the county can file rabies vaccination reports. And that is mandated in our ordinance. And if you look at the performance measures for our department, rabies vaccinations is a piece of that, in which we've increased, I think it's about 4,000 reported rabies vaccinations in a couple of years. The challenge now becomes following up on all of those to ensure that people are taking the next step, which is getting their license.
Okay, so when I get the email to re-up, that also goes to my vet? No?
No.
Okay.
You would still need to make an appointment with your vet and get your rabies
Oh,
vaccination.
no, but I already have the rabies vaccination. I'm just saying that, so that doesn't automatically go to you when I get a rabies vaccination?
Yes, that's.
Oh, it does?
Your veterinarian loads that into
Okay,
just
cool.
a Dropbox
That's,
for us.
that's what I wanted to know. Okay, thank you very much.
You're very
All right,
welcome.
cool. I just got to pay the $25. That's right. All right, got it.
Okay, County Council.
Thank you, Madam Chair, members of the board. The board is scheduled for one item of closed session of anticipated litigation, significant exposure to civil litigation. On April 11th, the county received a threat of litigation. It's regarding the change of owner, operator, and guarantor for the San Ynez unit, gas plant, and Las Flores pipeline system, and there's a letter attached to the agenda. And the time estimate for closed session is 30 minutes.
30 minutes? Okay, let's give a little time, maybe, 1:30, 1:35. We'll be back for round 2 of today. I said, I missed, no, 1:30. Okay, we are back for the afternoon session. We have our second functional group of the day, which is our community resource and public facilities.
Madam Chair.
Oh,
just
I'm
gonna do
sorry,
a
I
quick report.
forgot to have you read us out from closed session.
No problem. The board met in closed session on one case, significant exposure to civil litigation, one case, and the board took no reportable action.
Sounds good. Okay, let's go to our overview.
Thank you, Chair, members of the board. The next functional group presenting today is Community Resources and Public Facilities. The Community Resources and Public Facilities functional group is comprised of Public Works, the Agricultural Commissioner Weights and Measures, Planning and Development, and Community Services. This functional group makes up 20% of countywide operating expenditures, 12% of total county FTEs, and receives 7% of the county's total general fund contribution at $28.1 million. Looking at the 5-year operating revenue and GFC trend, we see that GFC makes up a relatively small share of operating revenue and has remained relatively flat for all 4 departments. The operating revenue decrease that we see in CSD in fiscal year 22-23 was related to the expiration of pandemic relief funding for the Housing and Community Development Division. Similarly, the decrease we see in fiscal year 25-26 for CSD is related to the ending state and federal grant revenue for homelessness programs and affordable housing projects. Public Works has had steady revenue growth over the 5-year period with a significant $24.6 million increase in fiscal year 24-25, primarily due to greater intergovernmental revenue for Highway 101 parallel projects and federal reimbursement for disaster recovery projects. Looking at operating expenditure trends, we see that Ag Commissioner and Planning and Development are holding relatively flat over the 5-year period. The variances we see in community services expenditures are mainly driven by changes in one-time pandemic relief, homelessness, and affordable housing funding. You will notice that while in the prior slide, Public Works operating revenue held flat in fiscal year 25-26, operating expenditures are increasing due to a carryover of transportation projects from the prior fiscal year that will be funded with draws from transportation fund balance. Looking at FTE, we see that Ag Commissioner, Community Services, and Planning and Development have remained fairly stable over the 5-year period. Public Works has seen steady growth in FTE related to increased activity in various divisions, namely transportation and resource recovery and waste management. Here we highlight the major challenges and initiatives of the functional group. Major challenges include cost reimbursement for storm recovery efforts, sustaining critical housing and homelessness services with limited-term grant funding, growing costs associated with maintenance and construction projects, and changes in international export certification requirements. Major initiatives in this functional group include implementation of the Workforce Housing Study and Climate Action Plan, and leveraging technology to streamline processes. Next, we'll provide a high-level summary of each department's budgeted sources and uses of funds. Most of Public Works funding comes from charges for services at nearly $85 million, which primarily funds resource recovery and waste management and Laguna Sanitation District activities. Intergovernmental revenue is also a major funding source at $72 million and is comprised of regional, state, and federal funds, which primarily support transportation projects. The use of fund balance is also a significant source of funding for resource recovery and waste management, Laguna Sanitation District, and transportation at almost $75 million next fiscal year. Most of Ag Commissioner funding comes from state and federal intergovernmental revenue at $3.6 million, followed by GFC at $2.3 million. Funding primarily supports agricultural programs that include pest prevention and pesticide use enforcement. Here we see that the majority of Planning and Development's funding comes from permit revenue at $17.6 million, generated mostly from building and land use permit activity. This funding is largely used to support permitting, inspection, and compliance activities. GFC is another significant source at $5 million and primarily funds long-range planning activities. Lastly, we have Community Services, whose funding mainly comes from intergovernmental state and federal grants totaling $25.5 million, which supports homelessness and housing projects. General fund contribution at $15.5 million and charges for services at $12 million are also significant sources of revenue that fund parks and community support services. And that concludes the Community Resources and Public Facilities Functional Group Summary.
Okay, thank you so much for the overview. First up is Public Works.
Good afternoon, Chair Capps, members of the board. Chris Nunn with Public Works. I'm really excited to be here today to present our budget to you. I wanted to start off by thanking Julie Hagan, our CFO and admin, and many other things in our department, and her team who put this budget together. We have our deputies here who feed them the information that they need to put that together. I also want to thank your board and the CEO office, Paul's team, Katrina. These budgets in these times are a little bit more challenging to put together, and we really appreciate the collaborative approach that your office took to help us put this together, so thank you. And then lastly, I really want to thank the people in our department who are taking this budget and putting it to good work in our community. As you can see in this picture, literally taking this money and getting it out on the streets, so thanks to them. For key takeaways this year, the first bullet really refers primarily to FEMA and FHWA funding for disaster response in 23 and 24 storms. We have $65 million in work outstanding and reimbursement that we need back from the federal government and from Cal OES. And so if we don't start to see some of those funds coming in this year, it will have impacts on us delivering some of our other capital project programs as we move into the future. And the second bullet is regulatory compliance and environmental permitting challenges. We're seeing that that's having impacts on the cost and the time to deliver capital projects. And it's not just impacting capital projects, it's impacting our ability to perform maintenance. So our flood control crews trying to go in and clear creeks to protect life and property, our roads crews that are clearing creeks and bridges, that work is getting increasingly challenging to get permitted and increasingly expensive. So that's something that we're going to be working on in the upcoming year. On the good side, we're anticipated to complete $62 million of projects this year. That's leveraging over $25 million in grant funding to complete these projects. And then as we're going to talk about in some of our upcoming slides, we're really working to expand our in-house capabilities to do work. That helps us save costs, that helps us streamline what we're doing and be more nimble in adapting to changes as they come. And that applies to technology as well, as I'll talk about in some upcoming slides. With that, I'm going to turn it over to Julie Hagan to walk you through the budget.
Good afternoon, Chair Capps and board members. I'm going to start with our proposed budget for 25-26. Our operating budget is $234 million. We have a capital budget of $48 million, $5.4 million of general fund contribution, and we have a proposed 320.8 full-time equivalents. The major areas in our department are shown here, with transportation being the biggest division. We also have water resources and flood control district, resource recovery and waste management, and Laguna County sanitation, and then we have our county surveyor. This is a partial list of our capital projects, and I wanted to highlight the Bonita School Bridge project in Santa Maria. This total cost is anticipated to be $50 million, and it will be 100% funded by the Highway Bridge Program, and this is a huge financial benefit to the county. This is the same way we were able to fund the Floridale Bridge in Lompoc and the Foothill Bridge in Cuyama that have recently been completed. These are the general county program transfers, and I want to thank your board for the ongoing deferred maintenance 18% funding. We use that for our pavement preservation program and attacking our deferred maintenance backlog. The Clark Avenue Improvements project listed here is mostly funded by the CIP allocation, which it sounds like from an amendment posted last night, that may be reduced by $250,000. The remaining projects on the list are carryovers from the prior year that were delayed due to disaster projects that we had to work on. Our staffing summary does show an increase in staffing. A majority of that is 13 FTEs that your board approved in August of 2024. That is due to us taking over the operations at the Resource Center. And we have 2 additional staffing changes. They are both to increase operational efficiencies, reduce costs by performing work in-house, as Director Sneddon mentioned, and to help with streamlining the permitting process. We are not requesting general fund for these positions. Excuse me. The increase in our operating budget is mostly related to major projects, as our transportation capital projects are built into our operating budget. Also, the liability insurance cost continues to increase every year. This increase shown here is for the transportation division alone, and we are working with the CEO's office on solutions to this issue. And at this point, I'm going to hand it back over to Director Sneddon to talk about anticipated accomplishments.
Thanks, Julie. So the next few slides will walk through some of our anticipated accomplishments for the year, and then we'll get into our plans for next year. In the left-hand side here, you can see the Cold Springs debris basin modifications. That project was completed in addition to other basins in the area, and those will increase our operational efficiency by making it easier to maintain these basins as well as protecting natural resources. On the right, you can see the Isla Vista trash capture project. That big hole in the ground with all that complicated equipment is now covered up, and all you see as you drive through is 2 manhole covers. But underneath there, what's going on is all the water that comes out of that area of Isla Vista is filtered to take out the debris and the trash so that what's flowing into the ocean is clean water. On the left here, we see the Resource Center. Our Resource Center was designated as one of only 4 of the 206 across the state as a high diversion processing facility. That's a huge testament to your board's commitment, to past boards' commitments, to our city partners, and to the community towards meeting the goals for the state in terms of reducing greenhouse gases, but also making sure that we're being good stewards of our environment and the waste that we're generating. On the right is the post-fire mitigation measures that flood control installed after the lake fire. That's a debris rack, and as you can see, it worked exactly how it was supposed to. All the burnt wood and debris that came down out of the hills after the fire when the rains came was captured by this device so that it didn't go downstream and inundate properties. And in fact, Walter Rubalcava, our Deputy for Water Resources, is at a national conference this week giving guidance to other agencies on how to do this, because our flood control agency, for better or for worse, has a lot of experience with fires and post-fire mitigation. And you have a very short time window between the time the fire ends and between when the rains come, especially with our shortening or our lengthening fire seasons. And there's a really they have a really regimented and aggressive schedules that they can meet when they have to put in these mitigation measures. So he's showing other agencies how to do that. We also, you heard Director Churgwin talk about the technology modernization plan for the county. We got a jump on that for our department, developing a modernization plan in parallel with the counties, working with ITD, and that project is complete. We've also completed, on the right, you can see the Waller Park tank. We're doing design and right-of-way work to extend those pipelines to take on other customers for our recycled water. Moving on to the upcoming year, that technology modernization plan, as I said, we completed the plan already, and we're really jumping into the implementation with both feet this year. I'm going to give a couple examples in a few slides, but we're really excited about the ability to leverage technology to improve the efficiency of what we're doing, to improve our data-driven decision-making, and to improve how we do the work that we do on a daily basis. We're also going to strive to meet our pavement condition index target of a minimum of the 57 that we're at today, and we'll be treating over 50 lane miles of roadways next year to do that. In water recycling and Laguna sanitation, on the right is the Waller Park pond, and we are going to be implementing those projects that are in design right now to, as I said, extend our recycled water line and to be able to take on more customers. On the left, you can see the 5th District's reservoir. It's a reservoir for Laguna sanitation, so I don't think there'll be water skiing or swimming in it anytime soon. But what it will do is help Laguna sanitation expand to meet the growing demand from development in the Santa Maria Valley for decades to come. In resource recovery, as I said, we're really proud to be a high diversion facility. That bar is a bar that moves, and our goal is always to be above the line on that. This flow chart shows the complexity and the progress that we've made as a county towards doing that. If you look on the left side of this where the trash is coming from, whether it be through the transfer station or drop off or curbside pickup, the first thing we're doing is we're pulling the green waste out of that and making mulch out of it. Then as it moves to our material recovery facility, we're pulling out the recyclables, and those are going to market. Then it moves the anaerobic digester where we're making electricity and we're putting that back into the grid. And then that product, the product that comes out of that, we go to our compost management unit to make compost that can be used for agriculture and other purposes. So at the end of all that, our goal is always to have less than 10% of the material that's left over going into the organic material left over going into the landfill. In our surveyor office, we are very busy this year with a lot of development coming online, housing element and other developments. And we're also going to continue to be providing GIS services for our department, other departments, municipalities, and other entities like LAFCO. We are also completing implementation of Acela this upcoming year. Transportation and water resources already have Acela up and running and implemented. Thanks to a technology innovation fund funding, we're going to be able to build a platform for the surveyor in the upcoming year so that we'll have all our divisions up and running with Acela. Moving on to the operational performance review. So we had 4 main recommendations from KPMG that we highlighted. The first was to develop a technology modernization plan. As I mentioned, we've checked the box on that one, and we're really heading into the implementation stage at this time. The second one was to increase tracking of data related to transportation maintenance requests. This is one we're really excited about. When I talk about the power of the technology modernization plan, what we did with this recommendation is we went and talked to other agencies around and to see what types of platforms they were using, what software solutions, and we got the vendor list from them. And then we went through a series of interviews with different vendors, and we got to the point of we're getting price proposals for them. When we got the price proposals, we were looking at upwards of $400,000 for the initial year startup costs and $300,000 a year for ongoing licensing costs, and then additional costs for any customization that we wanted to do in the future. So we wanted to find a better way to get the same thing done, and what we found is our IT team under Larry Lohman and the GIS staff that we have in Public Works started collaborating with ITD, and they have some amazing resources there. Jenna and Mike are extreme experts in this field and a great resource. So working with ITD and our resources, we actually are developing a platform on software that the county already owns for with no outside vendor costs. So we're really excited about the cost savings there. It also allows us to customize this software so it does exactly what we want it to do. And then if we have changes that we want to make in the future, we can do those changes. We're not having to go to a vendor to get those done. So super excited about that. The third recommendation is to do a similar thing for flood control, for inspection and operation of their infrastructure. And similarly, we're doing that process in-house, so that will be saving upwards of $100,000 as well by leveraging ITD resources as well as our IT team in Public Works. The fourth recommendation was to customize Acela workflows for flood control. So as I said, we do have Acela up and running in Water Resources, but we want to make some tweaks to it to be more operationally efficient. And thanks again to the Technology Innovation Fund, we have a little bit of funding to get that done in the upcoming year. For fiscal issues to watch, I mentioned FEMA and federal funding in our initial slide. That's really the big rock for us this year in terms of funding. We need to have some of those funds come in to keep things going. And sustained adequate funding, as always, is really important for pavement and our ever-growing backlog. We have our chart of PCI on the left, where we're always trying to move roads from the red zone into the green zone as much as possible. We do have a gap between the recommended funding to do that in this upcoming year and the amount of funding we have available. But we didn't put in a expansion request given that the budget outlook for the county and the myriad other things that the county is trying to get done. So we're going to be working to just stretch our dollars to get as much of that work done as we can in the upcoming year. On liability and litigation costs, those are not just increasing, but they're increasing at an increasing rate. So the slope of that line is going the wrong direction. So we really need to find a way to start bending those costs down. And the sort of irony of it is that those costs take away from our ability to do the work that actually reduces liability. So that puts us in a tough spot if those costs keep increasing. And then there's other state and federal transportation revenue sources and trends that we'll be keeping an eye on in the upcoming year. These are some of the performance measures. We have others, but these are some of the ones that go along with the bullets in the other slides that we track to make sure we're meeting our goals for them. And then for service level reductions, we have none due to $48,000 for the surveyor's office, and that's going primarily for Acela implementation, licensing, and some internal service costs. And then for our quote, it's a little similar to the CEO's quote, but maybe from a different perspective. It's from the great Dolly Parton. And Dolly Parton grew up in a one-room log cabin with 11 siblings in the hills of Tennessee. And from those beginnings, she went on to have one of the most prolific and influential musical careers in American history. Her career spanned over 60 years. She's sold 100 million records. She's won pretty much every award you could win. She has her own theme park. She has her own charitable organization. And she does that all with a ton of grace. What's that?
I just want to know if you're doing side job as a PIO for Dolly Parton.
I'm getting to that. I'm going to bring it around. So how did she do all that from those beginnings? Well, she started off with an immense amount of talent, and she always worked really hard at her craft and to be better at what she did. She had a ton of grit, has a ton of grit and determination, and she was very good at looking for opportunities to branch out into new areas at the right time, and had her finger on the pulse of how to make a big difference and big influences in people. And she always also had obviously a very charitable heart with the organization that she has and all the stuff that she's done for her community. And so those are some of the traits that we want to emulate in Public Works as we look at the budget this year, and there's a lot of uncertainty. There's a lot of volatility out there, and we just need to look at controlling what we can control. So we need to be aware of those things that are going on. We need to see them coming. We need to adapt and adjust to them, but we want to control our sails and make sure that our ship is sailing the way we want it to sail into the future. And with that, thank you, and we're happy to answer any questions.
Okay, I think we need a song, Director Sykes.
Not by me. You don't want that.
Okay, Supervisor Lee.
Chris, I know who I'm getting you for Christmas, so I just want to make a comment and say I always look forward to working with your team. You guys have been fantastic, so thank you and keep up the great work. Thank you.
Thank you.
Supervisor Hartman.
Oh, I guess that was left over, but again, you're one of the most responsive departments, and we really, really appreciate it. It's tailored customer service, and you make us look good.
Thank you.
All right, Supervisor Lavanino.
Thank you. You know how hard it was for me not to put on 9 to 5 right now and have
I got it right here.
little background. There we go. So I want to talk about PCI. And so it looks like when I'm trying to remember what year we put the 18%. It was like 2015? It was after the 2014 election, right?
Yep.
Okay, so 2015. So in 2015, we were in a steady decline from 63 was the PCI in 2009, and then we dropped all the way down to 59. And then in 2019, it kind of stabilized at 57, and it stayed there. Well, it went down to 56, and it's 57. So my question is, so the 18%, is it at this point, do you feel it is just kind of, we're kind of keeping a level playing field? We've stopped the bleeding, and we're maintaining, but I never see us really making progress. And I'm just kind of curious. I know it's just money.
Just money.
It's just money. I'd be interested to see what it costs, the difference to maintain the current condition. You know, back in 2016, 2017, when we did this, was like $14.5 million annually. Just kind of curious where you feel that is. And
yeah, Supervisor Lavanino through the chair. Thank you for that question. You hit it spot on. It's about $15 million in the upcoming year to just kind of hold the status quo. The last time we looked at the projections, which was maybe like in the last couple years, it was on the order. Really, the sort of there's two benchmarks in this. 70 is kind of the best management practice that you want to be at for pavement condition index. If you can get to 84, it actually gets much cheaper to maintain everything, but that's just a huge lift.
Right.
So we started looking at what would it be to get to 70. And the last time we looked at the projections, it was something on the order of $20 to $25 million a year to sort of start working that curve up towards 70.
that's pavement only.
Over like a 10-year period, correct? Yeah.
That's a tough lift. I mean, SB1 has helped.
Does that sound about right? Yeah, okay.
So SB1 has helped, right? But we're basically at the tread water.
Correct, but I would say the 18% general fund kept us from going that cliff,
Falling
going
off
off that cliff, and that's been really a huge improvement from where we were headed.
Okay, thank you.
Supervisor Nelson.
Yes, thank you, Chair Capps. Yeah, I'm going to piggyback on the PCI issue. So 57 is where we're at, and so this budget, the way you're funded now, you feel comfortable being able to maintain that year, at least over the next fiscal year?
Supervisor Nelson through the chair. We're going to have to evaluate that in the spring, and it's not an immediate result. So what we do this year, we might not be reflected in the PCI next year. It may take 2 or 3 years before we see the results of spending more money or spending less money. I think absorbing a deficit from the recommended amount for 1 year, and it's not a huge amount. It's $700,000, so it's a big amount, but it's not huge compared to the overall amount that we're spending. That it's something that you could probably absorb for a year. If it becomes a trend, is when we're going to see that line really start bending back down again.
Just, generally, my philosophy on supporting a budget includes maintaining that level, that we should not continue to mine that existing asset. And it does, and help me with my math here. So if we maintain at 57, even though we're kind of keeping the status quo, we're still adding to our deferred maintenance backlog, right? Because it becomes more expensive now, right?
Supervisor Nelson, that's correct.
And that's always troubling, because what we're doing is when we're adding more money to our deferred maintenance backlog, it is kind of a balanced budget, but it really is a future debt that we're going to need to resolve in the county. And I know it's kind of one of these unseen debts, but it's definitely still out there, and that's always going to be a constant concern. I think that I have, and I think this board is, seriously made that a priority. And it's, roads aren't sexy. There's no ribbon cutting. It's on a when you're out there with the pavement. But it's hugely important. And, I go through my emails just in the last week, this is what I'm getting mostly from my constituents, is about roads, and about how bad it is in front of their house, and how it's been 30 years since anybody's ever, showed up from the county. And that's really, where Steve was talking about social services being, what the county is for a lot of his constituents. Public Works and the roads department is a lot for a lot of my constituents. I have, 7 unincorporated communities. Most of my district is the unincorporated county. And, I think that's an immediate reaction, is when they walk outside their door and see, the condition of the pavement in front of their house, is how they judge, the county, and then sometimes their supervisor. So it's really important to me that it's something that we continue to invest on. And I did want to just point out those recycled water projects with Laguna Sanitation. If I understand that right, those have all been paid for by Orchid residents through rates. I know there are things that we're proud of as a county, but those are things that up here in the North County we've funded. They're all things that we're celebrating, but these are something that was specifically taxed our constituents to do. That they're positives, they're cutting edge, and there's something we're supposed to be proud of. But they have come at a cost. My other set of emails besides roads right now is, Laguna Sanitation rates are going to go up, and I have a lot of people who live in mobile homes in my community that are saying they were already having a hard time making ends meet. So these investments don't come without cost to some of our constituents. So just wanted to point those out. One last question and then a compliment. FEMA reimbursements, what are we looking at there as far as FEMA reimbursements, and where are we at on?
Supervisor Nelson, through the chair, do you mean what are the projections for when we're going to get paid, or
I'm looking at the
details
amounts.
about it?
The amounts.
Mm-hmm. So there's $65 million in projects. I believe we're at about 40 million, in the area of 40 million in expenditures. Was it 40 million? 32 million in expenditures. And so there's sort of two pieces to that. One is we're probably not going to be able to move forward on the projects, even though they're approved, that are funded, until we get that funding. And then in terms of the reimbursement, those are the numbers that are out there. I think we've been reimbursed on the FHWA side about $2 million. And I think the rest of it's outstanding.
Okay. I know there's a lot of criticism of the current administration on certain things, but I've been hearing from some of my other counties that they would actually be able to make progress on that. And so, I'd happy to work with your department on trying to unlock some of those things. Some of my colleagues, after trips to DC, have had those funds, in the mailbox by the time they got home. So it seems that they are opening up some of those purse strings for some of those funds in DC for these types of projects. And so we should make sure that we're getting on top of that and not being at the end of the line, hopefully in the front. And then I just wanted to add to the chorus of praise for you, Chris, and your department. You are continuing to be the gold standard, and I really appreciate the work that you're doing for our office. Again, as I mentioned before, I have 7 unincorporated communities, so Public Works is often, a big part of those communities' existence and day-to-day, their operation. And so, your department continues to come to the aid of many, many crises, and partners alongside our office and the CEO's office and other departments to solve problems. And you guys have been doing a great job at that. And I just really appreciate that, Chris. And I want to make sure I acknowledge it. Thank you.
Yeah, I'll round things up here, just pile on with the praise for the responsiveness in particular. the work on MODOC bike path, which is almost done, and also just the responsiveness to like a crosswalk after an 8-year-old boy got hit by a car. Just things that really do restore people's faith in government and the way in which people can be responsive. So thank you. I know that we've been working on parking in Isla Vista, and I just want to acknowledge it because there's a News Talk article about it, and a lot of people are upset with a lot of new housing coming into Isla Vista. So we're not quite there in terms of a proposal for parking enforcement, but I just want to kind of put a pin in this topic for potential with June, trying to figure out with Isla Vista Community Services District what their resources are, but just putting a pin in that as we go forward. So thank you. Okay. We will move on to the next department. Agriculture weights and measures. Okay. Director Chang, it's nothing personal. We're just getting a little punchy up here.
I think I missed that. Okay.
Take it away.
Thank you, Madam Chair, CAPS, members of the board, CEO Miyasato, county staff, members of the public, Jose Chan, Agricultural Commissioner of Weights and Measures and Director of Weights and Measures. I just want to acknowledge, and take a moment to acknowledge my team, Lori Martin, who is the Assistant Ag Commissioner. I also have Matthew Mayton, who is the Deputy Agricultural Commissioner, and Anthony Ponce, who is our financial person in the office, and he has been very instrumental in helping with the budget this year. So I just wanted to acknowledge them. The key takeaways for our budget, we are anticipating reductions in state and federal funding. I think that's something that I've been hearing, from all the other departments. We successfully balanced our budget with no reductions in service levels and eliminated the long-standing vacant management position. Our department budget, remains highly sensitive to changes in export certification requirements. The budget summary for fiscal year 25-26, the total operating budget for this office is just under $8 million. The general fund allocation, it is under $2.3 million. We get a one-time program transfer of $50,000 for FTEs of 36. Our department's three major service areas are, number one, agriculture, which consists of Environmental Protection Division, responsible for regulating pesticide use and ensuring safety for workers, the public, and environment. The Pest Prevention Division enforces plant quarantines, detects and eradicates invasive pests, inspects incoming plant materials, and certifies agricultural exports. The next service area is Weights and Measures, which is our Consumer Protection Division, which it inspects all commercial weighing and measuring devices, ensuring accuracy in pricing and weight for consumer goods. And finally, our administration and support, which provides essential services including fiscal operation, human resources, and customer support to ensure the smooth functioning of all department programs. We have, as mentioned previously, one county program transfer of $50,000 for cannabis enforcement work. This slide shows our staffing summary. As part of our efforts to align resources with operational needs, we remove a long-standing vacant management position. This decision allows us to streamline our organizational structure and better allocate funding where it is most impactful. As a result, our total number of FTEs now stands at 36. This staffing level reflects our ongoing commitment to maintaining high-quality service delivery while being fiscally responsible. Our preliminary budget for fiscal year 25-26 reflects a decrease of approximately $300,000 compared to the previous fiscal year. These are some of our key accomplishments for this fiscal year 24-25. One key highlight is the implementation of our electric vehicle fueling inspection program. Through this effort, we tested over 300 EV chargers across the county to ensure that consumers receive the correct amount of electricity for what they pay, promoting accuracy, transparency, and fairness in the marketplace. Here are some of the department's goals for fiscal year 25-26. We are actively working to acquire a new detector dog to replace the canine that recently transferred to another jurisdiction. In addition, we will continue to promote our new online payment system with the goal of achieving at least 10% increase in usage. I am very pleased to announce that we have completed all of our KPMG recommendations. We established dedicated divisions to streamline services and enhance service delivery, and we have implemented the use of constant contact to share timely updates with the community and are actively utilizing social media platforms to expand our outreach. The next two KPMG recommendations, supervisors are now conducting biweekly one-on-one meetings with their staff. Additional, we developed comprehensive program manuals to consolidate procedures and improve overall efficiency. We launched an online payment platform to provide the public with a more convenient user experience. We also enhanced our website to make it more accessible and user-friendly. Some fiscal issues to watch in fiscal year 25-26, as it has been mentioned before, the ongoing uncertainty with our state and federal partners, which may impact our ability to deliver programs and services. The continued electrification of vehicles and machinery, which is a good thing, but it can reduce our unclaimed gas tax revenue and impact related funding streams. And as always, we remain vigilant, monitoring for invasive pests that could pose a significant threats to our agricultural industry and natural environment. This slide shows our performance measure. Some highlights include we are on track to inspect 100% of commercial weighing and measuring devices permitted in the county this fiscal year, and we plan to maintain this target for the next fiscal year. We are also on track to complete all of our pesticide monitoring inspections this year. As a result of increased efficiencies, we have increased this inspection target by 10% for the next fiscal year. And as I previously mentioned, we have no service level reduction. And lastly, I just want to conclude with the following, and it is critical that we continue to support and advocate for the farming profession. Without dedicated farmers and without dedicated farm workers, we will not have access to the food and resources we depend on daily. We need to recognize farming not just as a job, but as an essential profession that is key to maintaining our food systems, our economies, and environment. Investing in agriculture is investing in our future, ensuring that we have the means to feed our community, preserve natural resources, and fostering innovation in sustainable practices. So, Madam Chair, members of the board, I really want to thank you for your continued support to this office, and that concludes our presentation.
Thank you so much. Yes, Supervisor Nelson.
Yes, thank you, Chair Capps. Great job, Jose, and great job out there in the field. Obviously, agriculture is our biggest industry in this county, and you are the face of that to the regulated industry, and you've been doing a wonderful job, and I continue to get compliments from the public that really feels like your department, plays it right down the middle. You guys are just the umpire out there, calls and balls and strikes, the regulations, and it's about education, it's about compliance, it's not about politics or gotcha. It's about, trying to keep people, the public, safe and following the regulations that we have in our state. So again, thank you for the work that you're doing out there. Also, the outreach you're doing, Spray Safe, with the things you're doing, that's multilingual, I think has been a huge effort that I think is something to be commended. One question I had from your presentation that just kind of piqued my interest was the EV chargers. So you guys have tested 300. So how's that going? Like, are they all pretty accurate, or is it all over the place? I'm just kind of morbidly curious.
I'm going to look at Matthew Mayton to answer that question.
Thank you. Supervisor Nelson, through the chair. So I do have an answer for that.
Okay.
So let me get my glasses on. Sorry. So last year we did our first go about with this new program, and we found about a 60% compliance rate during the first initial inspections. So that just means 60% of them passed, meeting all the specifications and tolerances. And some of the reasons why they didn't pass range from not delivering the right amount of energy to not meeting some of the labeling and marking requirements, or not meeting type approval, because they have to be approved devices through the state of California and the National Type Evaluation Program. So it's just a combination. And then when we do find them out of compliance, we let them know, we give them time, but it's still a new industry. It's still emerging, but I can say that we are one of the trailblazers, trendsetters in the state of California.
Well, it's neat that you guys are doing that, and I think it's exciting to kind of see, and 60% is pretty good, I guess, especially since it's new. Drilling down into that 40%, because I don't think many people care about the sticker, or that whether it has the right sticker on it or not, or if it's a licensed one. It's really about, are they getting the amount of electricity that they're paying for or not? Does that seem to be, are they overshooting it, undershooting it? What's the?
I think it still has to do with, it's still a new emerging industry, and a lot of companies out there still don't know all the agencies that are involved in this industry. For example, they go through APCD, but they forget there's another department, the Agriculture Weights and Measures Department, and all the devices have to go through us for approval and testing. So it's still emerging. I mean, I would say maybe 8 counties in the whole state of California are doing this program.
So I guess the question, Matt, was, so are people overpaying right now for electricity or underpaying? And those that are failing, is it trending one way or the other?
Supervisor Nelson, through the chair, I would say, without looking at the data, from what I just heard from my staff, most of what we find out is they're giving away energy.
Okay, so
just a little bit.
So they're underpaying. Okay, yeah. If they're going to err on the side, I like hearing that. Okay.
So, Supervisor Nelson, through the chair, it is actually, and the way that I've been explaining, it is actually, we see that at times both. We see underpayment and overpayment. And at the end of the day, we want to get everybody in compliance. And so, and at the end, many of the businesses, they get those chargers, to be accurate and be, not cheating customers. So,
sure.
Yeah. But it's so to answer your question, we have seen both, underpayment and overpayment. Okay. Of course, if as a consumer, I would rather get, more for what I'm paying for, and that's not good for the businesses. Yeah, and so we, of course, let them know that they probably need to look at that too.
Okay, excellent. Thank you for that.
Supervisor Lavanino.
Thank you, Madam Chair. And I just want to piggyback on what Supervisor Nelson was saying, that this, and I know there's other departments, fire, sheriff, in North County, this is the position of trust that you're the face of the county for our industry and also labor. And like Bob said, I've seen your department just play it right down the middle, and both sides can respect that. And it's been a long time coming that both sides feel that, and there's still always going to be squabbles, right? But both sides feel like you're being a real arbiter of the situation and not getting involved in what Bob or I would like to see, or some other activist group. So we just really appreciate what your whole department does, and keep up the good work, because honestly, it only takes one time for something really bad to happen, and all that's down the drain. So appreciate being kept up to speed also. You always bring me potential problems, and it's always good for me to know. I think some people always think we just want to hear good news, but we also want to hear what the potential pitfalls are out there and get ahead of them so that we're not caught by surprise. So thank you.
Okay. Thank you. We're good. Moving along. Planning and development.
Good afternoon, Madam Chair, members of the board. I'm Lisa Plowman, Director of Planning and Development. Today I have my fiscal team here. I have Elise Dale, Assistant Director, Drew Rosura, who's our Administrative Deputy, and David Mitchell, who's our Business Manager. I really wanted to thank them for all the hard work that they've done, along with the CEO's office in the development of this budget. It starts months and months and months ago, and it's quite a long process, and they've been working really hard. I also want to note that I have Jeff Wilson, Travis Seawards, Alex Tuttle, Aaron Briggs, and Craig Johnson here, and they are the deputies of the other divisions. Just for members of the public that might be watching, planning and development is responsible for land use policy development in the county, permitting, inspections, enforcement, and compliance, all related to community development. So key takeaways from this year are that staffing levels are remaining steady. Revenues from permitting and inspections are expected to increase due to the housing sites that were rezoned as part of the housing element. And we're seeing about 2,500 units that are in our pipeline right now that hopefully will be built out. The general fund is providing $250,000 to backfill a structural deficit in the long-range planning division. And we have no known impacts from the federal administration cuts. We didn't have any grants that were tied to that. Our budget this year is about $28 million. The general fund contribution is 4.9, or roughly $5 million. And about $3 million of that goes to our long-range planning division, and 1.9 goes into the public counter, enforcement, and reimbursement for appeals. Our staffing levels are at 114.25. The department has 5 service areas. They include administration, permitting, code enforcement, coastal mitigation, and long-range planning. Our key project in the last few years has been the Acela project, which enables us to move to a fully online permit process system. It's designed to create efficiency and transparency in the process so that the department can better serve our customers. The second phase of Acela was completed in March of this year, so that's really exciting for us that we've moved fully to an online system. And one of the other things that we've done in our efforts to sort of modernize our process is develop on-demand permits in the Building and Safety Division. And those are smaller permit types where an applicant files an application online, they print out their permit, and the county conducts inspections. So they don't even have to come into the county for this. And we have 12 of those, and they include things like re-roofs, electrical panel upgrades, residential solar installations. So that's been a really exciting process. In 2024, I wanted to note that we issued permits for 139 low-income units, 85 of those in North County and 54 in South County, and there are more in the pipeline. So we hope to see those come online in the next year or two. And one thing I wanted to note about permitting was that the Coastal Commission just recently upheld the board's approval of the Miramar project. And that is 26 low-income units in Montecito for the workers of the Miramar Hotel. And that was one of the key projects that we identified for the future in our housing element update. And we're really happy to see that we're getting some low-income units in that area of the county. Under coastal mitigation, this is one of the fun things that we get to do, and this is distribution of money that's brought in from oil and gas. And this year, the board, along with the department, allocated about $318,000 to some very important and meaningful projects. And one of those is Nature Track, which is a program that allows people with disabilities to get out to the coast and see the natural resources. So they're like little four-wheel drive wheelchairs. We also funded bike racks to help improve access to coastal resources, as well as funding a project at the Cabrillo High School for the Coastal Gallery in their aquarium. And that's always a great project. And that's one of the photos up there. I know it looks like a bar, but it's not. It's actually the high school aquarium project. Long-range planning has also been working diligently on housing element implementation, and we will be continuing to do so over the next few years. This includes ordinance amendments and updating our code to keep up with the new state mandates and state laws. We expect to return to the board this next fiscal year with our local preference program, concepts for the board to consider, as well as facilitating code amendments that help us build housing in our residential areas. General county program transfers. About $525,000 is provided to long-range planning for a supervisor and consultant costs for some of our streamlining efforts. $370,000 for cannabis appeals, reimbursement and counter support. $356,000 for cannabis code enforcement staff. $237,000 for the EIR for utility scale solar, and $221,000 to support the housing element implementation. As I mentioned earlier, our staffing levels are at 114.25. It rounds up to 0.3 on this slide, but our staffing levels have remained steady over the last few years. And our operating budget is $28 million this year. It's up slightly from last year, about $800,000. That's due to increases from the COLA and equity adjustments. And then to sort of balance that out, we saw reductions in our professional service contracts. So over the last few years, the department has been really focused on making significant improvements to our permitting process and updating our policy documents to keep pace with our state mandates. And as I said, ACELA has been sort of our keynote project, if you will. And we completed that phase 2 this year. That included establishing memorandums of understanding and service level agreements with all the reviewing departments. And that includes Public Works, Environmental Health, Parks, and 3 different fire districts, the county, and then 2 other districts in Carp, Summerlin, and Montecito. And that's important for us to maintain the standards and the requirements that state law mandates in terms of reviewing projects. We also are utilizing a new software called Bluebeam, which is really a helpful tool. It allows all of the departments to review the same plan online, make comments on the same set of plans, so that each department can see what the other department's comments are. And if there are conflicts, then we can work those out early in the process. I also want to commend Travis Seawards in the Development Review Division. He spent an immense amount of time overhauling our subdivision development review process. That's the process where applicants get to come in and meet with all of the different departments that are providing comments on their project. So they have an opportunity to ask questions and discuss those requirements. As I mentioned, we implemented over a dozen on-demand building permit applications. This slide says there's about 2,100 that have gone through the process, but since the preparation of this PowerPoint, it's 2,300. So that is a pretty good number of people who can just get their permits printing out at home and get inspections. We expect to complete our comprehensive fee structure analysis and updated fees. This has been in the works for a little bit of time now, and it's due because we haven't done one since 2017 when the department initially transitioned to a full cost recovery model. Some of the other additional accomplishments we expect include, we already completed some of these, and that is amendments to our code to bring us in compliance with state housing law, including SB 9 and ADUs. Some of the additional ordinances that we completed included the cannabis odor control project, lighting and signs and commercial telecom. We will be coming back with the mobile home park overlays, and we identified a number of cleanup items that were flagged by board members in our code, including some changes in the M2 zone, allowing outdoor retail in our coastal zone, and allowing for art tours. Our goals and objectives for next year continue in the vein of improving and streamlining and modernizing our permit process. And those include tracking the performance of our service level agreements with the other departments. So we're going to be developing a KPI for that. These are really important because the state continues to produce mandates about how quickly we review applications and get permits issued. We are going to continue to expand on the Acela platform by producing project management tools and dashboards. We also have an aspect of Acela that's going to help the public interfacing with our permit system. We will further streamline our building permit process, and we expect to add more on-demand permits, the ones that are in the queue or for heat pumps and window exchanges. And I wanted to take a minute just to chat about AI. Some of the other departments have brought it up and the importance of it, and we've been working with ITD and Chris Chergwin to look for ways that it can be applied in planning and development. And we think that we can use it in the development of our policy documents, preparation of staff reports, and review of plans for consistency with codes. So we're going to be exploring all of those options over the next year as we bring AI to the county. Some of the other goals and objectives include the implementation of the IV rental inspection program, which is a pilot program that will last about 12 months. And that is geared towards improving the living conditions in Isla Vista for the students. We're going to be modernizing the multifamily and commercial zone districts so that it's easier for multifamily housing to be built in those zone districts. We expect to make significant progress on our circulation element, our open space element, and the safety elements, all of which have been out of date. We will prepare amendments to increase ministerial permit types as well, so truly ministerial permits, and we will initiate environmental review on that program. In terms of the operational performance review priority recommendations, there are 4 priority KPMG recommendations, or what we now call capstone projects, that we've been working with the CEO on. 3 of those are related to the Acela upgrade, and we have completed a number of aspects of that. One of the things I mentioned earlier is that we're going to be developing a KPI to monitor how successful our service level agreements and our MOUs are with the other departments that review applications. The fourth is bringing our hearing process and planning, for the boards and commissions that planning and development works with and oversees into the paperless world. So we would like to make sure that we can do away with copies of staff reports and make sure that everything is electronic in that process. The fiscal issues to watch for us in the next fiscal year include new state requirements for housing or other general plan element updates. And so for those of you who sit on the Ledge Committee, you probably are tracking that there are 22 new fast-track housing bills that are being considered by the legislature right now. And so we're monitoring those closely to see what kind of effect they could have on our process. Another thing to watch out for is the lack of available grants. Historically, the department has been quite successful at bringing in grant money that subsidizes long-range planning activities. And because of the budget shortfalls at the state level and changes at the federal level, those monies have essentially dried up and we have not had access to them. So that does limit what we can do in long-range planning. Building and safety revenue, we're watching the rate at which our housing projects are moving through the system and when they pull building permits. And then just watching out for a potential decrease in permit volumes due to some of the economic uncertainty that we have seen of late. The next slide outlines some of our performance measures. I wanted to highlight a few of them. The first one, of course, is the Acela transition. We are 100% complete now, so we will not be having this KPI in future budgets. I wanted to talk about one of our KPIs that we plan to change in the future. And if you can see the middle one where we approve land use and coastal development permits within 60 days of the application submittal, as you can see from the last few years, we're not performing very well on this KPI. And we looked more deeply into it. And part of the problem is this KPI captures the time recommended changes or required changes in applications sit with an applicant. So we bring an application in, we review it, and then we give it back to the applicant and say, here's the changes that need to be made. So it tracks that time and it can sit with the applicant. Sometimes it moves quickly, sometimes it doesn't. And we don't have any control over that. It also includes projects that go to our design review boards. And depending on how quickly they move through that process, that can delay the issuance of a permit. So what we're going to do is change that KPI so that it tracks from application completeness to permit issuance, because that will more accurately reflect the time that we control in the department. And then the last one I wanted to highlight, and I do this every year, but I think it's of note, and that is our building inspectors. They have, at near 100% record, have completed building inspections within one business day of the requests that come in. And that's the 15th year that they've done that. So I really wanted to tip my hat to them because they work very hard getting out in the field. Next year, we're going to be adding the two KPIs, the ones about the service level agreements and MOUs, and then we will have one for the increased in ministerial permits. So we'll be tracking those as well. With respect to service level reductions, we don't have any this year because of the $250,000 that is being contributed by the general fund, and this closes the structural deficit in the long-range planning division, and we're very grateful for the work that the CEO's office did with us to close that gap. And I know I cannot compete with Public Works on this, but I'm pretty convinced that Chris used AI to come up with all that data. So I did a little bit of my homework sitting here on Tom Landry. Tom Landry was the longest tenured coach in the NFL. It's in history. He coached the Dallas Cowboys for 29 seasons. He went to 5 Super Bowls, and he had 2 Super Bowl victories. We found this quote because we thought it fit well with the work that we do in the Planning and Development Department. But he said, setting a goal is not the main thing. It's deciding how you will go about achieving it and staying with that plan. And that concludes my presentation. I'm happy to answer any questions.
All right. Thank you so much, Dr. Plowman. Questions from the board or comments? Supervisor Hartman?
Well, I think of that quote in light of all the work on the housing element and how you guided us through that, you and your department. That was one of the major undertakings since I've been at the county, and very humbling task. And now all the tasks that go with it to keep in line with all the policies and programs we're supposed to develop. I had one thought, and that is about HLAC. I'm still struggling with their budget. I know that for a department having another commission, another group weighing in is not exactly the way to streamline. On the other hand, they're people with tremendous expertise who are volunteering their time, not to hang projects up, but just really to identify for people with historic buildings what they have so that they have a better sense of it. So I'm not quite sure. I guess the budget they have, they actually have to pay to go through the permitting process. And we discussed about streamlining that and looking at our ordinance. And so that was something on the long-range plan. But I'm trying to think what else we can do in terms of the budget to make that easier. I mean, it's the only commission that I know that has a budget that has to pay for these things. I don't think the planning commissions do or the architectural review boards do. So help me out.
Yeah, Supervisor Hartman through the chair. So historic landmarks, they propose whether to landmark a structure or not. And because the way our ordinance is currently constructed, that has to be brought to the board for approval. And so that is brought before the board by a planning and development planner. And because we are a cost recovery department, we have to figure out a way to pay for that. So that's part of what their budget pays for. So I've been working with the chair, Keith Kaufman Gray, on figuring out how to sort of realign their budget to make that work a little better so that they can move forward more landmarks in a given year than they have in the past. There is some question as to whether or not the code should be amended so that they don't have to come to the board for approval, but perhaps it could be appealed to the board. So we are looking at options like that. And that would save money.
Right,
Yeah.
right. So that's one option, but I hope you are looking at other options in addition to trying to streamline our permit process there, because it seems like they're the one commission that has this burden of having to pay for all the process. And they're eager to do work and they can't. And again, it's not a regulatory process so much as I understand it. It's really more providing useful information to someone about the values of what they have. So thank you. That's really, I mean, your department, again, it's probably the hardest job in the county to be a planner, and your department really it does it well. And I'm getting more and more comments about how helpful the planners are and how people appreciate working with you. And I certainly know in my office, people come to me and you're willing to sit in with me and help guide people. And and you certainly did that on the Builder's Remedy projects. And so I really like that role for planning, is to get in there early and help guide people and give them the benefit of the tremendous experience that you have about what good planning is. So thank you.
Okay, Supervisor Nelson.
Yes, thank you, Chair Capps. And I'll just piggyback on the HLAC issue, because at some point we just staffed them appropriately, right? And then at some point we made a decision to give them only a certain amount of dollars, right? I mean, so. And
that's correct.
That was a policy that was determined. How'd that actually come about?
You know, that
So I
it
don't-
happened a long time before I was here, and so it's sort of, their budget has been the same. But there's a process that was laid out in the ordinance for how the landmarks get designated. And so that was board approved. And I'm not sure exactly what year that happened, but it's been in place for quite some time. And so
But-
that process requires them to come forward to the board and have a staff board letter for the board to consider.
But treating them like an applicant's a fairly new practice. That's,
No, actually, we've been doing that for quite some time. I mean, the department has consistently brought forward those HLAC recommendations.
and charged against their budget, and that's been,
That's been in process for a long time.
okay.
Yeah.
All right. I'd like to pull back some of that and figure out when that actually happened and how it was decided from a board level, you know, because I think that's where, it seems like something changed here in the last few years. And so I don't know if it's the department declaring them, I mean, that your cost recovery, there's things that we do that are not cost recovery as well, right? So I would have thought this one was one that wasn't cost recovery just because it was a county function. So, you know, whoever made that policy decision, whether that was internal to the department, whether the CEO's office or the board, I want to kind of pull back and figure out when that was made, because I think that would be helpful and educate our process forward. So that was just my adding to that question. That key performance measure on the 60 days, you know, I think it might be good to subtract out the time it's with the applicant, but I don't think you should, you know, I think that would be more appropriate there. And I also think that you guys should include when things actually get submitted, because I know sometimes it'll take you a couple weeks before you actually accept the application. And so, you know, I think from the user side, they think submittal means when you submit it. But you guys have a different definition for that, right, in your department?
So it kind of depends on the type of permit that's being submitted, right? So what will happen is it'll be submitted, and that'll be recorded in Acela, and then we figure out if they have all of the requirements for a application to be submitted. So that can take a few days to determine that they submitted everything necessary, and then it gets its case number and moves on to a planner. So there might be some time at the beginning of that submittal process just confirming that they have everything that's needed for a planner to start reviewing their application.
I just hope that we can track that amount of time, because I think that is one of the pinch points that I'm hearing. So, I mean, I know you're saying it's a couple days, sometimes it's a couple weeks. And so I think that that's an issue that needs to be addressed. And then, you know, I think the amount of time it takes to get to hearing, I think that's also something that should be a part of that, you know, performance measure, because I think that matters when these types of things are pinch points for housing, for economic development in the county. So that would be my feedback on that. You said there's 2,500 homes in the queue right now?
In the pipeline.
How many businesses are in the queue?
I don't have that number off the top of my head.
Okay. Do you know how many additional hotel rooms or anything like that that are in the queue right now?
Well, I do know that we have been working very closely with the Biltmore to try and bring that project online. That's been non-operational for a number of years since the debris flow. So we've been working really closely with them. We do have hotel in Vandenberg Village, thank you. Vandenberg Village. And I think that's 60 rooms, is that correct? Roughly 60 rooms, and that's in the queue as well.
Yeah, I think those are important things for us to know as a board too, and for you and the public, because I mean, that's really the economic engine for the county, and something that we don't really often embrace here, or think about is, you know, when we look at our budget, you know, we need to have more to do the things that we're doing. And so part of that is a revenue issue, and that's additional housing, that's definitely additional businesses. You know, I've got one that I think is finally getting traction, but it's been, you know, stuck in planning for 4 or 5 years. It's going to produce, you know, $500,000 in general fund revenue a year, but, you know, we've been struggling to get it through the process. And, you know, there's so many other projects that are stillborn because of how long it takes to get through a process. I've had to talk this business owner into staying with it multiple times where he's wanted to bail. And so I think that happens throughout our county, and so we need to definitely be looking at those types of projects that can really bring in additional revenue. I mean, that again feeds what we're doing here, and makes these budget hearings a lot easier if we actually end up having more tax revenue instead of just waiting for everything to appreciate in value. If we can grow the pie, we can do so much more. And I do think that our systems and our are an impediment to that. And so we need to find ways to not just make things more ministerial, but make things move through the process quickly. You know, because I think we actually make decisions pretty quickly when they come to us. It's a matter of getting to us that is a big part of the issue in this process. And hopefully we can find ways to streamline that, or even, you know, if we have difficulty hiring, giving ways for, you know, project applicants to potentially, you know, go outside the county and, you know, hire third parties to do some of these same issues that we have to rely on ourselves to do, might go a long way to pushing projects forward and faster.
Are you good? Yeah, I think Supervisor Nelson covered it mostly. I'll just chime in on the legislation coming down the pike potentially. You said 35 bills. I know it's a big package. And on the one hand, I want us to maintain our local control. But on the other hand, I do hope that your department is realizing the change that's in the air about making it easier and cheaper to build. And so I just hope that's viewed as something that's motivating and exciting as opposed to oppressive, because it is, there's so much focus. I mean, any podcast you listen to right now is all about, if you're into political podcasts, you know, just about how, you know, California is sort of an example of, I mean, high-speed rail is the sort of the example that's used a lot that has nothing to do with us, but just how things get bogged down so easily because of, to be blunt, folks like me who want a lot of environmental regulations and things. So I just hope that this time in history of things are really breaking apart. And I hope that it's seen as a challenge to strike the right chord of balance, that we can be efficient and we can build and we can also uphold the values of what our community wants. And trying to achieve all that at the same time is the goal.
Yeah. Supervisor Capps, I think that is fair to say that there's a lot of energy in the Development Review Division focused on these housing projects. We're meeting with groups of applicants together that have housing projects all in one area to try and make sure that we're all coordinated and figuring out how to make sure that these projects work together. So we're doing a lot of innovative things that we hadn't done in the past or hadn't had to do in the past. But we definitely recognize the importance of moving those projects through the system. And moving all of our projects through the system. I mean, I've spent the last 5-6 years working to try and improve things for applicants to get their projects through the system more quickly, but still being able to review everything that we have to compare them against in terms of our policy documents. We have a lot of codes and requirements that we have to make sure that they comply with. And so we do our best to try and balance all of that and get people their permits as quickly as we can.
Great. Okay. Thanks, everybody. Appreciate it. We are going to move to our last functional group. I mean, yes, I'm sorry, not functional group. Within this group is community services. And then a little housekeeping, we'll do public comment from the public, and then we'll take a short break.
Chair Capps, members of the board, Jesus Armas with the Community Services Department. A pleasure to be here today and to chat with you a little bit about both the achievements the department has realized in the course of this year, as well as the challenges that we're going to face as we embark on a new fiscal year. Assisting in the presentation and available to respond to questions are members of our leadership team that include Andrew Myung, our Chief Financial Officer, Sherman Hansen, our Business Manager, Joe Desvanek, our Deputy Director of Housing and Community Development, Jeff Lindgren, our Director of Parks, as well as Sarah York Rubin, our Executive Director for Arts and Culture, and the newest member of our leadership team, Garrett Wong. So welcome to Garrett. We have a few key takeaways that we'd like to share with you. They're visible on the slide. No need to really read them. I think you've seen multiple slides today, so I'll try to streamline our presentation. we're really excited about the opportunity to continue to make progress on a number of fronts. We've had some success on dealing with issues of homelessness, but obviously that's a key takeaway from a funding perspective. We have presented to the board a variety of sustainability initiatives, and how those get carried out and how those get supported are important elements. And I think one of the aspects that you've not yet had an opportunity to deal with as a body is the recreation master plan. It's going through various phases now. It's really an aspirational document that identifies what we can achieve when we follow the lead that was reflected in the previous slide, the previous quote about having a good plan and adhering to the plan. So we're excited about bringing that forward to you later this year. From a budgetary perspective, as you can see, our operating budget is close to $63 million, distributed among the various categories as noted there. I would note that the general fund contribution is slightly under $16 million, which represents about a third of our overall budget. So the Community Service Department is self-supporting to the extent of 2/3 of its operating costs. In the next slide, we'd want to talk a little bit about the diversity in our various divisions. Of course, we have our administrative and support function that handles a variety of IT and financial matters. Our parks and open space, we're especially proud of when you go about the county, people talk about the ability to enjoy trails, enjoy open space, and really the beauty and that Santa Barbara County represents. As noted in the slide, we've had over 7 million visitors to our various parks, quite an achievement for a county our size. An area that represents both an opportunity and a challenge, of course, is our housing and community development section, where we have an operating budget of slightly more than $28 million. As noted in the slide, we've produced through 167 units, as well as provided 3,100 beds for people that are homeless. The budgetary information is important, but really when you think about it, it's more than just numbers. It's about people and the residents of our county that we're able to serve. So if you'll indulge me, let me share with you a story. Recently, we were assisting a couple named here, Jacob and Dahlia. Their journey started quite some time, and it took a positive turn ultimately because of intervention of one of our service providers, New Beginnings. The couple first moved to Santa Barbara. The wife was pregnant, and they were attempting to connect with family. Unfortunately, they found themselves living in an RV, and they resided there for some 3 months or so. But with the assistance of the safe parking program, they were able to essentially provide a secure, a safe environment, a safe location in which they could reside. And ultimately, they received assistance and are able to call a new facility, a residential unit, home. I think it's important to translate the dollars and cents that are reflected into the budget to the fact that we do make a difference. And I want to commend the board for the strong leadership and support that you've represented when we've come before you on homeless issues. Not every community has that kind of history, so I want to acknowledge and express our appreciation. Of course, we also have really the benefit of community support in the form of funding for libraries as well as the various arts activities. And you know that whenever Sarah York Rubin goes throughout the county, she's immediately recognized as a person who's a strong supporter for the arts. So thank you, Sarah. We also have a key area of responsibility as it relates to sustainability. We have a budget of about $3.5 million, staffed by 7 full-time equivalent personnel. We've assisted a variety of homes in pursuing energy retrofit projects. And of course, earlier last summer, you considered and adopted the Climate Action Plan. We'll be coming back to you next month with some additional areas in that section as well. Some capital projects to share with you. are listed on the screen. The Rincon Beach Park is slated to benefit from the installation of a couple of vehicle charging stations. The Kachuma Loop water line, of course, is noted there. And based on the preliminary discussions on the CIP, we hope to continue improving the paving area at Goleta Beach. The general program transfers are listed on this slide. Don't need to review all of them, but note that we are very much appreciative of the 18%. Just as Public Works indicated how beneficial it is to their effort, it's made a difference in the Parks Division being able to tackle some important areas that had not been able to fully receive attention due them in years past. From a staffing perspective, we're largely flat. We do have one change as a result of the expiration of funding for a limited term position in our Sustainability Division. As we look at the operating budget itself, we see that it's declining for next year to the tune of about $20 million. That's largely a result not of service reductions per se, but as a recognition that we've expended monies in various capital areas, particularly in the homeless front, to either facilitate the development of units, to fund some of our interim shelter facilities, and otherwise operate within the prescribed time periods that the board has adopted. We're particularly appreciative and want to note here how beneficial Sankel's contribution was to such things as our homeless management information system. We continue to focus on some SURF 3 funding that you'll recall we received an $8 million grant, and we anticipate spending $4 million of which this year and then continuing on to next year. Our parks revenue has declined in part because of the absence of the revenue coming from the concession at Goleta, as well as the RV park at Lake Kachuma. I would note that park activity is slightly down in terms of camping, not so much for the reasons mentioned, but they seem to be returning to the pre-COVID level. There may have been a huge bump during that cycle that may be an outlier of typical activity. In terms of some of our accomplishments, let me note those that are listed here. Really appreciated working with P&D on the various aspects of the housing element, the inclusionary housing ordinance that we presented to you earlier, and then most recently, of course, the workforce housing study that offers enormous potential and can really be a game changer as we embark on how we address critical housing for the residents of this county. The Recreation Master Plan, as I indicated, is slated to come to you later this year. Some anticipated accomplishments are noted in the slide. Would highlight some of the efforts that we've been realizing through our Sustainability Division, particularly in some external funding to carry out projects there. I would also highlight the first item that's listed there, the collaborative work that we were able to do with the City of Santa Maria and the County of San Luis Obispo. We're anticipating being able to come to you in June with a memorandum of understanding that calls for the three agencies to continue to support Eyes in the River to make sure we don't have a repeat of what we experienced before. Some of our goals for the forthcoming year are around implementing the workforce study. I'll share with you that both General Services and CSD have agreed to form a team to make sure that we're coordinating our efforts on the, for instance, on the probation RFP that we have to bring back to you in a few months, excuse me. And then we also want to make sure that as we explore other properties that we fully engage the services that GS provides in that area. And of course, making sure that it's syncing with some of the planning regulations and rules, et cetera. We continue to implement the encampment protocol as revised earlier this year, and we're also undertaking some additional efforts in the Parks unit by taking a look at our present reservation system and hoping to make a variety of improvements, both with respect to the reporting aspect, but most importantly, on the customer experience. It needs a little bit of a boost, and we're eager to see how we can improve our forward-facing effort in that respect. Again, let me highlight in this slide some of the efforts that we're continuing to take with respect to EV charging and the like. Garrett's unit has really done a yeoman's job in making sure that we look at opportunities for pursue grants, to pursue external funding to achieve some of the objectives. I would also note that based on your discussion just a few months ago, a few weeks ago, we will be also in the coming year focusing on the issue of swimming at Lake Cachuma, as well as the request that we examine our fee structure for parks to determine whether there's an opportunity for to draw a distinction between resident and non-resident levies. Some operational reviews that the department embarked upon this year. Really excited about some efforts that we've been doing in our call center. As we shared with you when one of our employees recently retired, we brought that back in-house because we think we can do a better job than the external vendor that we were employing, and we're excited about that undertaking. Additionally, as noted here, we have also installed traffic counters, so we have a better indication of the number of visitors visiting each of our park facility. One of the challenges for any department such as ours, particularly in the parks area, is to make sure that we have a good manner of evaluating productivity. And so we have had some success in implementing our Planet Geo work order system, where we track orders, maintenance orders coming in, we track how much time it's taking, and we're able to better assess our productivity in that respect. Again, our homeless team and our housing team have done remarkable work on both the homeless front and also on permanent housing. As you can see, we're also eagerly paying attention to pursuing grant opportunities. Fiscal issues that we need to be paying attention to next come to mind. The current administration, as you know, has seemed to renewed the repeating pattern of trying to zero out the housing and urban development, which tends to focus on such programs as community development block grant and homes. So we're going to have to make sure we keep a close eye on that. When we bring back the recreation master plan, I think we need to have a good discussion with the board as to what the expectations are relative to ultimately implementing that. Homeless funding is seeing a decline from the federal government. We are seeing the governor also examining more carefully how those dollars are used. We're proud about the work we do, and we're proud about our ability to withstand any scrutiny of those dollars and those expenditures in those program areas. Sustainability will be doing a number of things to assist in the implementation of the CAP, as well as working with other departments as appropriate. The performance measures that you see here continue to show some attention to productivity and efficiency. We're pleased to say, with the assistance of the CEO's office, that there are no additional general fund contributions beyond the assistance that's outlined on this slide. I would note that the support is necessary in part because of the decline in camping revenue, and the extra help cost that's listed here is not additional personnel. It's aligning salaries between the extra help personnel and our regular employees. As we turn to the final slide and the quote, I would hope that the board would indulge us next year if we follow Chris Snedden's lead and bring forward a musical and biographical profile of either Ray Charles or Stevie Wonder. I'm not sure yet, but I hope you'll be receptive to that type of a presentation. Our quote is, I think, trying to respond to the period that we're in at the moment and what we're experiencing. Greatness is not found in possessions, power, position, or prestige. It is discovered in goodness, humility, service, and character. It is with that goal in mind, that quote in mind, the CSD commits to continuing to provide community services and explore opportunities through technology, through system, through empathy, through compassion, to provide efficient, effective, and responsive departmental services. We're happy to respond to any questions the board may have.
Thank you, Director Armas. Any questions or comments from the board? Supervisor Lavanio.
Thank you. Can you put up, I think it's slide 2, it's the one that has your entire, like there's 5 or 6 different departments inside your department? 4, slide 4, please. So I got myself in trouble a few years back when I called this the junk drawer of the county. And I think I was corrected, it's a Swiss Army knife. I just want to say that you are given a wide range of different things to deal with. And whenever I call on any one of those different areas, we get excellent service. And especially, I just have to say that the work that was done inside the Santa Maria riverbed, it's probably government at its best. I don't know how many people in Santa Maria knew. They didn't care. This is what's always different about serving up here and then being in the community, is we worry about jurisdictions and who's going to pay for something and, what process, we got to go up the chain of command. People don't care that that's San Luis Obispo County. They see it out this side their window. It was impacting us. And instead of coming up with a bunch of reasons why you couldn't, which probably should have been, you had good reason to not want to do it, you found a bunch of reasons how to do it and how to make it successful. And Joe, your work with just pinning everybody together, it was just amazing to watch you work. I was down there where you were receiving calls from San Luis County telling, well, we can't do it because of X, Y, Z. And I would say it was, you did it in a friendly manner, but more so of getting the job done was what you were concerned about, not hurting somebody's feelings. So, amazing work on housing, the park system, everything. Sherman, it's just, and Sarah, everything you do with libraries and art and all kinds of stuff. I take back it might have been a gaffe. It wasn't as bad as calling AI A1, okay? But I learned my lesson, and I just wanted to say you guys are doing an amazing job.
Thank you, Supervisor.
Is that like a steak sauce or something?
Yeah.
Okay.
Yeah, it was actually, I think it was Department of Education Secretary called AI A1, but
Okay.
It's all right.
I love A1 too, no offense.
Supervisor Nelson.
Yes, thank you, Chair Capps. And I'll piggyback again on Supervisor Lavanio's comments about the work, especially in Santa Maria Riverbed and the work that Joe did. I think on my notes here, when you said it was a collaboration, I thought you were being generous, because I really, they were there at the table, but there was definitely somebody that was serving the food and getting everything done, and that was Joe and your team. And so, without Santa Barbara County as a leadership, that wouldn't have happened. And, and we were the ones that had the least really invested youth, if you think about it. It's on the other side of unincorporated area, right? We have a whole city between us and the riverbed. So most of those people were going either between, Santa Maria or unincorporated San Luis Obispo County into Napomo. It was in San Luis Obispo County. But at the end of the day, there needed to be a leader, there needed to be an adult in the room, and Joe took the bull by the horns and really came through on that, probably saved the mayor's reelection. There's a lot of other ancillary things that came from all that, but there was a lot of attention in the community and a lot of trust now that we've built through that. So again, Joe, I just, want to give you kudos for all of your work there. Going through the Swiss Army knife, one of those issues I do like to point out is in, I think, the community support, arts and libraries, so Sarah's group, and is the amount of money that we actually in Santa Barbara County use to fund local libraries. And I think that needs to make sure that's highlighted. Because when we're looking at all these choices, all the things that we don't have to do, but we do, and something that, a lot of people take for granted. We're one of the few counties, maybe the only county that funds libraries within cities. We have a municipal responsibility for unincorporated residents. That's less than a third of our population, but we fund libraries for the rest of the county. And that's something unique that we do here, and that's a lot of money. It's $7 million between arts and libraries. I don't know what the library, it's probably about $5 million is the library portion. Andrew, am I right there? That's a lot of money when we're looking at our expenses here and things that we don't necessarily have to do, but we choose to do. And I think that goes a long way towards being a countywide benefit that isn't necessarily something that this board has to prioritize, but has prioritized. And I don't think we get enough credit for that. I also don't think that we fund our municipal services for unincorporated people as generously sometimes as we do for other people's municipal populations. But that's another soapbox for another day. But overall, Jesus, I think it was really important for us when we hired a city manager, right? Because this is really a small city here that you're running, and you're doing a great job. Always not on the same page with you, but I know that you're pushing forward and doing the best with what is before you. So again, thank you, Jesus.
May I just say I appreciate the board's attention to the department and how supportive you've been in the 15 months or so I've been here. I also want to acknowledge that the housing unit, and particularly the homeless, as we began to look at the Santa Maria riverbed, really it took the challenge put forward by Supervisor Nelson and Supervisor Lavanino for us to say, yeah, we can do something. And so I want to acknowledge that, but for their intervention, if I can use that word, we might not have been at the point we're at today. And so thank you.
I could say many things, but in the interest of time, I'll just say thank you. Okay, we'll move on actually now to, thanks for that functional group. We'll move on to public comment if there is any.
Chair Capps and members of the board, we have no requests to speak from the public on the Community Resources and Public Facilities Functional Group.
Okay, let's just keep ourselves healthy up here. Let's take a 10-minute, 12-minute break, roughly. Get a little natural light. Come back at 3:45. Oops, welcome back. We are going to take on our last functional group, budget workshop. So we'll have a summary, please, by Ms. Fernandez.
Thank you, Chair and members of the board. The final functional group presenting today is Policy and Executive. This functional group is comprised of County Council, the Board of Supervisors, the County Executive Office, and General County Programs. This functional group makes up 6% of overall county operating expenditures and 2% of county FTE. 20% of the county's GFC is allocated to this group and is primarily received by the General County Programs Department before being transferred out to other departments to fund a variety of board-approved policies and projects. Looking at the 5-year operating revenue and GFC trend, you'll notice that the board and county council are primarily funded by GFC and show more modest increases year over year. The reduction we see in operating revenues for the CEO in fiscal year 25-26 is driven by a $27.9 million decrease in ARPA funding as board-approved allocations for these projects come to an end. We see that General County Programs shows a steady increase in GFC in the first 3 years of the 5-year period related to increasing reserve funding and set-asides for various uses. The decrease in General County Programs in fiscal year 24-25 is mainly related to the release of ongoing set-asides as a balancing measure for departments impacted by increased internal service rates and salaries and benefit costs. The larger decrease we see in fiscal year 25-26 for General County Programs is primarily due to the end of the Northern Branch Jail funding plan and the allocation of ongoing GFC directly to the sheriff instead of general county programs. Looking at trends in operating expenditures, we see that the board and council have remained steady over the 5-year period and mirror operating revenue from the prior slide. A large share of CEO operating expenditures in this chart are insurance premium payments made by the Risk Management Division of the office. Year-over-year increases reflect growing general liability and workers' comp insurance costs. The spike in CEO expenditures for fiscal year 21-22 is related to ARPA expenditures in that year, and the variability in General County Programs expenditures over the 5-year period is mostly associated with contracts such as KPMG, Accenture and Workday, and the court's Conflict Indigent Defense Contract, amongst others. Turning to the 5-year FTE trend, we see the Board of Supervisors has held flat while Council shows slight increases over recent years related to the addition of a Deputy County Counsel for litigation and administrative support staff. The changes in CEO department FTE over the 5-year period are primarily related to departmental reorganizations and include the addition of cannabis licensing and data-related positions, and the shifting of OEM positions to fire and CSB-TV positions to general services. Here we highlight the significant challenges and initiatives for the functional group. Major challenges include uncertainty surrounding federal impacts to the county budget, depletion of ongoing reserves to fund the deficits identified in the 5-year forecast, funding of increased litigation and settlement costs, responding to legislative changes, and funding for the Northern Branch Jail expansion. Major initiatives include advancing criminal justice partner collaboration, implementing streamlined board agenda processes, strategic investments in facilities and infrastructure, and successful implementation of new financial and budgeting systems. Next, we'll move into department summaries. The majority of county council funding comes from GFC at $12 million and supports their core legal services. Here we see that 100% of the board's funding comes from GFC at $5.3 million and funds district and board support activities. In the CEO's office, major sources of funding include insurance premium contributions at $60.5 million, which pay for the county's general liability, workers' compensation, unemployment, and medical malpractice insurance programs. Intergovernmental revenue is also a significant source at $7.3 million, comprised mostly of ARPA revenue that is transferred to other departments for board-approved projects. Finally, we have the General County Programs Department, whose primary source of funds is GFC, that is held in fund balance for board-approved policies and projects. Fund balances are released to various departments throughout the fiscal year as projects are completed and associated costs are incurred. And that concludes the policy and executive functional group summary.
Thank you so much. We will move to County Council, please.
Madam Chair and members of the board, good afternoon. I'm Rachel Van Mullum, I'm your County Counsel. County Counsel is the county's in-house law firm. We defend the county and we protect the county treasury. We do this by advising departments and by litigating cases. The funds we defend and protect in litigation and the funds that we recover are used to support programs and services in the community. The key takeaway for our budget is consistency. This is significant because we have seen an increase in litigation costs and outside counsel fees. But by using technology and by bringing work in-house, we've been able to keep our budget the same, including our outside counsel budget. And we've been able to work with our existing resources of 47 employees. Our operating budget is approximately $13.9 million, and the majority of that is general fund. Last week, I had the opportunity to attend the County Council Conference, 58 counties and 58 county council offices. And the number of issues that a county council office has in a single day is incredible. And I am certain of one thing. We may not be the largest county, but we have a lot going on. On any given day, we may get a phone call or a text or an email or a Teams chat that Public Works needs help with a construction contract. Community Services asks a question about a sustainability project or needs help with affordable housing. Behavioral Wellness sends us a draft policy for review that's going to come before the Psychiatric Health Facility Governing Board. General Services wants to meet with us to discuss an upcoming purchase of property. Public Health sends us an ordinance. ITD requests review of a software contract. And the clerk of the board calls us because we received another civil lawsuit or 30 property tax assessment appeals. And these calls and emails come in while we are advising public meetings, such as the Air Pollution Control District, the Santa Barbara County Association of Governments, the Legislative Program Committee, Civil Service Commission, and Historic Landmarks Advisory Commission. And they come in while our attorneys are in court hearings and trials for child welfare, bail bonds and restraint motions, weekly calendars for probate and conservatorships, dangerous condition, employment, land use, and personal injury cases. Here are some of the major projects from this year, including our work on emergency medical services, housing development projects, the November election, including the transiency occupancy tax, and cannabis odor control. Our office handles a lot of litigation. Last year, our office resolved 27 cases, with 67% of those cases with no county payout. These cases were personal injury, employment, and civil rights cases. We prevailed in 6 out of 7 dependency appeals and 2 civil litigation appeals. There's been 1 since that slide was made. And we also defended other significant litigation, including a Regional Water Quality Control Board cleanup and abatement order for the Semco site. Our most significant operational change is the implementation of our case management system. It allows us to track and create reports, caseload, and activities. One of our office goals this past year has been to provide more training to our client departments, as well as internal to our office, and also to do litigation debriefs with the department so we can be proactive about preventing litigation in the future. So this saves the county money since we're preventing litigation, and also we don't have to pay for the outside trainings. So one example of this is that we implemented a new 15-week litigation training program for our legal office professional staff. A primary fiscal issue to watch is the increased cost of litigation. Our outside counsel budget is $800,000 this year, and it's staying the same for next year. And while that may sound like a lot, with hourly rates between $500 and $700 an hour, it goes fast, and it mostly supplements work that we already do in-house. As an example, one case going to jury trial at $500 an hour with outside counsel would typically cost about $1.5 million. That's due to the number of years and hours it takes for this type of case. But since our attorneys handling this type of litigation also handles numerous other cases, it's a significant savings for the county. And we will continue to try to do as much work in-house as we can. We made significant progress on our performance measures, including saving $213,000 through efficiencies, and that was by bringing specialized work in-house that we would normally send to outside counsel. We also met with the CEO and the department heads to receive feedback on legal services. We have no service level reductions. I do want to thank CEO Miyasato, Budget Director Paul Clementi, and our analyst, Charlotte Mack, for their help throughout the budget process. And before I conclude, I also want to give a special thanks to all of our staff at County Council who are so talented and hardworking and really care about the work that we do. In summary, as your legal advisor, County Council will continue to advise on major programs and projects. We will continue to defend the board's decisions, and we will litigate to protect and recover county funds so that your board will maintain your discretion on how to spend them. And with that, I'm happy to answer any questions.
Okay, thank you so much, County Council. Questions or comments?
I've got a comment. Thank you, Madam Chair. You know, I know recently that there's been a few articles here and there that I've actually read that kind of bothered me because maybe they weren't even, yeah, they were articles, and then there were some emails and things where they're kind of disparaging County Council's office because of some of the decisions that we've made. And I'd like to remind people that we all make our own decisions, the board does. And we're not actually allowed to say what advice County Council gave us. So it puts you in a really difficult position. And I just appreciate the fact that I've never heard you once say, hey, this is going to put some heat on my office, or this is, you know, you make your case, we kind of make our determination, and then you do the best job you can with what, you know, what we've come up with. And I know that's not easy. So I hope you can do what we generally do, and that's ignore what you read and keep doing the best job that you possibly can. You've done an amazing job. And I can't think of a time where we've had more serious litigation in such a short amount of time. And, you know, you guys seem to be handling it extremely well.
Thank you, Supervisor.
Ditto.
Supervisor Lee.
Rachel, since it's time being here, I just want to say I'm very impressed by you and your team about how hard you have been working for us. And I just really appreciate everything you guys do. Thanks.
Yeah, I'll just chime in with I'm appreciative that you listed off all of the varying things that you do, because that's what I've been struck with, is really how you serve as a policy arm as well as the legal litigation and legal, which most people see sort of the headlines about litigation, but there's so much else. So, and I've never once had an encounter where you or any of your staff said, sorry, I can't get to this right now. So thank you for being available. Okay, let's move on to the Board of Supervisors.
Good afternoon, Supervisors. I'm going to kick this off. Brittany Oderman, Deputy CEO, is going to present your budget as well as the CEO's budget, but I first want to thank Don Holden, the CEO Business Manager, who is also your business manager for your offices. Thanks to your board and mostly your chiefs of staff and your aides for all the work they do all year long, especially in preparing the budget and being the frontline constituent services for the entire county and working collaboratively with the departments. Brittany's going to go over your budget, but I just want the public to know, because we're only highlighting certain things. There's a lot that goes into all the work that you do. This whole day and Monday is testament of all the things that you do. And so I just want to highlight 3 things that are going to be discussed more in detail. But one is you've demonstrated a commitment to fiscal responsibility. You've demonstrated an unwavering commitment adopting prudent budget policies, and you care about maintaining the long-term financial health of our county. You've advanced community services and infrastructure. Just today, you heard about all the significant investments to combat homelessness, advance affordable and workforce housing, secure access to trails and recreational opportunities, supporting infrastructure maintenance, and supporting technological advancements. And lastly, preserving services for the most vulnerable, as well as fostering community-wide efforts for sustainability. So all of that, if anyone wants to read the budget when it comes out, will be in there. But for now, I want to hand it over to Brittany.
Good afternoon. Thank you, CEO Miyasato. I am Brittany Oderman, Deputy CEO, and I am here to present both the Board of Supervisors and the CEO budget today. A few key takeaways. The Board of Supervisors continue to maintain a status quo budget while providing quality public services to the people of Santa Barbara County and balancing future budgets. The proposed operating budget for the Board of Supervisors is $5.3 million, entirely funded through general fund contribution. There are 19.08 FTEs assigned to the board offices. The next 2 slides summarize the proposed budget by major service area, which are made up of each of the district offices, districts 1 through 5, and general board support. The board support budget unit is comprised of budget items not attributable to individual districts, but rather benefit the board as a whole. There are no changes from the 24-25 adopted budget for 25-26 in staffing, so we're flat at 19.08 full-time equivalents. The slight budget increase from last fiscal year is due to internal service fund rate increases, which you've heard from pretty much all of the departments, and as well as salary increases. Some of the anticipated accomplishments for the 24-25 fiscal year we found solutions to balance the need for access to public trails with neighborhood safety, protected safety net services for vulnerable populations with programs such as free tax filing services and opportunities to claim the earned income tax credit, promoted fiscal responsibility, assisted disadvantaged communities in recovering from natural disasters, and continued to build partnerships to address homelessness issues in the Santa Maria River. Board district staff also noted a few department goals and objectives for next fiscal year. The board offices plan to enhance countywide fire safety by establishing resiliency hubs and expanding fire-safe community programs. Working with planning and development to continue to implement streamlined permitting processes to enhance the overall efficiency of the permitting system. Continue investing in transportation and other infrastructure maintenance, and work with local stakeholders to develop a trail network that aligns with community plans and enhances recreational opportunities. Also, identify solutions and secure state or federal funding for infrastructure projects like reinforcing the southern bank of the Santa Maria River. As you know, more detailed objectives and goals are included in the departmental D pages. Some fiscal issues to watch. We've heard from other departments already, but we want to look out for the potential elimination of federal funding to programs that affect county residents and the lack of affordable and workforce housing near job centers in Santa Barbara County. There are no service level reductions with the additional general fund allocation to cover the previously mentioned rate increases and salary increases. And finally, we have a quote from Joe Echeverria, who is the former CEO of Deloitte. The best way to predict the future is to create it together. Thank you.
Okay, hot topic. Any questions, comments from the board?
Okay,
Go ahead.
okay, just a comment. I just want to thank my team for all the hard work they have been doing, because I wouldn't be successful without them. So thank you to them.
All right.
I'd like to do a deep dive on D3's budget. No, I'm just kidding.
I'd like to thank Supervisor Lee for the incredible amount of food that has taken place on the 4th floor since he arrived. Okay, I think we're good. We'll move on to the next one. Thank you, Ms. Oderman. You're up on the next one, County Executive Office.
Good afternoon, board members. I want to kick off my budget, my annual budget. Brittany will also be going over the detail. But so if you've noticed, Rachel Van Molen's quote every year, I think, is so apt. And that's, if you've got a problem, I've got a problem too. For me, I think about it as, if you spend $1, somehow I end up spending $1.87. Pensions, roll-ups, liability, and et cetera. But no, my office is responsible for implementing the board's directives, achieve the county's overall mission and goals, and work collaboratively with the county departments. We manage the day-to-day operations of county organization and prepare the organization for future risks. So I want to thank your board for all your support and your staff for working with us, and all the department directors and their staff. And I think this is probably the best crop of department directors we've had since Monday. And let's see who's here. And I know one thing for sure, and that is the department directors will not let Chris Nedden down, and they will be always singing Dolly Parton songs to him from now on. But for my staff, I just want to say thank you to all my staff. They work hard throughout the year. A lot of their work is not known to the board, especially risk management, so thank you, Greg Milligan. Jacqueline, the clerk of the board, and her entire staff. Paul, of course, and the budget team, Carmela Beck, and the cannabis licensing, as well as the superhero ACOs, Tanya Heitman, Wade Horton, our communications manager, PIO Kelsey Butita, and of course, Brittany Oderman and Don Holden. And with that, they'll go over details of the CEO's budget.
Thank you. Some key takeaways for the County Executive Office. We have maintained a status quo department budget. We did unfund a cannabis license specialist due to reduced revenues, and we continue to coordinate several multi-departmental initiatives, and we are working diligently on future budget balancing and jail funding strategies. The total operating budget for the CEO looks large because it includes risk management, where all of our insurance is collected and paid out, including general liability, workers' compensation, and unemployment insurance. The general fund contribution is just about $9 million, and transfers from general county programs about $1 million. We have 46 full-time equivalents, and no service level reductions or expansion requests are being recommended. The County Executive Office is made up of 2 budget programs, county management and risk management. A majority of our staff work in county management, which houses our operating programs, including the clerk of the board, budget and research, cannabis licensing, communications, our legislative and economic vitality program, and then executive administration. The risk management budget program supports the insurance programs I mentioned in the last slide, as well as all of the Public Records Act requests that come into the county, which are estimated to total over 3,000 this fiscal year. General county program transfers include some money for the criminal justice consultants that we work with, cannabis licensing administrative costs in our office, 2 positions previously funded by American Rescue Plan or ARPA funding, and then transfer of the county physical security coordinator to our risk management division. For staffing, there's a net change of 1 position as we added the security officer I mentioned, 1 deputy CEO as part of the board-approved reorganization, and deleted or unfunded the cannabis licensing specialist. The Executive Office operating budget grew by a total of $4.6 million, mainly due to risk management program cost increases and salary and benefits. These costs were offset by decreases from the end of the American Recovery Act funding and contributions to the Santa Barbara County Association of Governments for completing work on the Local Assistance Broadband Grant. Our department's highlighted current fiscal year anticipated accomplishments include supporting safe reduction of the number of incarcerated people by leading a work group that addressed better treatment and more opportunities for diversion of felony incompetent to stand trial, or IST, individuals. This resulted in a 20% reduction in the IST population and a 60% reduction in penalties paid. We also provided coordinated service delivery and strengthened the county's safety net through continued support of developing workforce and affordable housing options on county-owned land, and the implementation of CalAIM Healthcare to enhance access and delivery of healthcare services to county residents. We are fostering financial and organizational excellence by developing realistic fiscal outlooks and plan for budget deficits. We reworked the 2025 legislative platform to create a more streamlined document and completed the very well-received Your County, Your Heroes video series. We also streamlined the Capital Improvement Program, or CIP, process with elements such as enhanced project prioritization. Looking forward to some of the Executive Office's 25-26 goals and objectives include continuing to assist with CalAIM healthcare reform, drive the implementation of criminal justice partners' priorities, and collaborate with Good Samaritan Shelter to launch a second felony incompetent to stand trial housing facility. We will help to advance the Public Safety Radio Network project and support the launch of the Regional Fire Communications Center. In addition, we will enthusiastically support implementation of Sherpa budget development software, streamline the outdoor festival permitting process, complete the county's 175th annual video series, and explore improvements to Granicus, which is the system the board and public use to access board agenda materials. We'll continue to support the implementation of Senate Bill 43 to improve care for those with severe mental health issues, track the implementation of the current housing element update, and ensure the implementation of cannabis odor scrubbing technology by early 2026 deadline. Our top 4 operational performance KPMG recommendations include strategic management and performance measurement, which is in progress. The renewed countywide goals were updated in 23-24 and continue to be followed and tracked. We completed the coordination structure between the assistant CEOs and departments with the reorganization of the County Executive Office to focus assistant CEOs over functional groups with the support of our principal analyst team. We have a recommendation for change management and continuous improvement. This is also partially completed. The continuous improvement facilitated through the Innovate SBC training program, that's our green belt and black belt program, is fully implemented. And then the Santa Barbara County Black Belt Change Management Facilitation Program is underway. Risk monitoring and reporting is partially completed. Risk management has created data reports for departments to monitor claims activity, and development of data dashboards with relevant information for departments is in progress. The big fiscal issues that are keeping our staff up at night are how to maintain core services that the community relies on with changes outside our control, such as a potential recession or reductions of federal funding to safety net programs, as well as costly state initiatives without additional revenues. County costs are growing and could crowd out other board priorities. And future disasters. Will FEMA be a reliable funding partner? And this is a sampling of some of our performance measures. We track and aim to project general fund revenues consistently over a 3% variance. And then in accordance with board policy, we strive to keep the strategic reserve at 8% of general fund operating revenue. We began tracking the progress being made specifically in our office to annually review each cannabis operator's compliance efforts with a target of 100% of operators for next fiscal year. And the last measure tracks the number and completion rate of general liability claims received within the year to ensure responsive, timely processing. We are recommending no service level reductions. And finally, We close with the quote from Ron Daigle that CEO Miyasato shared with you at the start of the day, one, and is the message our staff is carrying into final budget development. If you cannot change the course of a storm, be the lighthouse. Thank you.
Thank you, CEO Miyasato and Ms. Oderman and the team. Any questions or comments? Supervisor Labanio.
I just wanted to, thank you. I just wanted to highlight the amazing work that our PIO has been doing. I've been here through a number of them, and this is the product that we're putting out now, as far as the videos and just the communication, it's night and day. It's just amazing. And it actually puts us in a good light, which we don't get to do very often. So I've learned something from your videos as well, so I think they're really cool. And just keep up the great work. It's good.
I agree. I think we're good to move on. Last one.
Chair Capps, members of the board, Paul Clemini, our budget director. I'll be presenting the General County Programs budget. The purpose of General County Programs is to account for countywide types of activities that are not typically associated with a specific department's function. Overall, the operating budget has remained largely status quo. The biggest year-over-year change we see is the shift of the ongoing GFC for the existing NBJ operations funding from where it had been accumulating in General County Programs since the inception of the funding plan over into the sheriff's budget, as we discussed on Monday. This is also the department where we hold many of the funding reserves and set-asides. And as I've just noted here again, we released $6.8 million from the ongoing set-asides to help balance the county budget this year. And our strategic reserve is fully funded at $47.5 million. Operating expenditures for this program in fiscal year 25-26 are $9.7 million. Capital budget is $1.9 million, and general fund contribution supporting operating costs and debt service payments is $10.2 million. There is an additional $43 million of GFC that goes into the various fund balances maintained in this department, most significantly the 18% deferred maintenance, the ongoing set-aside reserves, the cannabis tax revenue. Together, those three alone make up $30 million of that $43 million. The major service areas include support to other governments and organizations, which mainly consists of handling the conflict defense contract and LAFCO funding, our reserved and committed funds budget program with operating costs that include expenditures of the UCSB settlement funds as well as ERP implementation costs, and the smaller ancillary services program where programs such as Innovate SBC are funded. Debt service is also paid out from the ancillary services. It just doesn't show up as an operating expenditure here because it's a transfer out to the debt service department where that payment is actually made. The capital $1.9 million budget I mentioned on the previous slide is the software subscription costs for Workday and Sherpa budgeting software. Compared to prior year, the operating budget shows a slight decrease, $100,000 of which is due to the last bit of the KPMG contract that was in the 24-25 adopted budget, dropping off in this next fiscal year. Accomplishments in this program include continued funding support for initiatives and projects, including the 18% deferred maintenance funding and funding the Workday implementation. Similar objectives next year, including continued implementation on Workday, as well as developing a funding strategy around the new Northern Branch Jail expansion. As we've been discussing during these workshops, fiscal issues facing this department are the costs of the debt issuance for the Northern Branch Jail expansion, as well as the eventual depletion of the ongoing reserves that we've been using to balance recent budgets. No service level reductions in this department. Finally, this last slide shows the general fund key discretionary fund balance accounts held in general county programs. This does not encompass fund balances maintained within department budgets, as many departments have their own balances for specific purposes. Most of these accounts are associated with a board-approved policy and are committed to specific purposes. Many of the accounts receive general fund contribution, which are then passed through to other departments, such as I mentioned before, the cannabis fund balance, the 18% deferred maintenance, as well as roads baseline and facilities maintenance baseline, and hazardous tree mitigation. Touching on a few of the specific accounts here, the behavioral wellness account, it's the second line up here. Now this is a small print slide. The behavioral wellness account was established around 10 years ago to cover annual costs overruns at the PUF that were becoming a general fund obligation as they overexpend their revenues there. While it hasn't been needed in a few years, you did hear from Be Well earlier today that the rising costs of IMD beds are a growing concern, and this fund balance would be a contingency balance for that if they start having those cost overruns again. I'll point to technology replacement fund here. That funds countywide technology initiatives and is how we're currently funding the DEMS electronic discovery implementation and subscription costs, along with a grant that the DA has received, some PSRN and aerial GIS costs. It'll likely fund AI implementation projects as plans are further developed on that, and other action items from the IT strategic plan. It also serves as a fallback for the ERP implementation project. We see our strategic reserve over there, fully funded, as I mentioned, increasing $1.8 million this year to remain fully funded per policy at $47.5 million. I'll point you to program stabilization right here. That's where we hold our ongoing set-aside funding, as well as a variety of earmarks established in prior years, such as for Hope Village and La Posada operations, should outside funding not materialize for the full 5 years of operations there. This is also the balance that we're recommending be used for the social services $3.4 million funding gap, as well as the RFCC operations funding gap. New jail operations is where the prior MBJ funding plan was housed. The residual balance there will be put towards the new MBJ construction costs. Finally, emerging issues, that one there, third from the bottom, is where we hold a variety of other board-approved allocations and set-asides. This includes the uses of the parks, trails, and open space fundings from a few years ago, various LRP projects, Orcutt ball fields, MODOC multimodal, sustainability initiatives, unspent board discretionary allocations, and quite a bit more. That concludes my presentation on general county programs.
Okay, thank you, Mr. Clementi. Any questions or comments on the board? All right. Oh, CEO Miyasato? Okay, Madam Clerk, I'm just confirming there's no request to speak.
Chair Capps and members of the board, that is correct. We have no request to speak on the policy and executive functional group.
Okay, well, thank you. It's now up to the five of us to figure out if we want to.
Supervisor,
go
we
ahead.
do have a workshop summary. So if there's we didn't hear anything else, we have the workshop summary.
Okay.
So we'll pass that out and post that, and it's posted. This is just a recap of what we heard, any direction from the board, and we'll go over the 3 issues we'd like direction on as part of your deliberation.
Thank you.
Thank you. So I'll just kick off the workshop summary here while Stephen distributes those. It is posted online on our Budget Workshops documents website with all of our other materials. So just covering what we've heard over the workshops, again, this is a largely status quo budget with the exception of social services. We did have increased use of general fund contribution to close budgets out. We did release $6.8 million set aside needed to balance this budget. Reiterating this uncertainty I think you've heard from many departments around the federal, state, and federal budgets. And again, no expansions recommended from our office. We did have 3 specific items we mentioned earlier in the workshops that we are seeking board direction on, and that is approval of the recommended use of one-time funds, direction on balancing cannabis budget, as well as proposed capital projects for deferral, and those I'll cover on the coming slides. So first are the recommended uses of one-time. Again, these are derived from previously established set-asides. We're seeking board approval on the list here. To cover that again, it was the social services funding gap bridge at $3.4 million, the RFCC funding gap at $2.1, replacement of Sheriff Patrol in-car video and computing equipment, $925,000, upgrade of the jail management system at $578,000, covering co-response deputies half-year grant as that drops off in December, $166,000, as well as a district attorney victim witness funding gap bridge, $142. Those total $7.3 million. And I will pause here.
So Chair, we can go through the rest, which is going over the 3 items we're requesting direction, or we can pause at each one and wait for your board's deliberation, if you'd like.
Yeah, I just want to just double check that we want to keep going here and finish or come back Thursday. We want to keep going? Okay, just wanted to, just.
Then I
Okay.
would request if you could deliberate on this, and we're requesting approval of this list, or if there's anything you would want to pull off.
So, okay, so the first task of deliberation would be the CEO's recommended uses of one-time funds. And does anyone have any comments or questions about this list?
Are you talking about the recommended use of one-time funds?
Yes.
Well, let's have a discussion about the replacement of the sheriff's patrolling car vehicle equipment, because I remember you brought it up the other day. I want to get your thoughts on it.
Yeah, thanks. I just, again, it's quite a bit of money. Of course, it's needed, but I wasn't sort of, I didn't have a full picture of why it's needed this year with such a crunch. It's tightening elsewhere. We just spent about $1.3 million about 5 years ago on this system. I was told that they're not broken. So I would recommend that we do a little more checking in on that, and perhaps we table that decision until June.
I agree with you.
So Supervisors, at least 2 of you are asking that because we won't include it in the recommended budget, and we'll come back for discussion in June. You can see if you want to defer it further beyond June, or if you want to include it in June. So if there's direction from 3 of you at least, we could do that.
I'm interested in hearing what the opportunity cost is to waiting a year on this or not. We're going to defer. We're obviously going to be, or not, obviously, we have to decide on deferring other expenses as well. So I think, this, if you're looking at any of these that might be pulled off to be looked at for a second one, and if it isn't a huge risk to us after a year, it might be worth deferring this one. I don't know, but I need more information before I'd be comfortable one way or the other, and I'm okay with bringing that back.
I'm sorry, you said you'd be okay with bringing it back?
Yeah, I'm okay with bringing it back.
In June?
In June, yeah.
Okay, great.
Because I need more information. I don't think I can say whether I'm okay with deferring it another year. I could be convinced that this is an urgent need, but I don't have that information yet.
Yep.
Okay. So thank you, board members. We will include everything on this one-time list into the recommended budget, except for the replacement of the in-car video, and we will revisit that in June at the hearings. Thank you.
And if I could just, the other comment I have on this, and it's just, it's more editorialization, is the dispatch funding gap. And I just, there's just a disappointment there. I think that exists, and I think that's partly because of the contract that we signed. And, if there's any other way for us to find ways to trim that up in the future, I don't know if there's working with some other partners that are supposed to be investors there. I don't know if that's still on the table. It's just a big gap there that we're having to eat. And we're looking at that for at least the next 4 years. That's really an $8 million gap that we're looking at, and that's really hard to take in the scheme of things. And so I know we have to do it. We got to get that thing open, and we are the safety net. Where the rubber meets the road, but that is a really hard number there to stomach for me. And I just, again, editorialization, and if there are options next year to look at ways of closing that gap, I am very interested.
Supervisor Nelson, through the chair, I will say on that one, a transfer from 990 from general county programs, we won't actualize until the end of the actual fiscal year, so it'll be June of next year. We're appropriate it with your direction here, but continue to work with the fire department, over the year and look at how the operations are going, and if there are ways to, find other revenues and other things, we don't have to transfer all of that money if they're able to balance by the end of the year.
Thank you. And I'll just add, I'm fine with, we certainly asked a lot of questions related to the management system of the jail upgrade. I'm fine including it with this list, but I do have a level of discomfort. I want to have a better sense of the data related to our jail. I'll just keep saying that. I'll be polite and professional about it, but I didn't like making a decision on expansion of the jail without having firm numbers and hearing from advocates and hearing from other criminal justice partners that we still don't really have a handle on how many people have mental illnesses, how many people are there, and making sure that a system we're now putting in close to $600,000 on management. Of course, it sounds as though we do need that, but I want to make sure it's as much as legally possible, the system will help with the other departments. And I didn't quite hear assurance. I also had an issue with the fact that it was stated that the previous system that's being upgraded, by the time it was implemented, it was already outdated. That, as someone whose job is to be fiscally responsible up here, that did not bode well. Maybe it was a miscommunication, and I'd be welcome to be clarified on that point, but that was not a high point of this budget hearing for me. So reluctantly, I'll be fine with including that on this list. Any others? Supervisor Lavanio.
I'm good with the list, Madam Chair. I agree. I think I have requested some things from the Sheriff's Office about who is in jail.
Yeah.
And I think I think some of it is, I got a big binder and there's just chock full of information. But that is something we got to get a better handle on I know I can go through and say, I don't want the names, obviously, but you can see what charge they're in for. But even then, it's weird because it's so complicated. Every person in there has a story, right? And we do need more hearings on that, though, to get more familiar with the lingo and how they present it. But I'm for. I'd like to see more technology. I think is better, gives us a better feel for it. But I'm okay with this right now. But I share your concerns on that issue.
Okay. All right, so it sounds as though, is that enough direction for those?
Yes, because we'll be included in the recommended budget, except for that one item. Thank you. The next one is on cannabis, and so we were asking the board, as we demonstrated, we expect a $1.2 million deficit between the revenue we receive, the cannabis tax revenue, and the ongoing expenditures. So we're asking, one, do you want us to balance that budget for the recommended budget or wait a year? And if you are going to balance it, for this recommended budget, are there particular programs you would like us to look at?
Yeah, Supervisor Levin.
Okay, thank you. And I want this to be, I think the CEO's office is probably the best place to come back and make a recommendation on this, but we're spending $3.3 million on enforcement throughout all of our different, through council, DA's office, sheriff, ag commissioner, P&D. I think that's way more than anybody else is spending. I totally supported a very robust enforcement system up front because we had a lot of rogue grows in the Cuyama area. We had them in what am I thinking? The place I got rid of. Tepesquay Canyon. I didn't get rid of it. It got drawn out of my district. Okay. Sabata Canyon. I got all the cannabis out of there. I don't know. I'm good.
We're on our 9th hour.
Yeah, we're on our 9th hour. I'm sorry. I'm slipping. It's being a boomer, right? I'm hitting my level. I just like you to come back with a recommendation and say, okay, I don't want it to be board directed because then it's going to come with a lot of baggage attached to it. I don't know what the right level is. I think we've overdone it at this point. If I saw the other part of it is, if I saw a lot of hay being made, then yeah, okay, we're prosecuting these people and we're getting convictions. I just don't see a lot of that. I think a lot of what they're doing is more compliance And I'm not really sure that that's the best tool we're using in the toolbox to get what we want out of this. So, if more goes into education or more goes into wherever it needs to go, I just think I'm just not sure we're getting the bang for the buck there.
Supervisor Hartman.
Oh, well, you give us a choice of, do we do it now or do we hold it off? I want to do it now.
Rip the Band-Aid. Okay, well, I don't want to, I don't know what the level is, though.
I'm sorry, I meant the choice on whether we want to status quo.
Oh, I see what you're
Or whether
saying.
this year we want to, and I think it's important that we bite the bullet and do it this year. I think
yeah.
your recommendation of having
Okay.
staff come back is a good one. I just wanted to add that in terms of the education, I would think we could combine and get some advice about public health and Be Well. We don't need both of them. It would be similar education. Maybe we're getting duplicative administrative costs, so I think we could realize a small efficiency there as well.
Yeah, I agree with biting the bullet on the cannabis program now. My hope and vision is that with the choices that this board has made just recently with odor control, that just a lot of work, incoming work, will reduce. That's my optimism with appeals, et cetera. So I defer to you, CEO Miyasato, but I would see a someday where it's not a division in your office. I don't know when that comes or where that would be, but to me it's outsized in terms of the impact on people's lives throughout the rest of the county, excuse me. So anyway, I'm definitely for the recommendation of reconciling that budget gap this year. Supervisor Nelson.
Yep, I concur. I think we're starting to spend our reserves here, and I think if we defer another year, we're going to be in. It might even be even worse. We have to right this ship with this industry. This is definitely still one of the down times, and still having difficulties with tax collection and operations, and just trying to find the right fit. I'm with Supervisor Lavin, that this seems a little overly robust. And again, if I thought we were getting, cannabis, out of our high schools and things like that I'm seeing in our community, then I would say this is money well spent. Again, I haven't seen that, and so without some other information, I would be in favor of reducing the enforcement costs.
Thank you, board members. So our plan to return before the June budget adoption with an item for you to discuss. We're hoping there's enough time to do that. Maybe June 3rd. We'll work with the departments in the meantime so that we can present a recommendation to you in early June and then have it ready for the budget adoption. Okay, thank you for that. Go ahead.
So the final item we were seeking specific board direction on is deferral of some of the CIP projects that were discussed in March. What we see here is recommended funding for $4.92 million worth of those projects. That includes the $200,000 arts funding, the Kyriel Water Loop, $1.5 million, Clark Avenue, $1.24, Sheriff Annex temporary relocation, $1 million, and then Parks repaving program, just under $1 million. The remaining 5.08, our recommendation is to set that aside towards a Northern Branch Jail construction. I have on the next slide the projects that would be deferred until future funding is available. And I believe ACO Horton is here as well to discuss if you have questions on the selection process and how the projects were selected.
And while he's coming up, I do want to mention that we are talking about deferral, not elimination from the list. And we're saying deferral because we need now until closing of the year and probably early next year for us to look at all the pots of funds we have. As we've said, our goal would be to reduce the actual construction cost of the Northern Branch Jail. It's over $160 million. And so we would like to reduce as much of it as possible so that we're not faced with ongoing debt service of $12 million annually for the next 30 years. So what we're saying is that we're looking at all the pots of funds, and so we will see where we are come next year, this time of year, and talk to the board about what we've discovered, what we can put towards the Northern Branch Jail, and what we could still fund on one-time uses. And so this, again, this is not, removing these is just a deferral until we have better information. So, Mr. Horton?
Thank you, CEO Miyasato. Yes, as CEO indicated, our goal was to defer as much as we could in order to avoid debt service. However, we are recommending moving forward with approximately $5 million worth of projects because of the nature of the projects. CEO's office worked with CSD, General Services, and Public Works on this final list of the projects we're recommending moving forward. Would you like me to go through the 4 recommended projects?
Do you have any questions about any of these that we are recommending to continue to put in the budget for next year?
Oh. I have a question about one of the ones we're deferring. Is that okay to ask about? So the DA's security system improvements in the juvenile area, that's what I'm worried about. I mean, talk to me about how we can defer that if it's a safety issue, and I've seen that it's a safety issue, yeah.
So my understanding is the DA's, their office is already behind a secure perimeter in the courts. So by deferring a year of what that office, what that project entails, it's some safety glass installation, some installing video in front of their reception area, and reconfiguring their reception area. So as CEO Miyasato stated, we aren't looking at getting rid of this project, just deferring it for a year and then reevaluating.
Okay. Is it okay if I ask DA Savernock a question?
Sure.
Okay. So I know it's going to be really hard for you because you've got employees working there. So you're kind of in the same position I am. Just kind of make me, how are you taking this? Obviously, it's not easy.
I absolutely understand the tough choices that this board are making. I am a little concerned that given the nature of some of the juvenile crimes that we're seeing, certainly those that actually get to an adjudication are particularly violent, and there is, I saw better security in the mid-'80s in downtown Milwaukee gas stations than we have with the glass in the entryway security there. So I am concerned. Anytime you mention public safety, the other deferral, may have structural problems. The downtown building's going to look silly, half painted, but you know what? We have tough choices to make. In that this is a safety, I wonder if there is something we could do with the hardening. I understand the cameras and everything else, but certainly the safety glass, it's a pretty easy reach under right now.
Okay, thank you very much. So personally for me, that's the one that jumps out to me that I would just like to get a little bit better. It's $200,000. I know we're looking for everything we can get. I just like to see if there's something else we could do. And I don't need to make the decision today, but between now and June, just trying to figure out what can be done to, secure that area a little bit better.
Supervisor, through the chair, we're just looking right now at the fund balances for the department. And we can work with the department. We see an asset forfeiture balance of over $300,000 that maybe could be used in the DA's budget, so we could find out if that's an appropriate use. General Services also gets an allocation just for security improvements, and my assumption is that they're using it for other things, maybe from past CIPs, so we'll work with them.
Okay.
But we can look at that between now and June.
I appreciate that. Okay, thank you.
Good. Supervisor Nelson.
Yes, thank you, Chair Capps. And so, one of the things that's difficult, as I've mentioned before, is representing so many different communities that are unincorporated, and all of them have their own needs. And, This is what I try to explain to people. It's not just the 5 of us, that we have these things that we want to advocate for, but it's also, we have all these other county-wide concerns and trying to advocate for a specific community that wants to be the most important thing, because that's where they live. It's hard to be up here negotiating what's most important. And so I was looking forward to this CIP list because I had a few more projects than normally in my district. One of them that's on the list to move forward is the Clark Avenue parking hardscape improvement. I'm going to advocate for that to stay on that recommended list, in part because it's also leveraging other dollars to do a bigger project. So it's really important that that's there this year, or else it's going to end up costing us more in the future to actually bring 2 projects together. So I really appreciate the Public Works Director and the CEO's office for keeping that as a high priority on there. The one that I do want to advocate a little bit more for is the Vandenberg Village Park. And that's I'm not the master of PR, maybe like Chair Capps is sometimes, but today in the Santa Maria Times was an article that said Vandenberg Village Park project closer to reality after more than a decade of effort, speaking about this exact allocation. And so it was out today in the Santa Maria Times. They must be reading our agendas, and they were excited about this. And so those funds are leveraging another $400,000 to move this project forward. It's been over a decade. I don't need a yes today, but I would just ask that CO staff look between now and June to see if there's a way to be able to keep it on next year's budget, or maybe to phase it in over the next fiscal year, maybe initially with some of those development impact fees, but then to kind of become behind it. I think that's what the issue is on allocating those dollars, is you don't want to get started and then have to stop again. And that's why having some type of commitment to that would help them get off the ground. A lot of those other funds associated with this park had been by community funds, and that's something that I try to take to heart, is that I don't always come here asking for money. I usually try to bring money and try to leverage it. And this is one of those projects that we're trying to leverage to get more done in our unincorporated communities. So I just would like to have that highlighted as something that the CEO's office continue to look at between now and June.
We can, Supervisor, and thank you for that. I mean, we did this quickly, as you know, because we need to shore up what's going to go in the recommended budget. We did notice that remember a few years ago, you guys set aside money, was it cannabis money? It was initially cannabis money for open space improvements for North County and South County, so I believe there still is a balance in North County, so that if that's a high priority of that fund, we can use it for that, or we can recommend that come June.
Okay. No, I'm definitely, that'd be a great pot to talk about. So yeah, between now and June, let's look at those funds, and interested in keeping that on the list.
Good. Okay. Supervisor Hartman.
Well, this is where our decision really starts to bite.
Yeah.
And hurt, and this is only the start. But I agree with what the CEO is telling us, that we really need to tighten up. I mean, it's opportunity costs, things we can't do, but we've got to reduce the interest payment to help people in the future. And this board has been very responsible, very prudent, and I think we've got to do our best to continue on that path. I just wanted to add the net zero energy direction. I'm not sure if this is the section, but we haven't had it come up formally.
We do have a section after this about additional board input and direction. So if we could just finish up this conversation, then we can get into that, Supervisor.
Okay.
So what we're hearing is for capital projects, we will go ahead and defer these. We will look, go back to the other list, Paul, that these are the ones we will put in the recommended budget for capital. We will come back to the board on the DA's office security system improvements and the Vandenberg Village to see if there's other funding that we could use. We'll come back in June with those. Okay, thank you.
Yeah, and I just stating the obvious, it's hard to make these deferments, but everyone's doing their best to make sure we don't have to make bigger cuts down the road. So, okay, Supervisor Lee, did you have a?
I do. My input, Project Pet Safe. I really want that to get into this June's budget. If you could look into where we can find the money to fund that one-time funding, because it will pay for itself. It will help a lot of animals in the shelters. That's much needed. So I'm advocating for that. This is the hill I'm die on, so come on this ride with me. So
We would have to look for trade-offs in the department's budget, or unless the board had other places you'd want us to look. My concern is there's a lot of needs departments didn't even advocate or vocalize this week because they all recognize the situation you're in. If this is a priority, then I'd like direction from the board to look for alternatives for that program.
Yeah, it's hard. Of course, I'm supportive of it, but I do want to acknowledge that all the departments were really disciplined, most of the departments, to not make these specific requests. And so that's the only thing I'm trying to balance. I know this is your first budget hearing, and it's not the best one because there's so little room for anything. I do appreciate that it's upfront costs and then it will start to pay for itself, but I'm not sure where those upfront costs will come from.
Right, as they were giving their presentation, of course, I'm a big fan of animal services, and I am a foster parent, as many of you know from many of Lee Heller's foster dogs. The only thing I could think of, and if you want me to look in this place, was before Supervisor Capps and Supervisor Lee were on the board, when we did our animal service contracts, we are subsidizing the cities. I don't know if you remember that. Over when Dr. Del Reynoso came in, we said we're having 5-year contracts, I believe, and I believe at that time we said we were going to do a phase-in, but subsidize them with local funds. So we could look at that and try to renegotiate contracts to see if we can get that revenue.
Yeah, all I'm asking is just try and
Okay.
next time bring more puppies. I think that's
More puppies.
that's gonna work.
Supervisor Hartman, did you have a point?
The risk in asking the cities to pay more is that they'll opt out of the system, and that'll be not good for the animals. In my belief, it's better to have a coherent system run by the county. And I think it courts a lot of difficulties. So if I had to choose between the two, I want to keep the cities on board.
Did you have a thought, Supervisor Nelson?
I had a thought, yeah. It's been advertised to this board that it will pay for itself, and it seems that there needs to be some kind of proof of concept. So, I would just suggest maybe when looking at it between now and June, is there a way to use maybe extra help to do some small pilot project to see if it actually creates the revenue that it can sustain itself? Give that a 3 or 6 month, is it really creating the revenue? Instead of actually hiring up an entire position there, that might prove itself out. And if it really does bring in that revenue and it's ongoing, then maybe there's, next fiscal year, that there's an opportunity there to then, actually bring a staff member on because those dollars are there.
Supervisor, through the chair, I believe that's what, believe the department said they wanted to look at the numbers and do a cost-benefit analysis. So we can ask them to do that and bring something back to the board.
Okay, so do you have what you need? Is there 3 for that to at least explore it for June? Okay, all 5 then, we got that.
So we will do an exploration of what's feasible.
Options,
And options, and bring it back to you in June.
Great.
Thank you.
Okay, now we're, let's see.
Chair Cap, so these other 2 items that we have on here are just additional input we heard from the board over the course of the workshop. We had a lot of questions. There's specific things, work with departments to follow up with board members that ask things, but these 2 specifically we heard return in 6 months with an update from the County Data Sharing Committee on Criminal Justice Data Sharing, and then for General Services to return with an administrative agenda item on the Northern Branch Jail net zero energy options.
Great. I just want to clarify, since I serve on the CCP, there was also direction related to our Northern Branch jail expansion to have the CCP handle a needs assessment. So I want to make sure I understand which lane, if this is the same thing when it comes to population and making sure we have data. Thank you.
Chair Capps, Tanya Heitman, ACO. I actually chair the Santa Barbara County Data Sharing Committee, and I believe that the discussion earlier was on having the CCP do it. So the Data Sharing Committee would certainly help create the sharing infrastructure and operationalize it, but it is the CCP, that was my understanding, would actually do the analysis behind it and bring the work back to the board.
That's great. I just want to make sure that you all have clarity on who's doing what and what body is bringing something back in 6 months.
We could certainly consider it a joint effort.
Chief Benton, did you want to add something there?
Just to Chair Capps, just to follow up on that, we have had some discussion already about how we can make this happen. The CCP work group is already starting to work on those data points, so we anticipate doing a joint effort in bringing this back to your board.
Okay, so the direction is clear.
Yes.
And we're all fine. Okay, thank you. That's reassuring. And then Supervisor Hartman, you brought up the zero net energy options, just making sure our direction is clear.
Yeah, and I think it is. But then I had an additional one that I don't see. We haven't had an opportunity to talk about it. I'm not sure if it fits here or not, but I've been talking about cross-agency compliance collaboration and whether there are any efficiencies as we look to, for example, the Hot Springs Trail. We just had the sheriff, but over long run, what are we going to do there? The homeless encampments that have been cleared, how do we monitor and patrol and guide people to other places? That perhaps cannabis odor control, I'm not sure, but I think that I just wonder if there's, instead of each agency doing different things, and whether there's some opportunity to pull it together. I know that other counties are organized differently, so it's easier for them to do that kind of thing, but I nonetheless think it might be possible and would just like some further exploration of that, because I think that it would, enforcement, as you're looking quizzically, Supervisor Nelson, but enforcement is always the issue. Compliance is always the issue. So I'm trying to figure out, are there other ways we can approach it? Pop-up restaurants on the streets are another example. What can we do to make the most of our compliance authorities?
Supervisor, through the chair, you have brought this up with me individually, and you've mentioned it at many board hearings. And I think you're trying to figure out what can we do to improve our enforcement efforts. And I think when we have particular items, so like the issue in Santa Maria on the riverbed, or even now the task force on the vending, the street vending, I think that bringing groups together for those particular items, I think that's how we've been doing it. We can talk about what are the top initiatives you would like us to look at in enforcement. I mean, there's enforcement in every department almost. I mean, everyone is a regular, everyone does enforcement, and we can come back with different options, but I think the issue is what can departments do within their budgets for these high priority issues. And I think you've mentioned the vending, which we've already known, homeless enforcement. I think cannabis is on its own trajectory, but we can talk about what other types of things you might be looking for. I've asked Mr. ECO Horton in the past to figure out what else we can do. We've looked at other counties, and as you said, some counties just organize differently because their planning department is part of a larger agency that includes environmental health, et cetera. That's not how we're organized here, but that doesn't mean we don't collaborate and work with each other. So we can definitely come back with different options for people's work plans on how we could organize better on these particular issues for enforcement.
Excuse me, Hot Springs Trail, or, I think fire prevention is going to be another key that people aren't in the front country, not just at the Hot Springs Trail, but overall, staying overnight, starting fires, campfires where they're not allowed, that kind of thing.
We can do that, and as like everything, it's going to be a trade-off. Either it's going to be an articulated trade-off or just something that they recognize throughout the year. But if these are the most important things, we can certainly try to tackle them and work with the departments to see what we can do.
I'd just like to comment on that.
Sure, Supervisor Nelson.
And enforcement is the issue, but I mean, we got to start with actually doing the enforcement. That's the issue that I keep struggling with, is that we know it's a problem and we should probably go enforce that, but we often don't. And so it's a prioritization of some of these departments, whether it's the sheriff's department or environmental health, to make that a priority. You know, is it a priority to go and inspect tattoo parlors, or is it to deal with roadside vending? I mean, you move your assets to the place that with the most, heat. And I don't know if, some of our organizations are getting the signals from us at the board going, hey, these are our highest priorities. I think, even the homeless space with the riverbed cleanup, that had to be the top priority for community services for up in the North County for them to do that. And so it's really a prioritization. And I think some of these departments hear that and address that, and some of them don't. And I think we need to keep hammering on those who already have powers to enforce to actually initially do that. If that doesn't work, then we can create a new system. But I would rather start with the existing laws, existing rules. If we're trying to force those and they don't work, then we can try something else. But I'm not satisfied with some of these things that we're doing everything that we can under our existing authority and our existing resources. And that's what I feel like needs to be exhausted first before we create new systems.
Yeah, I hear what you're saying. I think what happens is we resort to law enforcement, which is one of the most expensive compliance strategies we have. And I think there are other ways we could go about it that might save money and be a softer touch on the community. And I think perhaps a more effective way to go about it. So I have seen this in other contexts where agencies do get together and they find that they can leverage their authority and downshift the level of person who has to be involved. And I'm just asking to have that explored.
And I support downshift because I don't want it's expensive, but it's also the most effective. And I think what we saw in the riverbed was we went in with the law enforcement on the initial, and then now we're going to actually have like a park ranger monitor it. So
Right.
I think because we've let these things defer for so long, they've persisted to an uncontrollable amount of enforcement, and now we actually have to go heavy. And that's maybe bad on us. Maybe we would have gone heavy, initially and hit them quickly. They wouldn't have persisted to the way that they have, whether that's roadside vending or that's homeless. But when we don't, we have to go use that hammer of enforcement, and then I think we can downgrade from there. But again, those are just my editorialization of it.
Supervisor through the chair, I think what you're saying is all right. I mean, it makes sense. The one thing I just want to point out to you that's come up regarding EHS is that, and Supervisor Nelson pinpointed it, it's for the sheriff, they're paid to do that. And so some of your departments, they are funded by fees. And so there's not a lot of slack in their budget for their staff to be doing these things. And they've been able to absorb it to some degree heretofore, but things are getting it tighter. And they're being mindful of also fee increases, although I know that's always a controversy with the board. So for some of our departments, there is a willingness, but trying to figure out how to do it, given our existing fees. And the flip side, if I look at other departments, I look at other counties, they're going to say, well, they have more general fund. Well, we just talked about where all our general fund is going. So that's the stress and the strain that we have. I think we will look at what Supervisor Nelson is saying about what our ordinance says, what we can do. But eventually, I'm going to tell you right now, it's going to probably come to money at some point for some of these departments. And we'll try to do the best that we can, leverage each other's talents, et cetera. But we could all do a better job at just hammering and saying we want it without either prioritization or figuring other funding sources is where it breaks down. But we can certainly look at it and look at different options.
And I just had, are there any more issues? Because I had a closing comment.
I don't, are there any more issues?
No, they just recommended actions and the conclusion that after we get your input, we will put together the recommended budget, and we'll get that out at the end of May, and the final budget hearings are in June.
Okay.
Well, I just wanted to say that I'm really proud of this board and how we've tried to set money aside so that we're ready for situations like we find ourselves in. I mean, there's, the costs are going up faster than our general fund and or even our state and federal money. So we've got that, and then we've got to sock away money for the for the upcoming construction at the Northern Branch Jail. So we're really in a difficult situation, but we've worked really hard to weather this storm. I was really impressed by the various departments and the innovations that they describe. And I just wonder if a suggestion for next year's budget would be to ask each department to come in not only with their quote, but their innovation. Because it really is heartening to me how much creativity there is. And the parenting court knocked my socks off, obviously, but I had seen from Public Works that debris catchment, and that happened to be in my district, and that prevented a lot of downstream problems. So we have examples like that, and the process improvements that P&D is doing, and the READY program and Public Defender. Anyway, I think it would just continue the culture of innovation, and it is really tough times, and so we've got to innovate. Some of the AI work that people are thinking about. So just a suggestion for next year.
Good one. Thank you. Other comments? Supervisor Lavanino.
Thank you, Madam Chair. Well, I was telling Supervisor Lee, this is first one. I said, these are easy when there's no money. I think the hardest budget we had was when we had a big surplus and we were trying to figure out what our priorities were and who was going to share in that. Probably the hardest one, though, was when we had so many cuts. So this is status quo budget. I think we all came in here and we said we were going to eliminate the status quo, but that's not what this is about. This is, looking at a 5-year forecast, and I think our CEO's office has done an amazing job of kind of reining in the wants and the whims of whatever board members are up here and saying, look, this year is okay, next year's okay, 3, 4, and 5 we have issues in. And instead of spending the money that we have today, putting it away so that we continue to maintain a level. I think Governor Jerry Brown was really good at this. He always said, hey, quit trying to, when we get a surplus, quit trying to increase your programs because then we just have to cut them later. Let's do what we do the best that we can do it with what we have. Plus, not only is society instant gratification that if we have a little bit of extra money, let's spend it, but as elected officials, that's the first thing you want to do because you have, the inclination is to create a new program or to come up with some new idea. So I just want to thank Mona, her team. This is, ever since I've been here, we've just really been on a smart but fiscally prudent path. And it does kind of go against the grain of what elected officials want to do. So it's not easy, and I appreciate all those that are on this board and the ones that came before us that put this together. I also just want to say that I don't like to rank department heads, but as a team, I got to say this is the best group that we've had since I've been around. I mean, just top to bottom across the board. The innovations that Joan was talking about that everybody's discussing, open to new ideas, which always wasn't the case. And I didn't have one department head come to me kind of backdooring and trying to work something out on the budget, which is really good because we're all working together as a team. Not easy to do. And it's hard because I know you all have employees and you all have middle managers that are saying, we have to have this, we need this. It's just not going to happen this time. But as much as we say it's really difficult financial times, I just want us to look around, and I think Mona put up some headlines from other areas. We've been extremely lucky, and some of that has to do with decisions that were made. Some of it has to do with the fact that we rely heavily on property tax, and Santa Barbara County is pretty awesome when it comes to property tax because it always maintains Montecito and Hope Ranch always come through for us. So I'm not overly excited about this budget, but it is what it is, and we're just going to keep doing the best we can with what we have.
Well said. Supervisor Nelson.
Yes, thank you, Chair Capps. And I want to add to the chorus of appreciation for the CEO and the budget director for a well-balanced budget. There's been a lot of talk in the news about our county and, about us and, about those raises and when you're running the county into the ground that we're bankrupt. And that's just simply untrue. And I've been trying to make sure I get that message out there, especially among people that might have a similar political bent that I do, that no, this county is actually really well run. We did Doge a long time ago here. We don't get to print our own money here. So, we've had to have a balanced budget. Not only do we have a balanced budget, we're going to have a $47 million strategic reserve and a contingency reserve and emerging issues reserve. I mean, we are super prepared here. And again, that is definitely the foresight of a budget team, but it's also the discipline of the departments and the board today and in the past. We saw it on some of our slides here. We are going to be one of the first jurisdictions in the state to pay down the pension debt down to something that's more manageable, to have a fully funded pension in our lifetime, and maybe not on this term, but maybe the next one if I'm lucky enough to be here for that. And that's really exciting. And again, that happens because of discipline, and that creates future opportunities. And I also want to show my appreciation for the budget team, that they're not counting on that as a future, rainbow issue, right? It'd be really easy for them to say, hey, we got to do this jail, but we're just going to defer all that until the pension thing maybe works out. But they're not taking that for granted, right? I mean, we don't know what happens with markets. We've seen them be very volatile just in the last couple of weeks. And so there's no promise of what the future entails. So it's really important for us to think strategically and fiscally conservative. And I think this board has shown that over and over again. One of my final comments would be about, I was actually looking at the board acquired reforms, and Supervisor Capps has this one about percentage of expenditures being spent on adult detention. And, you can derive a lot from that. We spend more as a percentage than a lot of the other jurisdictions that are our comparable jurisdictions, like Monterey, Ventura, Sonoma, others. And that's, I know that we're kind of concerned, maybe we're spending too much, but the other issue about that is we're not making enough money. And I think that's something that we need to be doing in our county is we still do have a culture that makes it difficult for businesses to thrive here. And, my questions to planning were around that, because I think we need to embrace that. I mean, I think there's opportunities every day for us to push projects along that are going to produce, triple threat opportunities like TOT, sales tax, and property tax. And, past generations of the board said we don't want to fiscalize our land use, but you know what? Fiscalizing our land use also creates economic opportunities for our residents so they can have jobs, so they can be employed. I mean, there's a lot of better things than just, tax revenue is a nice piece of it, but it actually raises the whole entire community. And so, I hope this board continues to put some emphasis on that. And I'm going to be, over the next year, finding ways to cut through some of the red tape and try to get things done so that we can, instead of just planning for future projects, that we actually do future projects and get things to break ground. Because I think with those opportunities, we will be able to have the difficult decision on how to spend the money. And that'd be a nice luxury to have. And so I'm looking forward to those days. But for now, I'm committed to the plan that this board has laid forth for our budget staff between now and June.
Thank you. Did you have anything to say? Okay, I'll just wrap us up here. And I want to say to Supervisor Lavin, I think status quo is actually going against the grain because if you just look around what's happening in different levels of government, I won't get political here, but there's a lot of chaos, there's a lot of confusion, the markets, and here we are sort of plodding along, making prudent decisions, getting along up here, not a lot of vitriol like I've experienced at a different job I had not too long ago. And I just want to, acknowledge that, and that we're steady is important right now for people. There's a lot of unsteadiness in the world, in their lives. It was a very sobering conversation, some of the departmental presentations, social services in particular, mental health, 50 new laws coming down the pike. So I think the fact that we're steady and consistent is the exact kind of status quo contrast that we need to be providing for people. And since I have the eyes of all the department directors here, I just want to make another pitch that we are here to help you earn and keep that trust with the people. So I would love to be asked to do more when it comes to outreach about a program, enforcement rules, feedback about a new, I don't know, just understand that I view our offices, and we saw, our budget, et cetera, with our teams as your outreach arm for the goals and the priorities that you have. And I said this as when I became chair of this board, it's so important right now that we keep and earn that trust with the people we serve on a daily basis. And that responsibility is mostly on us. It's definitely on you all and all of the thousands of people that aren't here that are represented by you. But I feel that very gravely and would love to be called upon to maintain that, because again, the contrast of protecting our democracy, delivering services right now that are potentially unsteady from other levels of government is incredibly important. So thanks for a good process. Supervisor Lee, you've now had your first budget workshops, and I think we're all in consensus on the direction moving forward. And again, just thanks to our budget team for setting us up so well for success today and Monday. Okay, we do need a motion though.
Yeah, do you want to bring it up on the screen again, the recommended actions? Oh, still there? There, okay. So I'll go ahead and make the recommended action with the staff, or with the comments that were made by the board for this various topic items, and that this is not an item under, project under CEQA. That motion.
Second.
Okay, we have a motion on the floor. We have a second. All those in favor, please say aye.
Aye.
Aye. Motion carries, and we are adjourned. Oh, yeah, to note for the record, there's been no public comment on general.
And no meeting tomorrow.
And no meeting tomorrow. And yeah, no general public comment. And when do we next meet? May 6th. Wow. Thank you.